844-330-2020. 844-330-2020. And otherwise, if you have it, it's been mailed to you, and it's sitting there on your kitchen counter, maybe you can dust it off, fill it out, send it in. We have till October 30th, the end of October 31st, I believe it is, though there's efforts, again, to deny that sooner. But we have just a number of weeks left, and want to encourage all of you to fill out this census. And speaking of number of weeks left, well, number of weeks before we move into the peak of our flu season. Flu season, you'll tend to see sort of acuity in terms of the transmission of flu in December, January. Flu seasons are just around the corner. We're even seeing some early signs of flu already. Bottom line, this is about protecting yourself. In order by getting a flu shot, you protect yourself and you mitigate the impact of what some have referred to as the twindemic of a potential second wave of COVID-19 transmissions and the flu happening concurrently, putting stress, putting pressure on our hospital system at the same time, draining resources and impacting the quality care that all of you deserve and expect of our healthcare delivery system. And that's why getting a flu shot is so important. I have done this every single year as long as I can remember. It is a simple thing to do, and getting a flu shot is a safe thing to do. In an effort to demonstrate how simple it is and how safe it is, I thought I would just take advantage of a moment of your time and take the opportunity to get a flu shot here and demonstrate what safely can be done by many of you watching. And I encourage you to do just that. And so I've got my nurse here, my doctor, and I've got the right shirt, which apparently is an issue. So let's roll up the sleeve.
Relax that arm.
All right. I wanted to show my biceps, because of but I can't do that.
Okay, and just relax.
Tell me when you're doing it. It's done.
It's done.
About as simple a thing as any of us can do. So I encourage everybody to get a flu shot. I thank you for this demonstration. And I remind everybody that the flu season is just around the corner. And so I cannot impress upon you more the importance, the power and potency of getting a flu shot, mitigating the spread and transmission of not only the flu, but as well impacting our ability to care for you, your loved ones, members of the community, as it relates to the spread of COVID-19. And so that is broadly where we are this year in terms of update, or rather this week in terms of an update. You can see additional information here on this slide of purpose of preventing the transmission of flu and the broader construct of helping all Californians stay healthy. We encourage you to do the same. As always, we end by reminding you of the power and potency of addressing not only the issue of the flu, but addressing transmission of COVID-19 of wearing a mask. It's an interesting point that in the southern hemisphere of this country, rather in the world, southern hemisphere, in places like Chile, in places like Australia, in South Africa, they saw a relatively mild flu season because of people's ability to address not only the transmission of COVID-19, but as a consequence, the benefits of doing so by wearing a mask, transmission of the flu. So practicing physical distancing, washing your hands, minimizing mixing, and wearing these masks will also help us with flu season, not just with transmission of COVID-19. So this slide, very familiar to all of you, is even more important in that frame and in light of our pending flu season. So with that, happy to, of course, answer any questions. And again, thank everybody for your time and your attention.
Jeremy White, Politico.
Hey, Governor. Thanks for giving us some time. You have been among many Democrats who have warned about what the impact of a sixth conservative justice on the Supreme Court would be. I was hoping you could talk with a little more specificity about some California policies, particularly parts of your agenda that you fear could be endangered by a sixth conservative justice.
Yeah, I don't want to get too much in the weeds except to say, on social justice, economic justice, environmental justice, broad strokes. I'm very concerned. I'm concerned clearly about tens of millions of people that have pre-existing condition protections because of the ACA, the expansion of the Medicaid system in this country and the impact that could have, millions of people losing the ability to get quality health care as a consequence of the ACA. I'm worried about the environment, the clean air. I'm worried about clean water. I'm worried about the capacity for states like California to continue to lead not just this nation, but lead the world in terms of low carbon green growth. I'm worried broadly about protection of minority communities, the LGBTQ community. I'm worried about a series of issues that obviously present themselves self-evidently as points of concern and points of departure as it relates to precedent, not least of which the impact on Roe v. Wade, the impact on people's freedom of choice, a value we hold dear here in the state of California. And so clearly, those are points of concern. 6-3, ideologically conservative majority could be impactful on all of those issues and more for decades potentially to come. So this is a profound moment in our nation's history. And I know that all of us are anxious, at least those of us that share concerns about the stacking of the court from an ideological bent, and obviously makes this election even more essential and more important.
Adam Beam, Associated Press.
Thank you, Governor. I have two questions. First, while the coronavirus numbers have been improving, Dr. Galley warned last week of an expected increase in cases and a potential 89% jump in hospitalizations in the next month. Now, in some counties, that could mean businesses, again, have to close or restrict services. So what do you say to those business owners who say they can't survive a third shutdown? And secondly, as more schools are now offering classroom instruction, have you and the First Partner decided whether your children will attend school in person?
Well, it depends when the school makes a decision about whether or not they can move in that direction based on concurrence with the county. There are hundreds of schools, I think north of 600 the last I checked, though I'll happily update you on that number, that have received waivers from all over the state of California in elementary schools. My kids, oldest just turned 11, youngest is 4, so we're in that category broadly. But beyond that, I have no update for you as it relates to my specific status and my family. As it relates to the broader issue of transmission, I would say to all the business men and women, I would tell all the entrepreneurs and parents included that we maintain our vigilance. If we continue to practice physical distancing and social distancing, we minimize mixing. If we abide by these mask mandates, then we can substantially address the concerns that you raised in your inquiry, and that's fundamental and foundational. We all need to maintain our vigilance. As we modify, as we make progress, and we are making progress, you will hear Dr. Galley tomorrow update you on the tiered status. Many new counties are moving into new tiers that will allow them to modify with modification to begin to reopen businesses and the like, that we do so safely and we do so with our eyes wide open, that we again are moving into the fall. And so if people can take seriously and not let their guard down, take seriously this moment as we transition through the fall and hopefully into spring, where we have a vaccine and we can turn the page on COVID-19. If we can do everything in our power to mitigate that spread in the course of the next number of weeks and number of months, then we can avoid the example that you just set forth.
Angela Hart, Kaiser Health News.
Thank you, Governor. I'm sorry if there's a little bit of background noise. I just wanted to ask you sort of a bigger picture question on healthcare-related legislation. I understand, even if it's more of a broad question, not necessarily asking about a specific bill. With lots of people losing their healthcare right now, I wonder if there's anything that you're going to do this year from a broad perspective to address some of those challenges legislatively. Is there anything that will help people with coverage or even cost-cutting measures And then kind of looking forward, I also was wondering, similar question, pitching into next year, is there anything realistically on the healthcare cost or expansion effort that will be realistically possible that's on your agenda next year?
Yeah, we're committed to universal health care in the state of California. We made progress to advance the cause of not only physical health this year, but also brain health. New parity bill, package of mental health, substance abuse reforms that I signed just last week as an example of those efforts. We are committed to the long haul of not only reforming our Medicaid system, Medi-Cal here in the state of California through a program called CalAIM into the future. It was delayed because of budgetary constraints this year, but that reform we are committed to advancing over the course of the next few years to reimagine our mental health and physical health financing system, funding system, incentive system, prevention system, a program that we have worked hard to design, and now a program that we look forward to advancing. So we are committed to that cause. I'm already working through the last, few dozen bills that are on my desk ending this legislative session. They have to be done by this Wednesday, but also concurrently working on next year's budget. And healthcare has long been a top priority for me, my administration, and long-term health care is also a frame of concern around issues for seniors as well, not just individuals on the related to our current marketplace, but looking long-term at bringing down the costs of health care and addressing the needs of an aging and graying population. So all of that is on the agenda. All of that we will advance. The question is, where is the economy? The question is, what is our...
So beautiful out here. And thank you for joining us as we announce a massive and groundbreaking expansion in our testing capability for the China virus. And as you know, it's already setting records like nobody's ever seen before. Last week, we crossed a historic milestone when the United States conducted our 100 millionth test, far more than any other country, and not even close, actually. Second seems to be India, with 1.5 billion people, and the numbers would be probably at least 50 million more tests by us. We've conducted more tests than the entire European Union and more than all of Latin America combined. We're thrilled to be joined by Vice President Mike Pence, Secretary of Health and Human Services Alex Azar, Secretary of Education Betsy DeVos, hi Betsy, Administrator for the Centers for Medicine and Medicaid Services, Seema Verma, and Admiral Jawar, who's done such an incredible job. Thank you, Admiral. We're also joined by Mississippi Governor Tate Reeves, had a tremendous victory. We're so proud of you. And as well by Abbott CEO Robert Ford. Robert, thank you very much. Great job. Today, I'm pleased to report that we're announcing our plan to distribute 150 million Abbott rapid point-of-care tests in the coming weeks, very, very soon. This will be more than double the number of tests already performed. And here's our plan. 50 million tests will go to protect the most vulnerable communities, which we've always promised to do, including 18 million for nursing homes, 15 million for assisted living facilities, 10 million for home health and hospice care agencies, and nearly 1 million for historically black colleges and universities, and also tribal nation colleges. 100 million rapid point-of-care tests will be given to states and territories to support efforts to reopen their economies and schools immediately and fast as they can. For example, the support my administration is providing would allow every state to, on a very regular basis, test every teacher who needs it. This continues our critical effort to use testing to protect high-risk communities. These new Abbott rapid point-of-care tests are easy to use and return results within just minutes. You'll have a result at a maximum 15 minutes. No machine is required to process them. So in the old days when we just started this, you remember we'd go out and we'd have to find these massive laboratories with tremendously expensive equipment. Now we're down to something that you'll see that is really from a different planet. I would like to ask Admiral Giroir to come up and demonstrate how these tests are performed. He'll do this very nicely, I think. Good luck. Hope you don't test positive.
So thank you, Mr. President. As of today, the nation has performed over 111 million tests for the virus causing COVID. On 13 separate days, we have achieved tests over 1 million per day, and our average test numbers are now approximately 920,000 per day. We are now at an inflection point in testing. We now have available on average 3 million tests per day, not counting pooled testing, which could multiply that number several-fold. Nearly half of our current tests are rapid point of care. All of the actions of your administration, including aggressive use of multiple titles of the DPA, hundreds of millions of dollars in HHS and DoD investments, and regulatory flexibility, including over 200 FDA emergency use authorizations, CLIA enforcement discretion, and application of the PrEP Act, have led us to this inflection point, which brings us why we're here today. On August 27th, after months of planning and only after 1 day after the FDA authorization, the Trump administration awarded a contract for $760 million to Abbott for the delivery of 150 million of these Abbott BinaxNOW rapid tests. The BinaxNOW detects the presence of the COVID antigen. It uses a specific nasal swab, and that swab comes with the test, and it's made by Puritan. And the reason why Puritan swabs are here is because the administration used the DPA and $120 million in investment to make these swabs able to use by Abbott. It does not require an instrument to determine the result. It's in 15 minutes, the result. Testing may be performed by laboratories with a clear certificate of waiver. This is not a home test. But during the health emergency, CMA and CMS permits laboratories to extend their certificate to operate in temporary sites like schools or churches or parking lots. So though we anticipate that the test will generally be performed by a trained individual on a patient, I will demonstrate a self-swab for you to show you just exactly how easy the test is performed. So literally, it almost could not be easier. It starts with 6 drops of liquid onto this piece of paper. 1, 2, 3, 4, 5, 6. And then there's a nasal swab. And again, this is not the deep brain biopsy that we talk about. This will generally be done by a healthcare provider, but it can be done supervised. It's this easy. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Into the test, twisted 3 times. The adhesive is pulled off, and you wait 15 minutes. And that is the test. It really could not be easier than this. This is a very sophisticated little piece of cardboard with lots of antibodies and incredible technology into that. We've already shipped 65,000 of these to disaster operations in California, Oregon, Texas, and Louisiana, and we have already shipped 2.1 million tests to 7,600 nursing homes, over 900,000 tests to assisted living, 300,000 tests to the Indian Health Service, and 339,000 tests to historically black colleges and universities. Today, we start the shipment of 100 million tests to governors, beginning with a total of 6.5 million tests this week, to be shipped this week. This is in addition to the continuing support to other priorities like nursing homes. Allocation to states and territories is based strictly on their relative population. Governors have the flexibility to use these tests as they deem fit, but we strongly encourage governors to utilize them in settings that are uniquely in need of rapid, low-tech point-of-care tests, like opening and keeping open our K-12 schools, supporting critical infrastructure and first responders, responding to outbreaks specifically in certain demographics or locations, and screening of surveillance in congregate settings. Mr. President, we just completed a briefing to the governors and their state health officials from the sit room, and we heard words like game changer for their states. Thank you, Mr. President, for your leadership and support of all our efforts to defeat this virus.
Thank you very much, Admiral. And let me ask you, Governor Reeves, do you agree? Would you like to say something?
for your leadership through this pandemic and through this crisis. It was said by Republicans and Democrats alike earlier, this is a game changer. In our state of Mississippi, our K-12 schools have been open for 9 weeks. Our institutions of higher learning have been open for about the same. But while we have testing available now at least once a week in every county of our state, what this allocation is going to allow for us is we will have testing available for our K-12 teachers every single day going forward. And the thing that we know is that kids learn, and Secretary DeVos knows this so well, kids learn so much better when they're in the classroom than when they're doing distance learning or a hybrid. And while we have 75 to 80% of our kids back in the classroom, we want to get 100% of our kids back in the classroom. It is also critically important, Mr. President, your decision to allocate on the front end to the historically black colleges and universities means the world to Mississippi. Our larger institutions have the financial resources to provide testing, but in Mississippi with Jackson State University and Alcorn State University and Mississippi Valley State University, 3 of our 8 institutions of higher learning will get an allocation of these tests, and it's going to make a difference. And kids all across our state are going to be better served because of it. And I want to personally thank you on behalf of the residents of Mississippi for doing this, Mr. President. Thank you.
Thank you very much. Thank you, Ted. Great job. In a short period of time, my administration has built the most advanced testing system in the world. There's never been anything like this. When the pandemic struck, there were 0 tests for the China virus, but we've marshaled all of America's resources to achieve these unparalleled capabilities. We slashed red tape and approved emergency use authorizations for 243 type of tests. That's how many tests we have. I invoked the Defense Production Act and related authorities more than 100 times and distributed $171 million to expand testing production. We've done nearly twice as much testing per capita as France, Italy, and Germany, and over 6 times more testing per capita than South Korea. We've done far more than any other country, usually times 2, 3, 4, 5, or 6. We've performed nearly 40 million more tests than India, and by the end of next month, we will have over 100 million tests available in the market. More than half will be point-of-care tests. Those are the quick ones, and they're really the ones that have the best impact, with the results in less than 15 minutes. We've also prioritized resources for the most vulnerable, including nursing home residents. We delivered rapid testing devices to nearly 14,000 certified nursing homes. We opened over 1,000 community testing sites in low-income communities. Nobody could have done this. We invested an unprecedented $8 billion to help tribal communities have the tests and resources they need to combat the virus. And it's important to remember that as younger and healthier people return to work, and as we massively increase testing capacity, we will identify more cases and asymptomatic individuals in low-risk populations. This should not cause undue alarm. The total number of cases is not the full metric of success. Hospitalization capacity and mortality rates are far more instructive metrics. As we do more tests, you're going to have automatically more cases. We are relentlessly focused on protecting the vulnerable while enabling healthy Americans to go back to work. We can do both, as Florida, Arizona, and other states have recently shown. Over the last 8 weeks, hospitalizations have declined by 48%, and they've just reached the lowest point since March. It's a long time ago. Due to advances in treatment, the fatality rate has fallen 85% since April. Our excess mortality has been considerably lower than comparable countries. Excess mortality compares total deaths during a pandemic to what we would be expected in a normal year. This is a critical measurement because it includes undetected China virus deaths along with deaths resulting from lockdowns. And lockdowns can be very harmful. And we have too many states that are locked down right now. The governors are, nobody knows what the governors are doing, actually. Europe has experienced a 50% greater excess mortality rate during the virus than the U.S., and their economic contraction has been far more severe. Under Operation Warp Speed, my administration is on track to deliver a safe and effective vaccine in record time. We're doing very well with the vaccines, as most of you know. 4 vaccines are now in the final stage of trials. The day the vaccine is approved by the FDA, we'll begin distributing it within 24 hours with hundreds of millions of doses to follow very quickly. We're all set to go. We're all ready, and logistically, we have the military lined up, and some incredible people are just waiting to have it. Over 100 million doses will be available before the end of the year. We will defeat the virus, and we will end the pandemic. And next year will be one of the greatest years in our history, and we think it's going to be a very exciting period of time. With that, I'd like to ask Mike to say a few words, because you just left a task force meeting. Vice President Mike Pence.
Thank you, Mr. President. This is a historic day. And other than the day that I believe will come soon, that America produces the first safe and effective vaccine, what's announced today with the distribution of 150 million rapid point-of-care tests all across America is a testament to your leadership, Mr. President. It's a testament to this great team that you've assembled, from Secretary Azar, Admiral Giroir, and others. It's a testament to the partnership that we forge with governors like Governor Reeves all across America. And it's a testament to great companies like Abbott Laboratories and the thousands of employees who, Mr. President, I know have literally worked around the clock since those early days in this pandemic, when you brought in the greatest research companies in America and said that we need medicines known as therapeutics, we need a vaccine for America, but you also challenged them to develop a rapid point-of-care test that could be distributed all across America and enable us to more effectively slow the spread, flatten the curve, protect the vulnerable, and save lives. And Mr. President, today's announcement is really emblematic of the public-private partnership that you forged from the early days of this pandemic. As you said, we met today with the nation's governors. The White House Coronavirus Task Force completed our 38th conference call with America's governors. But all along the way, from our very first meeting, you made it clear that we'd spare no expense of the federal government. The full resources of the federal government you made available to put the health of America first. But you also challenged us, and you challenged American industry to bring the full power and innovation of the American economy to bear on this moment. And whether it be PPE, where we forged a partnership to see to the delivery and the manufacture of hundreds of millions of personal protective equipment, whether it be how we started with 15,000 ventilators in the Strategic National Stockpile, and today in partnership with GE Healthcare, Ford, and General Motors, we have over 150,000 ventilators in the Strategic National Stockpile. Whether it be the extraordinary progress on therapeutics, remdesivir, convalescent plasma that are literally saving lives, or whether it be, as you reflected, Mr. President, on our steady progress toward achieving a safe and effective vaccine before the end of this year. It's been that public-private partnership that you've led that's made these advances possible. And on testing, the American people really deserve to know that when we began, as you said, Mr. President, it was literally a standing start. We didn't have information on the coding of the coronavirus until mid-February. But America's CDC labs and public health labs did their level best. And by the end of February, we'd done less than 10,000 coronavirus tests. But as you just announced a few moments ago, last week we cleared 100 million tests all across the country. It's extraordinary. We have the capacity to do 3 million tests a day. It's a testament to American innovation and the leadership that you've provided. Also, Mr. President, we've delivered to nearly 14,000 nursing homes in America point-of-care tests already that are making it possible for us to really keep focus on the most vulnerable. As you know, only 8% of those who have contracted the coronavirus are in nursing homes, but 40% of those that have lost their life have been in nursing homes. And so we've surged those resources and surged them to vulnerable populations. But with the announcement today of this Abbott Laboratories Buy Next Now test, we began a process first announcing 50 million tests to go to our vulnerable communities, to go to minority communities, to Indian Health Services. But as we told all the nation's governors today, we begin the process this week of distributing 100 million tests to each state and territory in the country free of charge, so they can begin to deploy those tests on the priorities that the state has set. But, Mr. President, given the extraordinary capacity that we have in testing today, we expressed a hope to all the governors today that they would particularly use these Abbott Binax tests to open up America's schools and to keep them open. And we heard about the enthusiasm of governors from both sides of the aisle about what this test will mean in helping to process the testing that will get our kids into school and keep our kids in school. And Mr. President, let me just close by saying we've passed through a challenging time in the life of this nation in 2020, and our hearts, and I know your heart, is with all the families that have suffered loss. But as you said, the cases are declining. Hospitalizations have been declining dramatically, particularly in the Sun Belt. In Louisiana, where not long ago 50 parishes had more than 10% positivity rate, now only 3 parishes are testing positive over 10%. Arizona was testing 20% positivity rate. Now it's less than 4% consistently. But with cases and positivity rising in 10 states, in the Midwest and the Near West, and with this historic advance in testing that's being distributed, 150 strong around the country, Mr. President, the American people should anticipate that cases will rise in the days ahead. But as we more readily identify those who've contracted the coronavirus, the American people can be confident because of this extraordinary and historic public and private partnership that you've forged, because of this whole of government approach. We're ready. As we proved through the outbreak in the Sun Belt this summer, we'll make sure that any community, any state that's impacted with rising cases, any school that's impacted will have the PPE, will have the supplies, will have the medicines. And as you said, Mr. President, we will continue at your direction our relentless drive toward achieving the first safe and effective vaccine, so we can achieve the day that we once and for all put this coronavirus in the past. So, Mr. President, with thanks to our industry partners, thanks to this team, but thanks to you for your strong leadership. I hope for that day, and the American people can be confident. We will not rest, we will not relent until we put this coronavirus in the past.
Thank you very much, Mike. Scott Atlas, would you say a few words, please, as to how we're doing and where you see us going, please?
Okay, thank you, Mr. President. And I also want to echo the congratulations to the team, the task force, Admiral Giroir in particular, who's worked very hard on the testing. This is a remarkable day because we have state-of-the-art testing. This is not the typical point-of-care test even. This is new. This does not require any kind of machine. It's very rapid. And this is not one of those deep swab things that people are reluctant to use. So I think we're really making an advance here to do what testing is supposed to do, and that's to save lives. As the Vice President mentioned, we know that there are areas of the country that have more cases. This is to be expected with more social mingling. And the testing, but particularly protecting the vulnerable, is the key here. We have not seen hospital overcrowding. We're doubling down now with testing to protect vulnerable people, not just inside nursing homes, but in residential settings and senior daycare centers. This is a remarkable advance, and I anticipate that as this virus, as we get toward the end of this pandemic and the vaccine is being developed as quickly as it has been, America will be in a different position. And there really should be, as I've said many times, the fear is not the issue here. We really have a handle on what's going on. We know what to anticipate, and there's remarkable advances being made as we see today. Thank you very much.
Well, thank you very much. Tremendous progress is being made, and I say it, and I'll say it all the time, we're rounding the corner. And very importantly, vaccines are coming, but we're rounding the corner regardless. But vaccines are coming, and they're coming fast. We have 4 great companies already, and it's going to be added to very rapidly. They're in final stages of testing. And from what we're hearing, the results are going to be very extraordinary. So thank you very much. I appreciate it. And thank you very much. Great job by Abbott. Right from the beginning, great job by Abbott. Thank you. Thank you very much, everybody. Thank you.
Financial information.
Well, there you have it. That was President Trump making remarks at the Rose Garden. You're watching News Now from Fox. I'm Daytona Everett. A couple key takeaways from that briefing we had just right there. It was all about coronavirus testing. He said that 50 million tests are going to be going out for the most vulnerable people out there. He also said that we've done far more testing than any other country. These are just key takeaways from that briefing. And they're thinking about wanting to get people back to work. That's been one of his major premises, so highlighted that. Also that the fatality rate is falling by 85%. Also, Operation Warp Speed is the vaccine strategy. They mentioned a little bit about that. VP Pence made an appearance. He was out there talking about his coronavirus task force and some of the strides that they've made. He also mentioned bringing kids back to school. So we're going to stick with the coronavirus vibe right now and head out to Chicago, where they had an update out there as well. Thanks for joining us. You're watching News Now from Fox.
Drinking, you must wear face coverings while seated. Now look, as a person who tries to dine out and support our local businesses, I know that this requirement is a pain in the butt. Let's just be blunt about it. But it is absolutely necessary to protect you, protect other diners, and importantly, protect the workers who are coming to your table. So we said, and we know that this is important, when you are engaging with a service person who comes to your table, whether it's the person bringing you water, checking on how you're doing, or your waiter, you must wear a face covering, engaging with others. That's critically important. And we're encouraging you, when you are not actively eating or drinking and you're just talking to the person that you're dining with, wear a face covering. Because it's not just about you. When you leave, whatever you brought in, whatever you've done during that dining experience stays, and the workers have to clean up, and they're putting themselves at risk. So please wear a face covering while seated when you're not eating or drinking. Second, there will be no walking up to the bar. Breweries, taverns, and bars must have customers seated when eating and drinking and ordering. So I know we're all used to going up to the bar to order whatever it is that we want. That will not be allowed. People will come to your table where you are seated to take your order. Please make sure that you abide by this restriction on bars and taverns. Third, personal services requiring the removal of face masks should be kept under 15 minutes. Now again, I know to get a shave, to get a facial in 15 minutes is a big ask, but it's an ask that we are making, obviously, for public health reasons. And the employees conducting the service must have a face covering on at all times. And I think a lot of the personal services folks are doing a terrific job with this, but we want to make sure that we emphasize this because it's important. And fourth, all places of business should provide hand sanitizer to customers and employees upon entry. Now, a lot of folks are doing a great job with that, but we want to make that practice uniform. That's important. I'm also pleased to say that thanks to our city's partnership with the technology company TOCK, and that's T-O-C-K, which is developed right here in Chicago, more businesses will be able to assist in our city's contract tracing efforts through their reservation system. Through this partnership, TOCK will provide free set setup and a 6-month subscription to Talk Plus Lite to restaurants and bars without reservation systems in areas of our city below 60% of the area median income. What we're trying to do is make sure that when people come into your restaurant, come into your place of business, that there is a way to know who is there and to track them in the event that we need to do a case investigation or contact tracing. This is being done in other parts of the world and other parts of the country. Now we have the ability to bring it right here in Chicago, and we'll talk more about that. This gives technology solutions to businesses in low-income areas that may need these enhanced capabilities simply to survive. This partnership reflects our city's commitment to inclusion and innovation, and will also help further slow the spread of this disease by quickly connecting people with the testing and care that they need should they or someone they know come into contact with COVID-19. Today's new guidelines are the result of the hard work and hard choices our residents, our workers, and our businesses have made to keep our entire city safe. They mean that we as a city are making slow but steady progress in our recovery efforts. But what these new guidelines do not mean is that we are out of the throes of this disease. Not so. Unfortunately, we're seeing states nearby and across the country open up entirely as if COVID-19 has suddenly disappeared. It has not. We continue to see new cases every single day. We continue to see new hospitalizations every single day. And while the number of deaths that we're recording every day has gone down substantially from its peak, people are still dying from COVID-19. So we have to remain diligent in our approach to making sure that we do everything that we can to respond to this horrible, horrible virus. Earlier this summer, we lost progress. Back in August, we saw cases really shoot up. And it's taken us some time and a lot of work on the part of a lot of different folks, including our fearless public health department workers, our community partners, to work to bring the numbers back down. We also heard complaints from workers that were being put in unsafe positions because their employers weren't complying with city guidelines. It's critically important that as we take this next step forward, that all of our workers know that we are here for you, and we will step in to protect you if you do not feel safe in your workplace. And the flip side of that is employers, our expectations is that you are going to do everything you can to keep your workers and members of the public safe from this virus. Many of you got the memo months ago and have done extraordinary and creative things to keep both your workers and members of the public safe. But we need to remain diligent, and we need you to step up and dig down a little bit deeper as we relax some of the restrictions in this next step. Before I close, I really want to, again, thank everybody who's come here today. I want to thank our Department of Public Health for always being diligent, working hard, and being open to conversations with businesses around how we can get to the same place but get there safely. That's very important. We will continue the important dialogue that we've had with residents all across the city, businesses of every type, to make sure that we remain the safest big city, the most open big city, and that we continue to make progress in our continued fight against COVID-19. And at this point, I'll invite Dr. Arwady to the podium to provide further details on where we are as a city. Doctor?
Thank you, Mayor Lightfoot, and good afternoon, everyone. Good afternoon. So my goal today is to talk you through the data. The reason we've made this decision today is absolutely based on the framework that we put forward on June 26th as we moved into phase 4. I know not all of you follow along the reopening guidelines on the website every day like I do, so I wanted at a high level to remind you of what the things are that we're tracking and why we feel confident that we can take this careful step, but also all of the things that we will continue to monitor so that if we start to see trouble, we can pull back. The hope, of course, is that we will continue to build on the progress that we've seen over the last month and be able to continue to take steps forward. But what we outlined here on June 26, and you can find the details on the website, are what we continue to use. So first, I want to highlight that there are 4 things that we track that do not have a number goal on them, but they have to do with whether we're seeing increases, decreases, or things being stable. So that's our case count, which we talk about every day. It's our number of hospitalizations, our number of deaths, and our number of emergency department visits. In the green, this basically means we're seeing stable or decreasing numbers over a particular period of time, and we're able to move ahead. Next is the positivity rate, which I know you've also heard a lot about. And you'll note, to be in the green there, we have to be under 5%. And that one has been hard for us to get to over the last few weeks, but we are there now. And then there's 3 about capacity: hospital system, testing, and response capacity. So I'm going to talk you through each of them. Go ahead. Cases. You all are very used to this graph at this point. This is the cumulative total of all of our new cases. At our peak, we were seeing about 1,000 new cases a day here in Chicago. We'd gotten down under that 200 case per day mark briefly, and then saw over the summer an increase, and then just over the last month have started to see some decrease. We're at 299 cases per day on average. We're going to focus now on what's happened in phase 4, which is gradually resume, for all of the rest of the slides. So in phase 4 on cases, this is the same graph from before with some more details. What you see is from late June all the way up until August 24th, an increase. Week after week after week. Cases going up, and positivity was not in the right place either. But the good news, while we peaked at 358 cases per day, is that since then, we had a brief dip related to testing over Labor Day, but we now have more than 28 days of slow but stable decreasing in numbers. And that's one of our metrics for being able to move ahead. You'll note for cases, there's actually 2 metrics. One is this stable or decrease for more than 28 days, and one is having the sustained cases under 200. Go ahead. Hospitalizations, similarly, have been on the decline, you can see. Formally, they've been declining in a statistical way since August 27. We're down to 14 new hospitalizations per day. That is also in very good range. Next, deaths. This is also over phase 4. You can see that has dropped very nicely. And even though we saw some increases in cases, largely because we were seeing those in younger people this time, as opposed to older folks who were really hit hard the first time around, we didn't see the big hit on hospitalizations or on deaths. So also, we've been making very good progress here. And then emergency department visits. These are not diagnosed cases of COVID. This is one of our systems where we look for people who have symptoms that may be COVID. It's one of our fastest alert systems. And you can see relatively flat, and then really right at the end of August, for the last 28 days, a very nice decline in terms of people coming to the emergency department with COVID-like symptoms. And then positivity. So this is a little bit of a confusing, it's always a little bit confusing when we talk about positivity because there's 2 ways we count it. But the bottom line is this again is over that phase 4 time period, and we want to be below 5% test positivity. We have to be below 5% positivity to consider moving ahead. And you can see that early on, we were below 5% test positivity. But then in August, got above, a little below, above, a little below, really just flirting with this 5% line, not able to regularly be below it. But now, and since September 10th, which is more than 14 days, we have consistently been able to see that percent positivity under 5%. We're at 4.3% today on test positivity, which puts us in that continued progress, green range. I do want to note our person positivity, which is when we count one person and one test, does remain above 7%. So we track both of these. But this also was some very good progress. And then quickly on hospital capacity. All of our capacity has been good throughout phase 4. You can see for hospital capacity, all the way since early June, those purple lines note where we need to be in green. And you can see that on the left, our hospital non-ICU beds, nice downtrend, continue to downtrend. Our level of concern is if we're at 1,000 beds that are full with COVID patients, and we're at 259 right now. ICU in the middle there, the threshold is 400 for major concern, and we're at 89, and then ventilators, the concern is 300, we're at 45. Again, there's been nice progress, largely because of the different age groups that we've seen affected, and that Chicagoans have done a good job of protecting those most vulnerable to severe outcomes. Testing capacity, similarly, here we want to be above that purple line, doing at least 4,500 tests per day. That marks the ability to test 5% of Chicago's residents every month. We've well exceeded this for more than 95 days. And then finally, our response capacity. This is our ability to have enough case investigations and contact tracers. We've hit our benchmark for that between the 75 and the 90% of cases assigned within 24 hours since June. So in summary, we're at a place to carefully move ahead. The restrictions that we're lifting today, we're excited about because they mark progress, but we will continue at the health department to track all 8 of those indicators. And if any of them start to show signs of concern where we're in yellow, we pause. If we start to see things heading in the wrong direction for enough period of time as laid out in that graph, we might have to go backwards. But as long as we continue to stay in the green, continue to see progress, even if things are stable 28 days from now, we may, for example, be able to move to a 50% capacity. But we're going to follow, move ahead carefully. Now is the time to double down on the things that you know work, not to relax. And with that, I'd like to welcome Rosa Escareno, the commissioner from BACP.
Thank you. Good afternoon. My name is Rosa Escareno, and I'm the Commissioner for the Department of Business Affairs and Consumer Protection. 6 months ago, I stood with Mayor Lightfoot and Governor Pritzker as they announced the closure of restaurants and bars across the state. A day we never thought would be here, a time full of uncertainty, fear, and anxiety for everybody. The challenges over the next 6 months were truly unprecedented, and we asked our businesses to make very difficult and critical changes throughout that time. And they stood up to the challenge every single time. Putting the health of our residents first, and in a true Chicago way, we all came together to face the challenges and to work hard to ensure the safety of our city. And it's because of these efforts that have led us to this change today. And I am full of hope as we announce the easing of these business reopening restrictions. And I strongly believe that we can take this step because throughout the crisis, our business community has complied with the orders that we have put in place. They have kept the workers, customers, and our community safe. We can take this step because the residents, as customers, have shown that they care about our fellow Chicagoans by masking up, social distancing, washing their hands. They are protecting the workers at their local restaurants, barbershops, and gyms. And we can take this step because our essential workers have kept our city running during this crisis and are enforcing the guidelines as we reopen to ensure that we are keeping everybody safe. Businesses have been doing their part, and since June, we have conducted over 2,000 investigations of businesses, yet we've only cited 6%, a clear indication that they're working really hard with us. But make no mistake, because we will make sure that they continue to follow these new guidelines. And as my department, along with all the city agencies have been doing, we will continue to establish the protocols that have been in place. So we will continue calling and holding webinars to make sure that every business understands the new requirements. We will maintain our strict enforcement, responding to complaints and now also conducting proactive visits to bars, restaurants, gyms, barbershops, and all the other businesses throughout the city. We will continue our efforts to crack down on large commercial gatherings. As you know, the mayor instructed me to put together a task force to address those large gatherings. This is not the time to be having parties because, again, this goes to protecting our residents. So today is a day that we look forward to the recovery of our city with true hope and optimism. And I ask, as the mayor and Dr. Arwady continue to remind us, we are not out of the woods yet. And so I encourage all of you to continue to work together with us so that we can keep our city open, keep our workers working, and keep our residents safe. We have to do this for the health of our city. So I want to thank you for all your partnership, to all the businesses and the aldermen here today. And Sam, thank you for working with, excuse me, I have a cold. Thank you for working with us. And now I'd like to call Samir Mayakar, Deputy Mayor for Neighborhood and Economic Development. Thank you.
Thank you, Commissioner, and good afternoon, everybody. As you heard, my name is Samir Mayakar, and I'm very proud to serve as Mayor Lightfoot's Deputy Mayor for Neighborhood and Economic Development. Now, as the Mayor mentioned, we continue turning up the dimmer switch gradually on our reopening efforts. And in particular, I want to highlight the true willingness of the business community to partner with the city and Mayor Lightfoot's team in supporting our reopening efforts with constructive guidance, financial support, and civic leadership. This continued reopening would absolutely not be possible without the leadership of the mayor and the joint support from businesses, community organization, workers, and all of our residents. So what I want to do today is to update you on the state of the Chicago economy and our recovery. We know that we are facing unprecedented times of economic crisis, and we are certainly not out of the woods. But there are some silver linings that we can point to here in Chicago. First and foremost is the fact that we remain the largest open city in America. So I thought I'd start with some data on small businesses. This is something personally very important to me, having come to this job after running a small business. Now, we have a partnership with the University of Chicago, and they track data from a company called Homebase, and it allows us to understand what's going on in our small business community. So what started after the shutdown, you can see a deep drop-off in hours scheduled and firm closures. And what started as a V-shaped recovery has started to plateau. And this is something we're seeing all across the country. Worker hours are down 35% from pre-COVID levels, and 25% of Chicago businesses remain closed. However, Chicago is in a better position than other cities. We are less impacted due to our COVID response as a city and that gradual dialing up of our economy. But what this tells you, the fact that Houston, Los Angeles, New York City are further behind us in terms of the health of their small business communities, this tells you that we need federal leadership and federal support of our business community. What this also told us and our team is that we needed to do more as a city. So Mayor Lightfoot challenged us to provide a transformational level of support to our small business community. And to date, we've allocated nearly $150 million to directly support small businesses in Chicago. Now, if you compare that with our peer cities, this is 300% more support than New York provided, and it's more support from a municipal standpoint than the top 5 cities of America have provided to their small business community combined. But the support is not enough. It's also about how those dollars are allocated. And if we look across our city, we took particular care to make sure that we are filling in the gaps from what wasn't covered in the federal PPP program. So what you see here in purple is a mapped out level of the $3.8 billion of federal PPP money mapped across our city. And on the right-hand side, you'll see that we've taken particular efforts because Mayor Lightfoot challenged us to take an equity lens with our small business support to provide support to who fell through the cracks of the federal PPP program. So you see a particular concentration on the Northwest, the West, the Southwest, and the South Sides, to making sure that we're supporting those businesses that might not have stable banking relationships and might not have tapped into that federal PPP program. Now, moving on to consumer spending. We have a partnership with Bank of America, and they have a detailed breakdown of their millions of customers in terms of credit card spend and debit card spend, which we can use as a proxy to overall economic activity in our city. And this is something that they compare all across the country. And what this data has told us week after week for the past 3 months is that Chicago has the largest amount of spending growth in terms of consumer spending of any big city in our country. So we are happy about that. Now, obviously, it's not enough. We know that there's still more to do, but this fits in with that theme that we've handled this crisis about as well as the city can handle it. And it's also due to the underlying strength and diversity of the Chicago economy, because as you know, no one sector of the Chicago economy occupies more than 14%. Moving on to real estate. We are in frequent contact with our friends at the Chicagoland Association of Realtors, and we thought we wanted to provide an update on how we're doing in terms of home sales and condo sales. So year to date, if you just look at the single-family home market, it's actually never been stronger in recent history. We're at an all-time low of inventory. In fact, median sales prices year on year are up 8%, and inventory is at a historic low. Moving to the condo market, it's very stable. We have a comparable number of listings year on year. The median sales price is up 7%, and inventory is stable. So we see a strong real estate market here in Chicago. Finally, I wanted to highlight some recent wins. There are so many companies growing here in Chicago that are in line with our recovery plans. And I want to note that under the mayor's leadership, we published the first recovery plan of any American city. So Amazon will be growing in Chicago, creating thousands of new jobs, and they have a steady pipeline of new last-mile facilities that will be growing in our city. Secondly, the Department of Energy has made $230 million of investments in quantum research in the Chicago economy, and that will pay dividends in terms of startup activity. Third, just a few weeks ago, Xeris Pharmaceuticals, a pharma-based company in San Diego, announced that they're relocating their research and development operations to Chicago from the West Coast. So we have net regional growth in our life science sector, and their facility will be in Fulton Market. And finally, New Cold Advanced Coal Logistics. Our recovery plans call for the growth in the food and agriculture sector, also in warehousing. And this is at the intersection of all three because it's a cold storage facility, and we expect many more of these to come. Now, there will also be a pretty big announcement coming in the next day or two regarding a major corporate headquarters, so stay tuned and pay attention to that. So to recap, economically, we are the largest open city in America. We have the first recovery plan of any major American city, and we encourage all of you, our residents, to eat, shop, and live Chicago. Our team knows that the city is going to get through this pandemic and that together we're going to build a more equitable, thriving business ecosystem for everyone. Thank you very much, and with that, I'd like to introduce our friend Sam Toya from the Illinois Restaurant Association.
Excuse me. Thank you, Deputy Mayor. Again, I'm Sam Toya, President and CEO of the Illinois Restaurant Association. As a city, we've been through tremendous hardship over the last 6 months. Our restaurant and hospitality industry, particularly, has been decimated by COVID-19. 55% of the Illinois restaurants say if things don't change, they will go out of business in the next 6 months. But we're here for change. Overall, 63% don't expect their staffing levels to return to the pre-COVID levels for the next 6 months. In Chicago alone, there are 171,000 jobs in the hospitality restaurant industry at our 7,200 restaurants. In impossible circumstances, Mayor Lightfoot and her team have continued to lead the city in a pragmatic way that balances the public health of Chicagoans and the welfare of businesses that drive our economy. Throughout the expanded outdoor dining program and winter dining design challenge, the city has been proactively working to find creative solutions to support the neighborhood businesses we all know and love. The safety and well-being of our team members are always at the top of our list. The safety of our team members and guests, we get that in the restaurant industry. And we're taking every necessary precaution to create safe and welcoming environments. We've collectively worked to affirm that our restaurants are serving you safely, then, now, and always. Thanks to the city's balanced approach, Chicago economy is more open than places like New York and Los Angeles, and our COVID indicators are headed in the right direction. The IRA remains committed partner to the City of Chicago to ensure that all necessary health guidelines, such as mandatory face coverings and social distancing, are followed by all eating and drinking establishments. Covered faces keep open places. We understand that. Increasing occupancy and extending our hours of operation will help give struggling restaurants and bars a chance to see light at the end of the tunnel. Allowing large restaurants to have needed flexibility to divide their indoor space is another helpful regulatory action. And finally, thanks to the team at TOC, restaurants across our 77 communities will have access to cost-effective and beneficial partnership opportunities for ordering and reservation. These are constructive steps in the right directions that will allow more restaurants and bars to keep their doors open and provide thousands of jobs to Chicagoans. But we really need the federal government to step up for the independent restaurants here in the city of Chicago and throughout the nation, like they have in the past for the airlines, for the banking industry, for the auto industry. So we encourage the federal government to please look at the Restaurant Act and help our independent restaurants. As we all know, restaurants are the soul of every neighborhood here in our 77 communities, but throughout the country. So we're looking forward to working with the federal government on that. On behalf of the IRA and the restaurant community of Chicago, I greatly appreciate the level of consistent communication and engagement from Mayor Lightfoot and Deputy Mayor Markar and our leaders at City Hall. As I always say, communication and education is the key to success, and Mayor Lightfoot is always willing to communicate, educate, and it's always a two-way street. And that's what I really appreciate about working with Mayor Lightfoot and her team. They're always there 24/7 to communicate and educate both ways. We're all in this COVID-19 fight together, and it will take continued collaboration between businesses, elected officials, public health experts, and community leaders to keep a strong and steady path for recovery. So I want to thank you, and I want to invite Abby Phelps, the owner of Pilates Studio, up here.
Thank you, and thank you for the opportunity to be here. As Sam said, my name is Abby Phelps. I own 3 Club Pilates in Chicago, but I'm here as a board member of the Illinois Fitness Association to remind people that studios and gyms are inherently safe. As an industry, we've taken the Illinois Fitness Alliance pledge to wear masks and practice social distancing to keep our members and staff safe at all times. States with contact tracing like Louisiana and Colorado have found that fitness settings are among the least likely source of spread of COVID-19. In fact, the fitness industry is a critical part of the healthcare solution to COVID. Exercise fights many of the comorbidities associated with severe COVID cases and reduces depression and anxiety in a year that has taken a major toll on mental health. As Chicago turns cold, clubs and studios will become even more important to keeping Chicagoans safe, healthy, and active. Everyone in our facilities wears a mask the entire time, making us among the safest places to recreate indoors. Chris Whitty, England's chief medical officer, their version of Dr. Fauci, has said, "There is no situation, no age, no condition where exercise is not good. We all need stress relief, and we need it in a safe environment." We appreciate the opportunity to work with the city and Mayor Lightfoot's office to figure out the safest way for gyms and studios to stay open and to continue to increase capacity to keep the greatest number of members healthy and the greatest number of our staff employed. Thank you so much, and I would like to pass to Brian Fitzpatrick of TOC.
Thank you, Abby. As you said, I'm Brian Fitzpatrick, co-founder and chief technology officer of TOC. TOC is the only unified system to offer reservations, takeout, delivery, and events all in one place, while at the same time helping restaurants to know their diner. We're currently the fastest growing reservation system in the United States, operating in over 200 cities. As a locally grown Chicago business, we're thrilled to partner with the city to help expand safe dining and help restaurants build a bridge to the future. For many restaurants and bars, especially those in historically disinvested areas, technology can make all the difference. Access to reservation systems during this critical time will help businesses keep pace while ensuring they comply with reservations and keep both their employees and patrons safe. Thank you.
Happy to take your questions.
Mayor, thank you so much. Of course, I'm getting questions from my fellow journalists who are asking, why now? When there had been so much talk early on that the city had to be below 200 cases per day to ease any restrictions, and you're not at that. We're at 299.
Yeah, I don't know that we said 200, and I'll let Dr. already talk about the specifics, but look, we have seen a consistent enough progress from where we were back in late July and early August, and then a lot of conversation with various industry sectors. We're always going to follow the public health guidance, full stop. And we believe that seeing the trends over the last 28 days, that we can safely take this next initial step. And we also need to be mindful of the fact that our businesses have just been devastated by COVID-19. And so we're at a place where we feel like the public health guidance allows us to take these next steps, so we're taking them. Now, if we see a problem, and everybody knows this because we are in regular dialogue with virtually every industry sector out there, if we see something headed in the wrong direction, we're not going to hesitate, as we did before, to step back. But we feel confident enough in the numbers, as Dr. already outlined in her statement, that this step is carefully done with a lot of support from us, a lot of communication with the hospitality industry, the gyms, and other venues. We haven't talked about the faith community, but this affects them as well, that we can take these next steps safely if we continue to remain diligent. Dr. Arvani?
Thank you. Janelle, could you just pull up my first slide? So what we actually laid out when we moved into phase 4 were two different options for being in that advanced progress move ahead. And I just want to pull it up again. So if you look all the way on the right, for cases, we specifically called out stable or decrease for more than 28 days and or sustained less than 200 new cases per day. And we did that recognizing that under 200 cases per day puts us out of the high incidence category, but recognizing that if we were not necessarily going to get to 200 cases per day, if we had seen at least 2 incubation periods of progress and everything else was in the green zone, meaning the positivity was under 5%, our capacity was good, we would be able to move ahead. And so the fact that, we waited basically that 28 days to make sure that we were seeing that decrease. We had that little dip over Labor Day, so we had to make sure that wasn't anything that was going to be a problem for us. But at the end of the end of the road, you can't make opening decisions at a time when you're having a significant increase. It's not safe. If we're going to try to move ahead here, and everybody recognizes that we're moving into colder weather, the time when we've been on a consistent decrease for a month and everything is in line with what we laid out, it's the right time to move ahead cautiously, as we're doing, and we'll keep following that data and keep using these exact same metrics that we laid out to make further decisions.
May I ask you one more? The cap for restaurants remains at 50 people maximum per room.
Yes.
That means a restaurant with a capacity for 200 will not be able to seat any more people starting October 1st than they can today. Why wasn't the cap increased?
So we certainly talked about that. And again, we are being cautious here. As you know, we're not below that 200 cases. You know, it's just been 14 days that our percent positivity is under 5%. And we wanted to work on being able to have some expansion, like with the hours, like with the capacity. But we do want to keep, for now, that limit of 50 per room. And as we've shared previously, that's just based on how many cases there are in Chicago and the risk that in a setting with 50 people, there's more than a 15% chance that somebody would have COVID in a group and not be aware.
Also, I'm hearing, next question, a lot of Chicago restaurant owners wonder why they can't have 10 people at tables compared to the rest of the state. Why is the city keeping it at 6? And what will it take to change that number?
Yeah, so once again, we are making decisions here in a way that is careful and that the hope will let us continue to move ahead. If we were to open everything up right now, I am confident that unfortunately we would see a big increase and we would have to take big steps backwards. We're trying to do this gradually, conscious of course that colder weather is coming, and as we continue to see stability or progress in our numbers, we can continue to look at some of these options. But there is still a lot of COVID here in Chicago, and the fact is when you're dining, you don't have a mask on by definition. We've not figured out a way yet to eat through a mask. So eating and drinking in a restaurant just is a higher risk activity. And so we want to keep that limit to 6 and want those people to be within an existing bubble as much as possible.
Mayor, this might be best for you, I think. What is the status of the service fee limit for third-party delivery services? As winter approaches, this seems that this could be a bigger issue in the coming months.
Well, I actually think that one of the things that I'm excited about with this new Talk app is that it will, I think, substantially reduce the potential for service fees. But that is something that we're looking at very, very carefully. My preference always is to try to educate people into compliance, but and we've been very, very direct with some of these companies that charge fees. We've seen things where they appropriate somebody's menu and make it look like they're actually in a business relationship and they're not. They have charge fees that are untethered from the service that they're delivering. So we've spent a lot of time being pretty direct with them about the do's and the don'ts, and it's my hope that we will continue to see progress. But if not, you know that there are ordinances pending by several members of City Council. And if we can't get the industry to be responsive, then we're going to have to do it for them.
What is the scientific reasoning for 40% and not 50%?
Well, again, I'll let Dr. already get into the specifics. We've looked very carefully at what's happened in other parts of the state, the region, and across the country. And what we've seen is instances where you go from a modest amount, which is 25%, to a much higher amount. You see a number of things. But most importantly, we've seen cases increase exponentially. And so from day one of reopening back on June 3rd, we've taken the approach that we want to be cautious, we want to be prudent, we want to work with our businesses, but we want to do it in a way that we don't have to keep taking steps back. And I won't name names of different states, but we've seen other states, other cities go from essentially very low to very high quickly, and invariably, in almost every instance, they've had to dramatically take steps back. I think that's hard on everyone, particularly hard on those businesses who then hire people, think that they know what the capacity limits are, and then they hit a brick wall because the city or the state says, no, we got to go back multiple steps. We don't want to do that in Chicago if we can avoid it. We want to gradually ramp up, increase capacity, but we want to do it in a way that really is safe. And looking at what's happened across the country, we feel like this is the most prudent approach. You asked earlier, well, why not do 10 people at a table? Because we believe, based upon our research and watching what's happened in other parts of the country and the world, when you start increasing the table size, then you see problems. People are less adherent to the masking rule, less adherent to social distancing. This is a way, these are all thoughtful things that we have done, talking with our partners, but we think that this is the most prudent approach. And Doctor, I don't know if you want to add anything to that or not.
I would just add that I think one of the reasons, honestly, that we're at the point where we are to be loosening some of these restrictions is because we've been a little more conservative than much of the state has. Besides Urbana-Champaign, where there's a lot of testing and that percent positivity is under 3%, Chicago and Cook County are the only areas in the state that are under that 5% test positivity. And I want to do everything I can to relax these restrictions in ways that will be safe. My hope is that we'll be at 50%, a month from now, for example, but we would need to see continued at least stability, if not decline, just as we laid out at the beginning of phase 4. There are cities around the country that have used different markers for this. Seattle's at 30%. But it's about loosening not just that one thing, all of the various restrictions that we've done at once, and see how we go. And I think if people can be serious, wear the mask, do all the things that we've laid out, my dear hope is that as it gets colder and we move inside, we don't see spikes, and instead we're able to be up here a month from now.
We're going to cut in right here on News Now from Fox. It looks like we have Jill Biden heading up to the podium. She is going to be addressing some coronavirus news as well as specifically the economic recovery for the nation. So we're going to tune into that. We'll come back to this press conference in Chicago, which was also talking about coronavirus. In summary, they're saying that they're at a place to carefully move ahead. So we'll come back to that a little bit later. Thanks for watching.
Next First Lady here today as well. Oh dear. In Waukesha County and communities across Wisconsin, families are struggling to stay afloat during this pandemic and recession as temporary layoffs become permanent job losses. While the president downplays and denies any real threat from the pandemic, families are paying for his failure to act with their lives and livelihoods. During these uncertain times, it should be obvious Americans need access to health care, now more than ever. But instead of expanding life-saving care or working to reduce the price of prescription drugs, Donald Trump is in court trying to strip millions of their coverage in the middle of a global pandemic. As a nurse educator and a former nurse practitioner, I've seen how the healthcare system still doesn't work for many, and I also know how devastating Donald Trump's actions will be if he succeeds in overturning the Affordable Care Act. As a nurse practitioner, I took care of a gentleman in the emergency department who had not had care in over 20 years. And he had not seen a healthcare provider because he just couldn't afford it. He was working full-time, just didn't have the benefits. I diagnosed him with diabetes and asked him to follow up with me at a free clinic that I volunteered at. When he came to my free clinic, I gave him insulin, which is a life-saving medication for diabetes. I also diagnosed him with high blood pressure and started him on medications for that. We were able to have him sign up for the ACA or Affordable Care Act. Within a week, he was able to see a primary care provider within his needs. And, that just shows me that we're not doing enough. It doesn't have to be this way. Vice President Biden has a plan to give Americans more choice, reduce healthcare costs, and make our healthcare system less complex to navigate. He also believes that this is not the time to just build back to the way things were before, with the old economy's structural weaknesses and inequalities in place. This is the moment to build an economy where every American enjoys a fair return for their work and an equal chance to get ahead. And now I'll turn it over to former Justice on the Wisconsin Supreme Court, Janine Geske. Thank you.
Welcome, Dr. Biden. We've experienced all 4 seasons while we've been waiting for you here. So, as a former judge and a former Wisconsin Supreme Court justice, I have stayed away from endorsing candidates. For 40 years, I have not endorsed a single partisan candidate, but I decided this was the time to speak. I could not remain silent as this race goes on and the difference that there is between the 2 candidates. So I'm very proud to have joined the Biden-Harris team. And as hard as it may be sometimes, this was an easy choice. I know many of you, as I do, mourn the passing of Justice Ginsburg. Justice Ginsburg's successor will have a profound impact on every part of our lives and our future. This isn't about who's sitting on the court. It's how people are going to decide issues on the court. We need fair and impartial justice on the court. People that will go there without a predestined decision in hand when they're deciding these critical issues that affect Americans. And so it is important that we look at what's happening at the Supreme Court today, tomorrow, and the next few weeks, because it will affect our lives and our children's lives for years and years to come. If Donald Trump succeeds in this appointment, we could see the court strip our country of affordable health care, and we will have millions of people who are going without basic health care and medicines because of that decision. All this while the COVID-19 is going on, like the lung scarring and heart damage that we're finding in people. There's simply too much at stake in this race to remain on the sidelines. I'm standing here, Dr. Biden, for my children, but my granddaughter, who's 16, wave, Patricia, and who absolutely is thrilled about being here today because she too knows that this race is important. And I will not be along for the next 10 decades, but she will. And it is important that we have leadership that is wise, that is caring, that is empathetic, that displays leadership to our children. One of the worst things I think that have happened during these 3.5 years is that all the children who have looked to see what a leader looks like have seen Donald Trump. They've heard his language, they've heard his meanness, they've heard his bullying, and that's who they've learned to accept as their president. We have to end that. We need a president like Joe Biden who's going to treat people with respect, with empathy, to deal with racial inequities, and to be able to make a difference in this world. Joe Biden has the experience and wisdom that we need at this moment. Now I'll turn the program over to Lynn Carey, a retired nurse and nursing professor from Washington County.
Thank you, Justice. It is really wonderful to be here today with all of you and with, of course, Dr. Biden.
Thank you.
My family, Jill, my family understands the economic consequences of health insurance. In 2004, I was diagnosed with a rare lung disease. I saw my doctor because I was short of breath. I thought I would leave his office with a prescription for an inhaler. Instead, I left with a prescription for oxygen 24/7 and a diagnosis that changed my life. I was on oxygen every day, all day. I was on very expensive medications. I needed to be monitored by my pulmonologist every 3 months. And I needed expensive procedures like heart catheterizations. I had to stop working. And when you stop working, we all know what happens, right? What do you lose? Your health insurance. I lost my health insurance. I was able to go on my husband's plan, and then he lost his job. So we lost our insurance again. I know what it feels like to be sitting across the table when someone tells you that you do not qualify for insurance because you have a pre-existing condition. We cannot go back. Fortunately, he did find a job shortly after, and I was able to get on his plan. They could not deny me because of the ACA. Actually, Dr. Biden, Jill, I first met you 8 years ago during the Obama-Biden re-election campaign. I was on oxygen. And I have a picture, and for some reason, you look the same, but I don't look that same. But I remember your kindness and concern as we talked. Well, as you can see, I don't need oxygen to talk with you today. On May 13th, 2015, I was fortunate enough to have a double lung transplant. Wow. Thanks to a young woman, a 37-year-old young woman who chose to be an organ donor. So transplants and ICU stays and rehab are expensive. We did not go bankrupt. We did not have to worry about losing everything we had worked so hard for because of the ACA. Yeah. And now COVID threatens all Americans, and particularly those who have chronic health problems or are immunosuppressed, like I am. So you see, I understand that this is a critical time. I understand that much is at stake in this election. For me, for my family, health care is at the top of my list. Joe Biden has laid a detailed set of plans. I was just on the website yesterday looking at the health plan once again. And no matter who you are, Joe would make COVID testing, treatment, and vaccines available to all of us free. Joe will give a, yes, that's huge. Americans will have a new choice, offering a new public option like Medicare, the fastest path to universal coverage. We all have the opportunity to elect a candidate in Joe Biden with the experience to help us recover and the empathy to help our country heal. So with that, I would like to introduce someone who I think speaks so well and gives me hope every day. Our second lady, former second lady, soon to be our first lady, Dr. Jill Biden.
Oh, thank you. Okay. Thank you, Lynn. And it's wonderful to see you again. My gosh. You know, as a nursing educator and a transplant survivor, you know our healthcare system better than anyone. Wow, you have quite a story. And you've seen how innovation can save lives, and the quality of care doesn't mean much if you can't afford it, right? So once again, I'm so grateful for your sharing your incredible story, and I thank you for your tireless efforts for making sure that all Americans get the health care that they need. Amy and Maggie, thank you so much for hosting us today in your beautiful house and your beautiful land with your beautiful animals. So I'm so glad to be here in Waukesha. I said that right? Right? Okay. Especially to be here in person after I've done so many virtual events in your state. But I'd like to start with a personal story of my own. So as many of you know, I've taught, for the last 10 years, I've taught writing at Northern Virginia Community College. But I've been a teacher forever, for 36 years. And a few years ago, I had to tell my students that I would miss the next class for personal reasons. And so my students have a lot of shining qualities, but boundaries are not one of them. So they immediately began shouting to me, Dr. B, where are you going? Well, my sister Jan was having a stem cell transplant, the first of her cancer treatments, and she would be isolated in a hospital room for over 6 weeks. And I tried to explain that to my class with as much composure as I could muster. But as I tried to tell them, you know, the words caught in my throat. And so I turned around, and I was in my classroom, and I faced the whiteboard, you know, hoping to gain my composure. And as I turned back around, my entire class was lined up, and they gave me a hug one by one. And that act of kindness, that act of community gave me the strength to keep going. And it saved me in a time when I didn't even realize how much I was struggling. And in a way, that act of community saved my sister Jan, too. You know, she has built her career as a waitress, and when she got sick, believe me, she didn't have the money, and she didn't have the insurance to cover her treatments. It was only because of the Affordable Care Act that she was able to find a plan that she could afford. And it was that law that made it possible for her to get covered, even though she had a pre-existing condition. So it's easy to take for granted just how much changed when we passed the ACA. So 20 million people got covered. It's amazing to think of that, including more than 200,000 Wisconsinites. Wisconsinites, I don't think I ever said that word before. So pre-existing conditions got covered. You know, it's not an exaggeration to say that this law saved my sister's life. And we all know that the ability to take care of our health is the foundation of a good life. I mean, we all agree with that. But these last few months have shown us that it's more than that, too. Our health is the foundation of our communities and our economy. And gosh, this pandemic has done so much damage. Some of it can be measured. The over 200,000 American lives lost. Millions who have contracted this disease and may now, and because of it, now have a pre-existing condition. The more than 10 million workers who are jobless. But in other ways, the damage can't be measured. The lost time with our loved ones, the mental toll of isolation and anxiety, the shattered hearts of every family that is grieving a loved one. And it didn't have to be this way. I mean, that's what's so unbelievable. It didn't have to be this way. And at almost every turn, this administration has not only failed to prevent and mitigate the destruction around us, they've made it worse. As the pandemic rages, President Trump is attacking the health care coverage that millions of Americans rely on and trying to eliminate the protections for people with pre-existing conditions. He's hoping to get rid of the law that protects them. I mean, for all of us, I mean, it's unbelievable. Still, amid the chaos and the grief, we also have so many stories of courage and resistance and resilience. Healthcare workers going above and beyond to care for their patients. Educators driving to neighborhoods to create hotspots for kids who don't have Wi-Fi. People donating food at food banks and in order for others to keep safe. It's amazing the food insecurity that we've seen in this country. And across this country, people of all walks of life are putting their shoulders back and fighting for each other. We haven't given up. We just need leadership worthy of our nation, worthy of all of you. And Joe is the only candidate in this race with a plan to recover from this pandemic. He's going to provide clear, evidence-based, yes, he believes in science, national guidance for businesses, schools, and individuals, created by public health experts. And he's going to make sure that our schools and our child care centers have the resources that they need to be safe, so that our kids can go back to school and we all can go back to work. And he's going to ensure that all Americans have access, like was said, you know, to free testing, free treatments, and when that vaccine comes out, so that we can protect our families and our communities. But it's not just about returning to a system that left so many behind. It's about building our nation back better than before. And that's why Joe is going to make sure that our steps for economic recovery are just, equitable, and benefit all Americans, creating millions of good-paying jobs. And he's going to invest in the small businesses that are the backbone of our country. And he will not only defend the Affordable Care Act, he will build on it as well. Because it was always meant to be like a starting point, not a finish line. So he's going to create a public health insurance option like Medicare so that everyone can have high-quality, affordable health care plan. And he's going to lower premiums, deductibles, and out-of-pocket costs. And the big one, I think, for everybody, he's going to make prescription drugs affordable. And I hear that across this country. Joe has spent his entire career bringing people together and getting the seemingly impossible done. And I can't think of anyone better to lead us through this pandemic than my husband, Joe. With the chaos of this moment, the uncertainty, it can be easy to watch, what's going on and feel so discouraged. I mean, I hear from a lot of people, how much anxiety and depression they feel. But right now, we don't have to just watch what happens. We have to decide what happens. And when we elect Joe and Kamala, they will help bring us back together and heal our fractured communities. And they have the fortitude to help us rebuild better than ever. And with their steady leadership, steady, not chaos like we have now, we can change the course of our future. So for just a moment, I want to take you to that future. So imagine that it's November 4th, the day after the election. I know, we're all like counting down, right? You wake up and it's a beautiful morning, maybe a little bit more sunshine than today. And maybe you stayed up a little too late watching the returns. I'm sure we're going to be up till all night. So you go and you pour yourself a cup of coffee. And at first you start to worry about your day, which I'm sure you all do now, like thinking, oh my gosh, what time are my meetings? What time do I have to get onto that computer? You're thinking about your Zoom schedule. And then it hits you like, oh my God, Joe Biden won the election. And pretty soon there's going to be a nationwide strategy to end this pandemic. And when you go out to get your mail, you think about your neighbor who lost her job. And then you realize, whoa, the next president is the same man who led the recovery in 2008 that created millions of jobs. You go to check the news and you notice there's no pit in your stomach. Your shoulders don't tense up. You're not dreading what's going on in the world. Instead, you sit a little taller, knowing that our next commander-in-chief will bring out the best in us. A president and a vice president-elect that your kids, your granddaughter, can look up to. Leadership that makes you proud. Joe Biden and Kamala Harris. And for the first time in so long, you take a deep breath and you feel hope. That's the November 4th that I want. And I know it's the November 4th you all want, or you wouldn't be sitting here today. In this moment, we have the power to decide what comes next. So I know you're here because you're already engaged. And or you wouldn't be sitting in this freezing cold. And I know you're busy and you're probably stretched too thin. But I'm asking you to just do a little bit more for the next 36 days, because this election is just too important to sit out on the sidelines. All of us have to do every single thing we can until the election. This is it. There are no do-overs. This is our last shot to wake up November 4th and feel that hope. So join us. Go to iwillvote.com to make sure you're registered. So I don't know if you've all done that. And so to make sure you're registered, help your friends and family do that too. Make sure they're registered. We have just, then if you want to get involved with our campaign, you, this is so funny. You text cheese to 30330. It's very fitting. So we have just 36 more days. 36 more days to make sure that our voices are heard, to make calls and talk to our neighbors, to fight for this country like we've never fought before. Let's wake up November 4th knowing that we did everything we can to feel that hope again. This is our moment. This is our election. This is our nation, and we will get to choose our future together. So thank you all for being here. Thank you for, in this chilly weather. Thank you for your commitment and your support. Thank you. Thank you, everybody. Oh, thanks. Thanks. Okay.
Well, you're taking a look at Dr. Jill Biden. That was her pandemic economic recovery plan right there in Wisconsin. Text cheese. Love that. So today, definitely the topic is coronavirus. So we're going to head out to New Jersey, where they had a briefing out there as well, just kind of updating the public about where they're at. So let's head over there on News Now from Fox.
Good afternoon, everyone. Thank you very much for bearing with us with a later start today. I'm joined by the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right, another familiar face, the state's epidemiologist, Dr. Christina Tan. Thank you both for being here. Guy to my left needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. We have the Director of the Office of Homeland Security and Preparedness, Jared Maples, is with us, Deputy Counsel, Paramel Garg, and others. So, beginning over the weekend, our team was in touch with the White House to further discussions on rapid testing resources for New Jersey. And following those conversations, and as was laid out in a video meeting three of us just came from, we've been notified that New Jersey will receive a total of 2.6 million of the NewsNOW rapid tests being produced by Abbott Labs. This is an antigen test that can provide results in 15 minutes with a very easy nasal swab, as opposed to the straight up turn left variety that we all started with. The first 170,000 of those tests will be coming within the next 2 weeks. These new tests will significantly scale up our testing capabilities. Through the Department of Health, obviously under Judy's leadership, we'll be working with our federal and local partners on a distribution plan. So this could be, if it comes to pass in the way that it has been described over the weekend and in the call that we all just left, this could be a game changer. When you do the math, it's just shy of doubling our daily testing capacity for about 12 weeks. And that allows, Judy, we talked earlier, you could plus up testing immediate overnight resources into a hotspot such as we're seeing in Ocean County, which I know you'll talk about. You could envision it being a big weapon in schools, a school setting, a big weapon in augmenting our already ongoing efforts with healthcare workers or vulnerable populations. So a potential game changer. I want to thank the administration. I also want to thank Abbott CEO Bob Ford was on that call that we just got off. As we learn more about this, we'll keep you posted. But this is a big deal. Next, working under a timeline that's put forward by FEMA, I have sent President Trump a request for a formal major disaster declaration and recovery funds for counties battered by Tropical Storm Isaias in early August. All totaled, we are requesting just...
All right, so we do have some live news for you. We've got Kamala Harris, who is presenting a sister-to-sister meet and greet shop talk roundtable. That's going to be in North Carolina. So we're going to head over that live here on News Now from Fox.
Question to you is this. Speaking as an Afro-Latino, a Black Latino, of Puerto Rican descent, Latinos have been constantly overlooked until election season. How will the Biden-Harris administration ensure that all are included, especially the Black and Brown community?
That's a wonderful question, and it really does highlight what's at stake in the outcome of this election in so many ways. So let's start with, one of the crises that we're facing as a country, which is the COVID pandemic. I think of it both as a crisis that is about a public health crisis. I think of it as an economic crisis. And in many ways, it is about the crisis of long-standing disparities in our country that have been only exacerbated, only highlighted, which speaks to the crisis of systemic racism in our country. So, on your point, right now we are looking at the fact that Black folks and Latinos are 3 times as likely to contract this virus, and equally 3 times as likely and twice as likely to die from it. And when we look at those disparities, we know that it's connected with the fact that there's a reflection between those numbers and the pre-existing conditions that existed before the virus hit. This virus is a predator in many ways. It preys on people who have pre-existing conditions. So when you look at the Latino community, when you look at the Black community, and you know that similar in many cases in terms of the pre-existing conditions, things like high blood pressure, things like diabetes are real. And so part of the perspective that Joe and I share is one to acknowledge those racial disparities and then address them. And that's about a plan that we have, for example. By the way, Donald Trump has no plan. Let's just start there. So it's not even like we're contrasting plans. He actually does not have a plan. But our plan, which includes what we need to do around testing, around treatment, and I pray every night that we get a vaccine as soon as possible that is safe, and about distribution of that vaccine. It's about addressing the fact that we need to grow what Barack Obama and Joe Biden created with the Affordable Care Act, and we need to expand it so even more people have coverage, that we need to deal with the expansion in a way that we are dealing not only with the health care from the neck down, but let us also realize we need to also expand health care from the neck up. That's called mental health care, which particularly is an issue for us in our Latino and our Black communities, especially when you look at the high rates of undiagnosed and untreated trauma. Right? I mean, think about it for a moment. Just step back on that point. Poverty is trauma-inducing. We need to diagnose and we need to treat it. It is trauma-inducing that you experience all of the effects of poverty, including violence in communities. All of these things must be addressed and done in a manner that is conscious of the disparities based on race, based on historical disproportionate distribution of resources. One of the biggest issues that we face, again, in terms of disparities, I can go into the history. North Carolina knows it better than most. But one of the issues is what is a challenge in terms of access to capital. So the whites, I'm sure they have long stories about what they did to be smart around acquiring capital to build up your business, knowing that a lot of the traditional sources of access to capital were unavailable to black, and still are unavailable to black and brown communities. So Joe Biden and I have a plan that is about $150 billion that is going to be focused on low interest loans and access to capital with an emphasis on black and brown communities, knowing that our businesses have always traditionally been, again, the source of our economic lifeblood and vitality. So those are a couple of things. I can go into the topic of criminal justice. I think we're going to talk about that in a minute. Education, the disparities there. You look at the fact that our children are supposed to be learning from home right now, but in poor communities, in black and brown communities, urban communities as well as rural communities, access to broadband is a real issue. I know it's a real issue here in North Carolina. We're talking about how our children should be learning from home. But first of all, that requires that you have affordable access to broadband if you have access at all. Then, if you have more than one child, do you have access to the technology? Are you going to have that many laptops? So many of our families who have access to Wi-Fi, it's on their cell phone. A child can't learn remotely on a cell phone. These are real issues that will have long-term impact on our communities if we don't see it and address it. And that's part of the plan we have. So I appreciate your question. Thank you.
Thank you so much, Senator Harris. And again, just your answer to that, being a middle school teacher at a Title I school, definitely a lot of the points that you have made are definitely spot on, especially about mental health, which is so important in the African American community. We want to turn it over now to our next question, Mr. LeVarn Barnes.
Good evening and welcome back to North Carolina.
Thank you.
And as a proud public school teacher in Durham Public Schools, I got to shout out the School for Creative Studies before I get in trouble.
Yeah.
My question to you is, how will the Biden-Harris ticket propel young men to be able to have a seat at the table of leadership? So that's my question.
All right. So first of all, it requires that you see young men and see in young men leaders. I find myself, it was actually after the Breonna Taylor grand jury decision that came down last week, I was reminded of one of the many sayings that my late mother had. And one of them is she would say to me, Kamala, don't you ever let anybody tell you who you are. You tell them who you are. So when I say that to you, I'm not suggesting I will tell you you are a young leader and until I anoint you young leader, you are. You're already a young leader. And I'm talking about the fact that I recognize that and I see that and I honor that. It means then creating not only access, but an open door with constant access so that your role of leadership can inform the decisions that I make and that we make. So that's about being not only able to walk through the door, but having a seat at the table. On issues, again, like what we were talking about around access to capital. You are both teachers. Title I funding. Joe and I have a part of our plan for Title I funding is that we will triple Title I funding. And for everybody knows Title I funding is about funding that goes to inner city schools, to schools that have low tax base, cities that have or schools that have the highest rates of need. It's about what we need to do in terms of leadership on issues that are about education. Not only K through 12, which you are both leaders as educators, but also what we need to do around creating access to employment opportunities based on providing the education that is necessary to have those kinds of jobs. The way I think about it is we got to stop talking just about higher education. I like to say instead, let's think about it as education after high school and making sure that there are paths that are available for education after high school, because the good jobs, most of them as we go forward, are going to require education after high school. And for some, that's going to be the ability to, at some point, then walk across the stage with a diploma and a 4-year degree. But for others, that's going to be getting the education so they can get the certificate to qualify for the job that requires that skill. I'm going to need your help figuring out how we make that relevant, how we actually create it as a policy in a way it hits the streets. Because a policy on high means nothing if it doesn't hit the streets. And that's where access, in terms of real leaders who are on the floor, on the ground, will make all the difference if we're going to be relevant. And I can go down the list of the policies that make that so. But also, it's about encouraging you, if you're interested in running for office. It's about being mentors. My mother, again, I'll give you another one of her sayings. She had a lot of them. But she would say to me, Kamala, you may be the first to do many things. Make sure you're not the last. And you can look at both Joe Biden's career and mine to know that mentoring and legacy are very much a way of how we think about our responsibility as leaders. So thank you for that.
Thank you.
Thank you.
Thank you, Levon, for such a critical question. So next, as we keep this ball rolling, I'd like to introduce Mr. Marcus Bass for the next question.
Senator Harris, welcome to North Carolina. Thank you for putting yourself out there as a black woman in such a pivotal way. We see so much uncertainty in this moment, but one thing we are sure of is that leadership is needed. My question, the perception among many young black and brown voters is that a Biden-Harris ticket may not be reflective of a hard line on the true reforms necessary in our criminal justice and social economic systems. The better than 45 message alone, with 6 weeks to go, needs a sharper, hard line for the base of voters protesting in this moment right now. How will a Biden-Harris ticket move past the lesser of two evils narrative being used to promote them to young black voters and get in tune with the issue base of the criminal justice community?
I appreciate the question and the point. So first of all, the premise of your point is something I couldn't agree with more, which is we have to earn the votes. Nobody is supposed to vote for us. We need to earn it. The other point that I think you're raising is something that I agree profoundly with, which is let's step back and decide how we're going to declare a win and how we're measuring the win. How do we define the win? Because here's what I mean. If you define the win as just simply beating Donald Trump, then the job is over the day we get sworn in. But if you define the win as winning, to actually confront the issues, then the job begins the day we're sworn in. So I couldn't agree more with the spirit with which you make the point. Now, specifically on topic, I know as a former prosecutor, and let me give you the background on that. My parents met when they were active in the civil rights movement, marching and shouting. There is not a black man I know, be he a relative or friend, who has not been the subject of some form of racial profiling, unreasonable stop, or excessive force. I grew up understanding how the system works. And it was the very distrust that so many have today that propelled me to become a prosecutor, because I decided, well, there are many ways to deal with the system. I'm going to choose to go in the system to see if I can't help reform it from the inside, which is why I created some of the first in the nation initiatives. For example, one that focused on young men who were arrested for drug sales and getting them jobs and counseling. It became a national model. So I'm committed to this. This is part of my life's work. Joe and I are very specific about what we will do as a start. Ban chokeholds and carotid holds. George Floyd would be alive today if they had been banned. We will create a national policy for a standard for use of force. What's that about? Well, excessive force right now, when it happens, in many jurisdictions, the question to ask is, was that use of force reasonable? Well, as we all know, you could reason away just about anything. The more fair and just question to ask is, was that use of force necessary? Joe and I also have a plan to have a national registry around police officers who have broken the law. Why? Because in many places where there has been excessive force, as an example, because the burden to prove it, see the earlier point I made, is so high, sometimes those cases just go by administrative process. So there's an administrative process and the person gets fired. Well, there's nothing that then follows that person when they move to a different jurisdiction and go get hired there. So we're talking about a national registry. We intend to get rid of the federal death penalty, to decriminalize marijuana and expunge people's records who have been convicted, and to get rid of the private prisons. Why is that important? Because let's be clear about the business model on the private prisons. And this also relates, brother, to the private detention centers. The business model there is that certain human beings are making money off the incarceration of other human beings. Right? So these are some of the specific things that we will do as a start. But there is a lot of work to be done. When I do national news, press conferences, whatever, I say, look, I know, having worked inside the system, we have to reimagine public safety and how we do public safety in our country. Because here's the thing. You go into any upper middle class suburb in America, you will not see the kind of police presence you see in other communities. But what you will see, well-funded public schools, high rates of home ownership, access to capital for small businesses, people who have jobs that allow them to get through the end of the month without worrying about whether they can feed their children, access to health care, including mental health care, that is affordable. Healthy communities are safe communities. And so that's part of what Joe and I am talking about. So when the conversation we had about access to capital, I didn't even get into, I was at Shaw earlier. That was my first trip, my first visit when I came to the state this morning. But I'm a proud graduate of an HBCU, Howard University, yes. I don't have any bison here, not one, huh? But we also are going to put $70 billion into HBCUs, 70. Because we know our HBCUs, like Shaw, and so many, North Carolina has the largest number of HBCU students of any state. We know that that is a pathway to national and international leaders in all the professions. And part of that $70 billion is also about investing, because the question about young leadership, right? Investing in so many of our HBCUs that have research components, right? Because we want to have a presence when we're talking about researching and figuring out how we're going to develop things like AI. You know what AI is? Artificial intelligence. The other way you can think of it is machine learning. Let's break that down for a minute because it's so important. Machine learning. Machine learning, the educators know that often what you learn is a function of who's teaching you. So the machine is going to learn based on who's teaching it. We need to make sure everyone is present in teaching the machine how it makes decisions about who does what and who can do what. Investing in HBCUs around things like research and development, it'll have a profound impact. So these are some of the ways that we think about it that are about the criminal justice system, but it is also about the investment that we need to make in healthy communities. I talked about home ownership. Again, North Carolina, the history of redlining, the history of folks being denied access even when they built up and saved the capital to being able to buy in neighborhoods where they would appreciate the value of their home. We're talking about a $15,000 tax credit, and this is again for young leaders, a $15,000 tax credit for new homeowners to help for down payments and closing costs. Because especially for us, and for most Americans, home ownership is their greatest source of wealth and intergenerational wealth, right? But we need to give people a leg up on being able to actually just close on that place to develop that intergenerational wealth. So those are some of the things. And I appreciate your question.
Thank you.
Thank you.
Thank you so much, Senator Harris. At this time, Lori Jones.
Thank you so much. Thank you so much for coming out to North Carolina again. My question for you is, what resources will be made available for small Black-owned businesses and for startup businesses, especially in the light of challenges faced in the recovery time from the COVID pandemic? Yeah, that's wonderful. So that's about the $150 billion going for low-interest loans as well as for capital for reinvestment. There's also a big part of what we're doing that's about basically helping people start back up. So small businesses, to your point, who have, I've seen numbers that as many as 50% or half of Black-owned businesses during the course of this pandemic have suffered to the point of shutting down. And the concern I have there is to shut down and never to reopen. So there's a big part of the plan that Joe and I have that's about helping people restart. So that's about rehiring and building back up. Also with, here, the White family will probably appreciate this, helping businesses have the capital to restart in a way that they can also get the grant funding to do things like build plexiglass barriers in their businesses, right? To equip their workforce with the PPE centers, because otherwise that's extra money out of their pocket, not to mention what we need to do for our teachers to give them that extra support and our frontline workers. But those kinds of things. In the PPP, which is the Paycheck Protection Program, not to be confused with PPE, which is the personal protective equipment, for the PPP plan, the last numbers I saw, 90% of Black, minority, women-owned businesses did not get the benefit of it, right? So another component of our plan is also about reinforcing and strengthening community banks, right? So CDFIs, the Community Development Financial Institutions. So they have more assets, because what we know is that when our entrepreneurs decide they want to open a business and go get a loan, it's the community bank that will know them, know the culture of the community, and also give the kind of the assistance an entrepreneur needs to run a business. Because if we're just relying on the big banks to do that, that's not going to happen. So that's a component of our plan as well, which is to reinforce and put more resources into the CDFIs, the Community Development Financial Institutions, because they're the ones on the ground, so that our businesses have real access in a way that is culturally competent. So thank you.
Thank you. Thank you so much. Again, Senator Harris, thank you so much for taking the opportunity to answer our questions this afternoon. So for our last question, I'd like to ask Ms. Robin Sanders to give the remaining question for this afternoon.
I'm going to take off my mask. Hi, Senator Harris. My name is Robin Sanders. I'm here with my twin sister, Ashlyn. I'm in my last year of law school right now, and I'll be clerking when I finish, and I will one day run for public office. And I'm honored to vote for you in this election. I'm deeply troubled by the state of our nation, specifically with respect to the law and the criminal justice system, as has been stated here today. There have been ceaseless murders and executions of Black Americans on video. And the most recent travesty in my mind is the Breonna Taylor murder. And my question involves accountability and equal protection, because as I watched Daniel Cameron deliver his press conference, I couldn't help but be disturbed by the perversion of the law. He stated that the Constitution affords equal protection to all citizens, but yet in the same breath urged that Breonna Taylor would not receive justice, even though the law was clearly broken in that case. So my question is, what are the priorities of the Biden-Harris administration to not only demonstrate that there's a real need for policy change, but what about the accountability piece and the equal protection piece? Because Black Americans deserve equal protection under the law and due process. So that's my question.
That's right. That's right. That's right. And you must run for office. Just first get through law school, pass the bar.
Yeah.
And thank you to you and your sister both. So I couldn't agree with you more. Here's how I think and talk about it. There's a phrase that's used often in the criminal justice system, which is there needs to be accountability and consequence. Accountability and consequence. And that phrase is almost entirely and totally and only used in connection with the person arrested, and not in connection with the system itself and the actors and players within the system. And that's part of what is broken and unjust about the system. So to your point on the accountability and consequence piece, if we are going to be true to those words, we just honored the life of Ruth Bader Ginsburg, equal justice under law. She who follows in the path, you know, one of my personal heroes, Thurgood Marshall, equal justice under the law. The fight that we are continually waging, which we will one day win, especially when you become a lawyer. We have to agree that there has been a failure to have equal application of accountability and consequence in the criminal justice system. So that's why, as we were discussing earlier, we have in our plan those things that are going to be about accountability and consequence. On the case of Breonna Taylor, it was a gut punch for all of us to hear that. You know, I've talked to Mika Palmer, her mother, starting months ago and most recently just a couple days ago. You know, and what I said is what we started to talk about, that Breonna Taylor's life, we will never allow other people to measure. We know the measure of her life and the value of her life. But we still have to fight for the system to recognize, as we often and always say, Black Lives Matter. I have said many times in many speeches and many situations, America has yet to value the sanctity of Black life and has yet to treat Black life as fully human. And her case couldn't be a more recent example of that. So accountability and consequence needs to happen. What would we do? So it's everything that I talked about earlier. And as a former attorney general, I was elected as only the second Black woman, I think, in the history of our country to be elected an attorney general of any state. I created, when I was attorney general, I actually implemented pattern and practice investigations of law enforcement agencies. Joe and I have a commitment to doing that, which is that the United States Department of Justice, under our leadership, will have the responsibility for seriously engaging in pattern and practice investigations, putting resources into not only the pattern and practice of discrimination, of excessive force, but also putting resources into the consent decrees, right? So after a court has found that there is a problem, there usually is a responsibility to fix it. But if you're not supervising that, that's called the consent decree, it's likely to not happen. The other thing we're going to do is not only, as has been done in the distant past, which is to have pattern practice investigations of law enforcement agencies, that's going to include prosecutors' offices, because that needs to happen also. In addition, I do believe that in the Breonna Taylor case, there needs to be a civil rights investigation of what they did by the United States Department of Justice. And we're just going to have to keep fighting, and we're going to keep saying her name. But we say her name not just to speak her name, we say her name to motivate action. And that's what's most important.
Wonderful. Thank you so very much, Senator Harris, for coming to the great Tar Heel state of North Carolina And a lot of the issues that we touched today, my grandmother has a saying, real change is hard change, but it's necessary change.
That's right.
And that is the epitome of the campaign that we see. And so we're just so thankful. And we want to turn it over to you for closing remarks.
Thank you. Well, I'm just honored to be with so many leaders. I appreciate the candid and the direct conversation we've had. I hope to have many more. There's so much to get done. There's so much to get done. And we can get it done. I do believe that. But everything that we've talked about and so much more is at stake in this election. I mean, not to mention, the man paid $750. Come on now. On top of all of that, adding insult to injury. But there's so much at stake. And when I think about all of our leaders of every generation, I'm here to ask you for your help. Joe and I need your help. I guess my final point would be about voting. The brother here has his vote 2020 mask on. You know, North Carolina has a specific and a particular history with this issue that has been going on since the ancestors were fighting. Shaw, right? Southern Christian Leadership, all the Student Nonviolent Coordinating Committee, which John Lewis led and shed his blood on that Edmund Pettus Bridge. In fact, that was the last big public event I attended before the pandemic, was to walk across the Edmund Pettus Bridge with John Lewis. So there is the historical piece of this, of all of those who marched and died and shed their blood. There is the piece of it that is about what happened in 2013 when the United States Supreme Court gutted the Voting Rights Act with Shelby v. Holder. And as you in North Carolina know, legislatures then, and in North Carolina's case with surgical precision, passed laws to prevent and to make it difficult for black people to vote. So we've got the reason to vote, which is to honor the ancestors like John Lewis. We've got the reason to vote, which is knowing that there are people who are putting so many powerful obstacles in our way when we have so much at stake. And then here's the other piece that I would just add to close out our thoughts. You got to sit back at some point and ask, why are so many powerful people trying to stand in our way to vote? Like, why? Why are they trying to make it difficult? Why are they trying to confuse people? Why are they trying to suppress the black vote? And here's the answer, I believe. Because they know when we vote, things change. They know when we vote, things get better. And they're scared of that. And so I say, let us not ever let anybody take our power. Not now, not ever. Let us not let anyone stand in the way of the power of our vote. No matter how difficult they are trying, and they are trying. So let's make sure everybody in North Carolina votes early. Early voting starts Thursday, October 15th. Let's let our voices be heard. Yes, in the name of the ancestors. Yes, because there is so much at stake. And yes, because we're not letting anybody messing with our power. Thank you all. Thank you.
Thank you, everyone, for joining us this evening. We're going to take individual photos. So at this time, you will be seated. We'll call you up one by one.
All right, that was All right, you were listening to Senator Kamala Harris speaking in North Carolina at a Get Out the Vote event there with students of historically black colleges and universities, bringing up the Breonna Taylor case and other people who have been, their lives have been cut short by injustice and police violence. And we want to segue over to an event now that's happening in Houston, Texas. This is a Say Their Names traveling memorial honoring Black lives lost to racial injustice, and it's arriving in Houston right now. The mayor of Houston, Sylvester Turner, will be making remarks there in just a couple minutes. As you can see, there's several monuments to people who have been killed due to racial injustice. You can see a lot of familiar names as well. Vanessa Guillen, Botham Jean. We saw Tamir Rice. So we want to bring this to you live once it starts on NewsNOW from Fox. As I said before, the Houston mayor, Sylvester Turner, will be speaking, as well as rapper Trey the Truth. And this traveling exhibit is honoring Black Americans. You'll see there George Floyd and volunteers and people working for this traveling memorial are now just putting bouquets of flowers at each of the installations. We've seen Tamir Rice, the name, Botham Jean, you'll remember, the Dallas case where the police officer in Dallas, Amber Geiger, shot Botham Jean in his apartment. He was only 26 years old. And this memorial will be open to the public starting tomorrow, and it goes through October 13th. And it will be traveling to a number of different cities across the country. The Say Their Names Memorial is a nationwide grassroots initiative, and it features over 200 photos of Black victims whose lives were lost to racial injustice, police brutality, and racism. You'll see all of them there in the live picture. It's already been put up in over 25 cities nationwide, and it was started in Portland, Oregon. You'll see there Ahmaud Arbery, who was killed in February in Georgia. The group shares photos and information with individuals and communities who want to create memorials in their own neighborhoods. And like I said, it was started in Portland, Oregon on June 19th of this year. So we'll bring that to you live once we have it. However, we want to go back out to the COVID update we got earlier from Governor Phil Murphy in New Jersey. Let's listen to that.
Because of the amount of storm damage, the state had to open 13 temporary debris management sites. In particular, we're requesting a major disaster declaration for the following counties: Atlantic, Bergen, Burlington, Cape May, Cumberland, Essex, Gloucester, Monmouth, Morris, Salem, and Sussex counties. Storm damages in these counties range from $3.87 per capita, and that's in Sussex County, to $32.42 per capita in Salem County. Both of those far exceed the baseline mark of $1.53 per capita to qualify for assistance. Cumberland, Gloucester, and Monmouth counties each also exceeded $10 in damage per capita. The statewide per capita impact of Tropical Storm Isaias was $3.89, We are hopeful for the swift consideration of our request. I want to thank the guy to my left, Colonel Pat Callahan, and the team from the Office of Emergency Management under the leadership of Executive Officer Captain Scott Polton for pulling our request together and getting it within FEMA's timeframe. Next, switching gears again. Earlier today, I was honored to join with legislative sponsors and advocates virtually to sign a new state law permanently exempting military combat pay from state income taxes. That's Senator Mike Tester on the upper left, General Jamal Beal on the upper right, and Assemblywoman Annette Quijano on the lower right. And both the senator and the Assemblywoman were two of the bipartisan group of sponsors. To say this is long overdue does not serve this point justice, this measure. We are the last, I think this is shameful, we're the last American state to have done this. One or two, to be 50, just jaw-dropping. But this is a long overdue measure for our active duty military women and men who literally put themselves in harm's way in service to our nation. And this is, at long last, a statement of our New Jersey values, values that honor service to our nation and to our fellow New Jerseyans. And this new law is a worthy complement to our ongoing efforts to ensure that the service of our military men and women is properly honored once their days in uniform are over, whether that be in providing educational and job training opportunities, in health care and housing, or any of the services they and their families need. So to every New Jerseyan who wears our nation's military uniforms, thank you for your service. And we also thank every single one of our veterans. With that, let's move on and take a look at the overnight numbers. We're reporting today an additional 561 positive test results for a new statewide cumulative total of 204,107. As Judy will remind us in a few minutes, the numbers over the weekend were also quite high. We continue to see the statewide number driven in large part, not completely, but in large part by significant new cases coming out of Ocean County. 242, for instance, of the 561 today, about 40%. And that's today's number, and we're maintaining our lines of communication with county and community leaders as we work together to mitigate these outbreaks. Now, by contrast, there were also 54 cases reported today from Middlesex County. That was number 2. But all other counties were 35 new cases or fewer, and that's a good thing. For all tests recorded on Thursday, September 24, the positivity rate was 2.48%. Statewide rate of transmission is currently down a hair. It's, I guess, bouncing around in the same neighborhood, 1.12. In our hospitals as of last night, 236 confirmed COVID positive patients, 185 persons under investigation, awaiting test results. The total is 421. Of these, 91 were in intensive care, 39 ventilators were in use, and sadly, we are reporting one additional death, bringing the total of confirmed deaths to 14,316. The number of probable deaths remains at 1,791. And again, at the risk of comparing apples to oranges, Judy, I've got 16 deaths reported in our hospitals yesterday. Again, those are not part of the confirmed numbers. Now, as we do every day, let's remember 3 more who this pandemic has taken away from our extraordinary New Jersey family. We begin in Fort Lee, the home of Francesca Porco, who was a recognizable face in Fort Lee High School's cafeteria as one of the dedicated food service workers. She was 72 years old. That she loved her job would not be a surprise to anyone who knew her, as Francesca always made sure her family and friends were welcomed with open arms and very often with a good meal. She loved giving back and she loved helping others, and she was loved by the students she served and the colleagues she worked alongside. Francesca had an abiding passion for gardening, and the tomatoes she grew were often the basis for those home-cooked meals she so willingly served to family and friends. Alongside them were the roses that she tended to, and after her passing, her family noted that they hoped Francesca found a place in heaven where she can prune and pick roses and grow tomatoes. She'll also be remembered for her tremendous talent for dancing and how she and her husband, Antonio, could basically clear any dance floor as others would watch them with awe. So Francesca leaves behind her husband, Antonio, and their sons, Guzzo and Dominic. And I had the great honor of speaking with Dominic on Saturday morning. She's also survived by her brothers, Giovanni and Pietro, both of whom live in Italy, and numerous nieces and nephews, both here in New Jersey as well as in Italy. We certainly hope Francesca has found that special place in heaven. May God bless and watch over her and her loved ones. Next, we remember on the left, Yvette Elizalde. I want to make sure I get that right. Elizalde of Fairview in Bergen County. Yvette was a native of Union City, raised by a mother who was a Colombian immigrant and a father who hailed from Puerto Rico. Yvette, by the way, was only 47 years old. She earned her degree in speech pathology and audiology from St. John's University, and for the past 2 decades was an educator at Union City's Robert Waters School, where she had garnered Teacher of the Year honors. In every aspect of her career, she stood out, whether it be from her quick wit, the relationship she built with her colleagues, or with the easygoing nature that allowed her to garner enormous trust from her 4th grade students. But it was a love of family that set Yvette apart. Her father passed away several years ago, and Yvette would take time after work every day to visit her mother, who lived only a few blocks from the Robert Waters School. At home in Fairview, she was dedicated to her husband of 18 years, Juan, and that's Juan on the right. I had the great honor of speaking with him on Friday. They met in college, and she was devoted to that guy in the middle, her 10-year-old son, Nicholas, often helping him with his homework, and when school was out, taking him to the pool in North Bergen. She leaves them all behind, along with so many family, friends, and colleagues, and of course, her beloved students. We thank Yvette for her years of service to the children of Union City and for her devotion to her family. May God bless and watch over her and her loved ones. And finally, for today, we recall Don Batayola of Springfield. Don, you'd think Don was a proud American? God bless that guy. Don was born in the Philippines and came to New Jersey 13 years ago to pursue opportunities in the healthcare field. Don was an occupational therapist at South Mountain Healthcare and Rehabilitation Center in Union Township. He passed away the day that he and his wife, Nina, were to leave on a vacation to Europe. Don and Nina spoke at least once a day while he was being treated, and she was self-quarantined. His passing was sudden and unexpected. That vacation, had it happened, wouldn't have caught anyone by surprise. Don loved to travel, whether a getaway with Nina or a whole family vacation with their 11-year-old child Zoe and 9-year-old guy Zeth. Don was also once able to merge his love of travel with his love of reggae music, taking a trip to Jamaica to visit the birthplace of Bob Marley. Don was only 40 years old, so 2 of our 3 fatalities today, 47 and 40 years old, and I asked his wife Nina, with whom I had the great honor of speaking on Friday, did he have underlying health issues or conditions? And she said no, he was in very good health. So he leaves Nina behind, Zoe and Zeth, along with numerous other family members across the country, several of whom, by the way, also work in healthcare. Our hearts go out to them all. We thank Don for choosing to make New Jersey and the United States of America the home for his family, and may God bless and watch over him and his family. So Francesca, Yvette, and Don reflect the tremendous diversity of our state, and they show how indiscriminate and cruel this virus is. Their memories and the pain felt by those left behind should be what spurs us to fighting against this pandemic. We are not out of the woods yet, and the numbers we've been seeing the past week or so, Judy, at this point, bear that out. We are all experiencing some level of understandable fatigue. That's only natural after the past nearly 7 months, but now is the time we have to dig deep and find some added resolve. So please remember, wash your hands, wear your masks, keep a social distance, stay away if you don't feel well, get tested. We cannot let up. Now, finally, for today, let's meet another of the entrepreneurs who's partnered with the New Jersey Economic Development Authority to help set the foundation for the stronger, fairer, and more resilient New Jersey we know will emerge from this pandemic. This is Jim Schatzel, president of Team Life, a Colts Neck-based company. By the way, I think he said he founded it 26 years ago, that not only markets and provides automated external defibrillators, but also leads training sessions for healthcare professionals, emergency workers, and everyday residents in CPR and AED use. Team Life sprang from Jim's own 30-plus years of experience as an EMT and paramedic. And because of the training that he and his team provide, countless New Jerseyans have learned valuable life-saving skills. To keep Team Life strong and ready to continue its mission, Jim worked with the EDA to receive both an emergency assistance loan and a grant that has allowed him to pay his business expenses. I had the opportunity to check in with Jim on Friday. Among other things, I realized and learned that he was the brother of a dear family friend, Cindy Westendorf, so shout out to Cindy as well. And I thanked him for all that Team Life is doing to help others. Check them out. They're at teamlife.com, teamlife.com. And I once again encourage all small business owners to go to that website, njeda.com, to see what programs may be available to help your business. And that's as good a place as any for us to wrap up for the day. Please, with no further ado, help me welcome the Commissioner of the Department of Health, the woman who needs no introduction, Judy Persichelli.
Thank you, Governor, and good afternoon. In the past 6 days, we have reported about 3,660 cases, new cases, and 28% of those new cases are in Ocean County. In response to this level of new cases, our hotspot team has increased the testing capacity in all sites in the county, and tomorrow, 20 contact tracers will be deployed to support case investigation. Our goal with this increased testing and contact tracing capacity is to contain the transmission of the virus in that county. Also, we continue to monitor cases closely to identify other areas of the state that may be experiencing an uptick. As part of the overall CDC surveillance, the agency has been working to estimate the percentage of those in the United States with COVID-19 antibodies. They have collected lab results from every state and the District of Columbia and Puerto Rico. In the first round, the testing of samples took place between July 9th and August 12th. New Jersey reports the second highest seroprevalence at 14.7%, New York being the highest. According to the CDC, estimates were highest among children and younger adults from the ages of 18 to 49, and lowest in the 65-plus age group. The finding of the data is limited because we don't know if it is truly representative of the state. However, it is unknown whether the samples come from an area of the state with high or low prevalence of COVID-19 cases. At this time, there is still a lot we do not know about serology. Since this is a new virus, we don't know if a person who is exposed is immune to future exposures of SARS-CoV-2. But these tests are valuable for epidemiology and research studies. What we also do not know specifically is false positive results may occur with any serologic test if a person has previously been exposed to, for example, a seasonal coronavirus, which circulate yearly in the United States and cause mild cold symptoms. We do know that a seroprevalence of 15% is not sufficient for community protection, also talked as herd immunity, but what we really talk about is community protection. CDC plans on doing additional rounds of data sampling in the coming weeks. They plan to post this data on their website. I would like to give you some further information about the Abbott by NewsNOW test. It is an FDA-approved point-of-care antigen test for COVID-19. No equipment is required. The sample is collected via a nasal swab and run on a card that uses what they call lateral flow technology. It has a 97.1% sensitivity and a 98.5% specificity. That was from a clinical trial of 102 individuals. Results are delivered in 15 minutes. And although the federal government is sending us the tests for free, the actual cost of the Abbott test is about $5. Moving on to my daily report, as the governor shared, our hospitals reported 421 hospitalizations, 91 individuals in critical care, which is slightly up, and 43% of those are on patients are on ventilators. We are reporting one new case of multisystem inflammatory syndrome in children. So there are now 58 cases in our state. The children affected have either tested positive for active COVID-19 infection or have antibody tests that are positive to a COVID-19 exposure. In New Jersey, there are no deaths reported at this time. The ages of the children affected range from 1 to 18. None of these children are currently hospitalized. The breakdown of race and ethnicity of these cases is white 17%, black 35%, Hispanic 39%, Asian 6%, and other 4%. The governor reviewed the new cases and deaths in terms of race and ethnicity of the mortalities. White is 54.1%, black 18.3%, Hispanic 20.3%, Asian 5.5%, and other 1.9%. At the state veterans' homes, one resident at the Vineland facility has tested positive, bringing the total cases among patients to 390. There are no new deaths. At our state psychiatric hospitals, the numbers remain the same. New Jersey reports an overall positivity as of September 24th of 2.48%. Northern part of the state reports 1.62%. The central part of the state, which includes Ocean and Monmouth, report 3.70%, and the southern part of the state reports 2.58%. That concludes my daily update. Please stay safe, wear your mask, wash your hands frequently, socially distance, and remember for each other, for us all. Please take the call.
Judy, thank you. You made I'd love to go back to the CDC.
All right, we want to just pause on this COVID update out of New Jersey from Governor Phil Murphy there and go over to what we previewed for you just a couple minutes ago out of this event in Houston, Texas, where they'll be holding an event called the Say Your Names Memorial, where they'll be remembering the legacies of people who have died at the hands of racial injustice in the country. Houston Mayor Sylvester Turner will be speaking, along with Representative Sheila Jackson Lee of Texas.
I always ask, why do we continue to say their names? The thing is, you have to think, man, after the social media wave or the regular media wave go away in a week or 2 weeks, they still gonna be hurting, and they still need people to stand up and fight for them or show that they care. And I feel with what we're doing with things like this, we'll be able to spark a whole new wave of helping people understand why we say their names across the world. So everybody know I hate talking. That's not what I'm here to do. But I definitely wanted to appreciate everybody that came out, because this is the launch of it. I feel this is something that's going to be historical for the city. And right now I'm about to kick it off and introduce quite a few important people, man. One thing I do want to point out is we definitely stand in solidarity with anybody who's a victim of injustice, man. And that's why I felt it was real powerful for us to have a podium, especially for some of our hometown people, George Floyd and Vanessa Guillen, you know. So this is going to be an amazing day, man. I appreciate y'all coming out. I want to bring up the actual one of the founders with Joy. I want to bring Emily up here so she can explain a little bit about it. And then from there, we're going to bring in a few more guests and After that, we're going to open it up to the public so we all can be a part of this. Emily, you want to come up here?
Hello. Thank you guys so much. I know I speak for myself and Joy, the founder of Say Their Names, that we are so grateful to be here in Houston. Thank you, Trey, for making that possible. Trey's an amazing man. He just reached out one day and said, let's do this, let's make this happen. So really grateful to be here. The memorial honors Black lives taken by systemic racism and racial injustice. It started as a grassroots initiative in Portland, Oregon, and has been put in more than 25 locations nationwide. Joy is standing next to me. She is the founder and leader and brilliant innovator to create something with this much meaning. She manages the only database of its kind with lives taken by racial injustice. The database is not complete, and we need your help. Please help us and submit names that are missing and stories that we do not yet know. You can do that on the website. Our goal in the next 6 months is to make this database searchable and complete with bios and other information. We are also hoping to do a nationwide tour of the memorial starting next year. If you have a name, if you're interested, if you want to submit a story, please reach out. We're here to listen, we're here to learn and grow together. Thank you.
Hello, everyone. I am Deronica Horn. I am here to represent the Say Their Names Memorial, which is found at saytheirnamesmemorial.com. Thank you, Trey, for bringing this to Houston. Thank you, Joy. Thank you, Emily, for being such a great help to bring this for Trey. Before we go on, I'd like to thank the City of Houston and everyone and all of their help for allowing us to do this with such short notice. Without further ado, I'd like to introduce our mayor, Mr. Sylvester Turner.
Thanks, Veronica and Joy, Emily. Let me just say it's good to see everyone out here today. And I want to start off by really acknowledging Trey the Truth. This brother has just stepped up time and time and time again. He was the one who reached out, wanted to bring this memorial to the city of Houston, called, said, Mayor, want this to happen, and it has happened. And I can't say enough for Trey the Truth, who's been from Lake Charles to Louisville, back here so many times. I know he is not asking for it, but please give it up to Trey the Truth. Love this brother. Thank you, man. To Emily and Joy, thank you all so very, very much. To all of the family members that are here, let me just say to you that our hearts and our prayers, our thoughts continue to go out to you. And it's just so important to be here for this local debut of the National Say Their Names Memorial Exhibit. And then we are right here in Emancipation Park, which I think is quite fitting, park that came into existence in 1872 by Pastor Jack Yates and a few others. There's so much embedded in this park, and now to have this memorial, Say Their Names Memorial exhibit right here in this park, it's very powerful in and of itself. It is a commemorative display paying tribute to Black Americans whose lives have been lost due to social and racial injustice. And today, I'm joined by Congresswoman Sheila Jackson Lee, of course, Ramon Manning, a board chair of the Emancipation Park Conservancy, Emily Clark, Dallas exhibit organizers, Deronica Horn, the Houston exhibit organizers, State Representative Ron Reynolds. I see my council member that's right here, Edward Pollard, that's also present as well, and Representative from Commissioner Rodney Ellis, who's also here. As the mayor of Houston and a person of color, you know, there's so many strong emotions that are evoked by this display of over 200 photos of people. And I want to say they're not just photos, they represent persons, they represent families who are no longer, in a sense, physically with us. But let me tell you, you simply cannot take that walk without feeling their spirit. And in so many ways, they're very much alive. For the next 15 days, Emancipation Park will be a place of healing and reflection that will commemorate the lives of those who were taken away from us too soon. It will also serve to inspire all of us to do even more, to do everything that we can, such that that memorial, that number, other than those lives that have already been lost, that memorial won't continue to grow. It's featuring over 200 photos of black men and women, victims whose lives were lost to racial injustice, police brutality, and racism. And this memorial opens our eyes and hearts to the realities and struggles people of color face every day and allow us to have a conversation about peaceful social reform. The exhibit was started in Portland, Oregon on Juneteenth, 2020 by the Say Their Names Memorial, a nationwide grassroots initiative. And the group shares photos and information with individuals and communities who want to create memorials. It has been displayed in over 25 locations nationwide. And thanks to Trader Truth, it is right here. And I want to underscore something that Trader Truth said, that in this memorial, you do have George Floyd and you do have Vanessa Guillen, which also represents that irrespective of color, when you are the victims of racial and social injustice, we are all connected. And so I want to thank him again. I also want to thank Ramon Manning, the board chairman of Emancipation Park Conservancy, for giving this exhibit a home. And there is no place more appropriate for this exhibit than Emancipation Park. The park is a Houston gem that serves as a monument to the pride and hope of the founding members of the Colored People Festival and Emancipation Park Association. And I also want to recognize Emily Clark and Veronica Horn for their hard work in organizing this effort. And we must continue to amplify the events surrounding any loss of life of a person due to social injustice. As you walk the memorial, something that resonated in my mind over and over again, and that is, unless we stand up, unless we do more, that memorial will continue to grow. But we cannot forget, we say their names because we do not want to forget the lives that have been lost because of racial and social injustice. And it's my prayer that in this city, we'll work every single day to get it right. Thank you.
My program says next that I'm going to introduce Trader Truth. Would you speak? Okay. I just want to make sure. Okay. And now I'm going to introduce the board chairman of the Emancipation Park Conservancy, which is Ramon Manning, who took my call at the last minute and answered when I asked, could we have a home here for this memorial. So I appreciate you, Ramon, publicly for taking our call and allowing us to have it here. Without further ado, Mr. Ramon Manning. Thank you.
Thank you, Deronica. As Deronica mentioned, just to give you guys some historical context, a couple Saturdays ago, I'm at home with my family, and Deronica and Trey called me on three-way. And as I began to listen and hear about this memorial, it became blatantly apparent to me that it had to be at Emancipation Park. And at this time, I just want to recognize Steve Wright, Houston Parks and Rec Director. I want to recognize the mayor. I want to recognize Susan Christian at the Mayor's Office of Special Events. I also want to recognize Steve Williams from the City of Houston's Health Department. You know, he was very involved to make this thing happen. And just to give you guys a little bit more context, this is the first event at any public park since the pandemic. So this tells you how important this is to this city and to this mayor. You know, as everyone knows, Emancipation Park was founded in 1872 by former slaves. We are on sacred ground. And I just thought it was fitting, with the help of my board, that we have a sacred memorial here. And, you know, everybody has been at home since this pandemic. Everyone has been reading more, you know, watching more TV, consuming more. And I just want to tell you, this has personally been weighing on me, because everyone knows that these lives matter. But one thing people aren't talking about is the value of these lives. I had a relative tell me about your top peak earning years are in your 40s and in your 50s. Many of you who know me know that I'm a numbers guy. So I like to deal with numbers and I like to deal with facts. Those lives in that memorial, over 230 of them, the average age of those lives was 44 to 45 years old. So I want to talk to you a little bit about value for a second. Think about what we missed out on, what contribution those people could have made to this country, to their respective cities, to their respective communities. Think about that for a second. The average age was 44 years old. Your peak earning years are in your 40s and in your 50s. We could have had artists, engineers, lawyers. We don't know. We're at a crossroad in this country. We can either go right or we can go left. I'm bullish on Houston because I'm a native Houstonian. I think we can lead the way. But ladies and gentlemen, this has to stop. It has to stop. It's happening too much. And I think all of us recognize that we need to do some self-inventory and figure out what we can contribute to. I had some prepared remarks. I'm sorry I went a little off script, but I'm hurting right now. That could have been me. Could have been one of my family members. So my ask is that you tell all your friends, all your family members to come take a look at this memorial. Emily, Trey, Deronica, thank you so much for that phone call. I mean that from the bottom of my heart. Thank you. And I want to close with this. Justice will not be served until those who are unaffected are as outraged as those who are. Have a good day.
Okay, next we have Attorney Lee Merritt coming to the podium. You all will welcome him, please. Thank you.
I'm going to ask you all to repeat something after me. It says, Ashe. Ashe. Ashe is a part of a ritual that I learned as a West African tradition called a libation. In order to successfully perform a libation, I need water. And it turns out that I couldn't run into any water on my way to the stage. Does anyone have a bottle of water I can borrow? Thank you. It's very important. I want to take a second to do this ceremony the right way. A libation because, thank you, brother. I said initially it was a West African tradition, but when I looked it up to be sure that I was historically accurate. There's not a culture on the planet Earth that doesn't have a libation ceremony. Every culture in world history is found to have some form of a libation ceremony. And it's simply a remembering and invoking of the names of the ancestors. And as tragic as many of these deaths are that are surrounding us, they also represent our ancestors. They represented powerful, powerful individuals. Some of them you know. Malcolm X is there, Patrice Lumumba, Bantu Stephen Biko, leaders of past. Some of them you've never heard of. I'm looking at this brother here to my right. His name is Jamel Roberson. And I'll show you how a libation works as I tell you about Jamel Roberson. When I say Jamel Roberson, you all say Ashe. I'm going to pour a little water on the ground. It's a pouring out of a drink to the ground where our ancestors are. My faith belief system says to be absent from the body is to be present with the Lord, but that we won't be present with the Lord until the day of judgment. So that means when I pour out water on the ground, I'm invoking the spirits of my ancestors that remain, as Mayor Turner explained to us a moment ago. So I say the name Jamel Roberson, you say? Jamel Roberson. Now, Jamel Roberson was from Chicago. How many of you all ever heard of Jamel? Jamel was a hero. He's a national hero. At a time that our country was moving from one mass shooting to another, there was Tree of Life, a mass shooting that occurred in Pennsylvania about hate. And less than a week after Tree of Life, there was Sherman Oaks. And I believe a dozen people lost their lives to that shooting. And within a few days, someone entered a small club in Robbins, Illinois. It was the after spot where all the clubs led out to. But it was too small for the crowd that it had, and things got to fisticuffs, and someone went to the car to get the long gun, and they began indiscriminately shooting at the crowd. Jamel sprung into action, knocking the person to the ground, disarming them, and holding them until police arrived. And when police arrived, they shot him in his back 4 times, killing him. When I say Jamel Roberson, you say Ashe. Jamel Roberson. I see my friend Michael Dean here. He's from Central Texas. Here on this podium to my right is Michael Dean. Michael Dean went out for his daughter's 6th birthday to get her a birthday cake. He was unarmed. He was by himself. He got the lights behind him. And Temple, Texas is known to be sort of a sundown city. You don't stop in the dark on a dark road. So he drove to a well-lit area. The police were annoyed with how long he took to stop. And so he pulled out his gun, and he claims, Officer De La Cruz claims, that his gun accidentally went off and he shot Michael Dean in the face, killing him. His crime was not stopping soon enough. When I say Michael Dean, you say Ashe. Michael Dean. I have one young man here whose work ethic has been a source of constant inspiration for me. I swear I tend to believe I'm haunted sometimes, but Botham Jean wakes me up out of my sleep and makes me get back to work. Botham Jean was on the partnership track for the #1 accounting firm in the country, PricewaterhouseCoopers. He had the Google account, if that means anything to you. He was a native of St. Lucia. He graduated at the top or near the top of his class, taking home the highest GPA award for his class group. He studied here. He came to the States to study, and he took a job in Dallas, Texas. One day he went home to eat a bowl of ice cream after coming from getting out of work early. He called his family and let them know that although he had just had his teeth removed and it was painful, but the doctors had just cleared him to eat a bowl of ice cream. And as he sat down eating a bowl of ice cream, a police officer burst through his door and shot him in his heart. Her name was Amber Geiger. His name was Botham Jean. And when I say Botham Jean, you say Ashe. The reason I feel like this memorial is so important, and I too was sort of deviating from my script. Unless you see it, unless you're forced to confront those faces and those energies, you can forget that we live in the deadliest police culture in the modern world, that no other nation kills or incarcerates more of its citizens, period. I'm taken back as I approach this stage with the mother of Botham Jean, the energy that comes from here. And it's your power, But the truth is, when we talk about powerful people like Jamel Roberson and Michael Dean and Botham Jean, their power doesn't simply disappear upon their death. Any person who studies science can tell you that energy cannot be destroyed. It only changes forms and it's transferred. So when these powerful individuals that you see around you left this earth, their power remained. Their power went back to the source. And I'm encouraging you all to tap into the source because it is your power and it is black power. Ashe.
Earlier, I made a mistake after I introduced the mayor, and I overstepped and introduced Trey, knowing that he didn't want to speak. And then I moved on to Ramon without acknowledging Congresswoman Sheila Jackson Lee, who is here with us today. So, Congresswoman, I apologize. Would you come, please?
Thank you, Derica. Deronica, thank you. I'm going to, out of a sense I've never do this publicly, but out of the honor of this place, remove this just for a moment to be able to acknowledge the spirits of those who are in this Say Their Name display. Thank you, Mayor, for governing a city that is a city that welcomes people from whatever condition they're in and gives them dignity. Thank you to law enforcement that you have offered as symbols of what justice should be. And Chief Acevedo and Chief Finner are here, and we thank them for their presence. To Council Member, we thank you, and State Representative Commissioner Ellis's office, we thank you for your leadership as well. When I think of Trey the Truth and gathered here with all of us, Lee, you took us to the level of our spirits. Trey the Truth may be wearing a red suit. I know it symbolizes much, but for me it symbolizes a heart that is too large to contain. He is the silent giant that comes when people are in pain and comes not empty-handed, but with solutions and embrace. He was there in Minneapolis. When I got there, they said Trey the Truth had been there and had given to them and their spirits. He was there with Breonna's family, and he was larger than life, but he brought a sense of resolution and action. We are grateful that we can call him our citizen of Houston, but we are also grateful for what he does for the nation. And I think he is owed a debt of gratitude, and if nothing else, we wave our hand or give our applause for Trey the Truth, because he is deserving. To Ramon Manning, to all of the parks leaders, thank you to the Kinders, who I know are here, Mr. and Mrs. Kinder, who have given. Thank you to the Conservatory for the work that you have done in a place like this, and to the families that are here. May I just do this to each and every one. To this family of George Floyd, Big Floyd, and by the way, you are in George Floyd's neighborhood. Everybody needs to take a bow. You're in George Floyd's 3rd Ward neighborhood, CUNY Homes and Jack Yates. We are grateful for their spirit, grateful for Cesar Espinoza. He'd worked so hard for Vanessa Guillen, and I am so grateful that, not because she has lost her life, but that they are all included. And let me thank our beloved brother's family, Mom and Dad, who have come here. I am grateful for them, but I am not grateful for the reason that they're here. So I want to just take a moment to speak of them, to speak of families, for you to know what this really means as we walked and took this walk. When we say the name, it is not the name. It is the pain. First of all, it is the bloodshed of which they died. It is the families that have to identify bodies. It is the families that would wonder why. It is the families that have to mourn and have to be able to face this on a daily basis. We are overwhelmed with pain, but what is the pain that they experience? Why couldn't Brother Botham be able to eat ice cream in his home? Why can't Brianna sleep in her bed? Why can't George go to a local store? Why can't those who are trying to see their daughter get home to see their daughter's birthday party? What is it about a young boy by the name of Emmett Till was down for a summer with his grandparents in Mississippi? And so tonight, and as you look at this, please be reminded that you're saying their name. You're honoring them by the fact that they deserve dignity and deserve to live. But please be reminded that you are dealing with as well their families and the pain that their family is struggling with. Frederick Douglass said, "There is no power without struggle." I want the struggle to be able to say that people live and not die. Let people live and not die. That is what we do today. The brother's expressing his First Amendment rights. Let him do so, but we humble before you because I wish you were not here. We love you, we struggle with you, and we'll fight for you. Thank you all very much. Remember the families. We must struggle to get power.
Hey, Marcus, chill out. Marcus, chill out, man.
As Congresswoman just mentioned, we have the parents of Botham here, and I'd like to bring her up if you'd like to speak. If you all give her a round of applause. This mother has a child here.
Good afternoon, everyone. September 6th, 2018 changed my life. That was the day when my son Botham was taken away by a Dallas police officer who was so disappointed that she didn't have a date with her adulterous partner that she went to my son's apartment, mistaking it to be hers. And in a fit of rage, she shot him right down his heart. Botham never deserved to die in that way. We are still trying, after 2 years, to come to grips with the pain and the grief of his loss. As the days go by, and I really thought that time, as everybody says, is a great healer. In this case, time for me makes it harder because every day that goes by, I long to hear him, I long to hug him, and I long to hold him. But that's not to be. So when you say the name of Botham Jean, I want you to remember that he was an innocent man sitting in the comfort of his living room, in his sanctuary, happy that he was about to watch the first game of football. Happy that he was just given the go-ahead to eat ice cream after having his wisdom teeth pulled. Happy that he had all his dreams and aspirations, and they were shattered by a police officer. When I hear of the work of Joy and her team having to create a database on persons who have been killed at the hands of police or persons who believe that they have more privilege than we do, I think that we all should be looking to put Joy out of business. Because Joy should not have to add another name to her database. Joy should start looking for another hobby. Because every other name means a family of pain, of grief. I cannot deal with it anymore. I come from the island of St. Lucia, and my husband and I flew in here only yesterday. And since we didn't get to see the memorial in Dallas, we came down to Houston today to view it, and I'm really happy that we did. But I'm in touch with every single thing that happens in the United States. And when I heard of Ahmaud Arbery, then Breonna Taylor, then George Floyd, folks, I stopped counting. I can no longer count. I can no longer use more hashtags. I can no longer bear the pain of another black man or woman taken at the hands of police or those who believe that their privilege is more than ours. And although I cannot vote in the United States of America to change what is happening here, I am calling on each and every one of you to do what is right. And in November, you know what to do to stop Joy from keeping her hobby or keeping her job of adding names to that database. I want to thank everybody who has been involved in this memorial. As you say their name, think of the pain that families go through. As you say their name, think of your own kids and think of you and think of what it is to be living black in America. Thank you.
And next we have Cesar Espinosa, who's here on the behalf of Vanessa Guillen and her family. Cesar.
Hello, everybody. Thank you for being here. I'm going to say something in Spanish first because I think it's important that my community also understands why we're here. Mi nombre es César Espinosa y soy director ejecutivo de Fiel. Hoy nos enorgullece estar aquí porque es importante que apoyemos el movimiento de Black Lives Matter, porque es importante que todos sepamos que cuando una comunidad enfrenta injusticia, todos enfrentamos injusticia. Queremos agradecer a Trade the Truth por seguir apoyando a la familia Guillén durante todos estos meses para asegurar que haya justicia para ellos y para nuestra comunidad. Y cuando Trey habla, él no habla de raza, no habla de nada, sino que él dice, quiero estar ahí para ayudar. So I'm going to translate that for you because I know I was looking at you when I was saying that. My name is Cesar Espinosa, and I'm Executive Director of Fiel. We are proud to be here today. We are happy to be here, but at the same time saddened that we have to be here. We want to thank Trey for continuing to support the Vanessa Guillen family because Trey doesn't see color when he calls. Trey doesn't see socioeconomic status when he calls. He just wants to make sure that we see justice that we deserve for our communities. So it is important for us to be here because in the Latino immigrant community, we have to recognize and give honor to the movement of Black Lives Matter. I'm going to speak some truth here. In the Latino community, there's sometimes some anti-Black sentiment, and we're having those important conversations that we need to have right now so that we realize that as communities, we have more in common than we do differences. So we were proud to stand with the mayor, with Congresswoman Sheila Jackson Lee, with Trade the Truth, and with all the families who have been impacted by this. And we want to give a thanks on behalf of the Vanessa Guillen family for Houston's continued support, because she was one of us. When Cesar Chavez used to organize Filipino workers in the fields, he would say, if they come for one of us, they come for all of us. So in that same spirit, we stand here today and we say to the Houston community that if they come for one of us, they come for all of us. And we stand in solidarity. And thank you so much, Trey, for continuing your work and for continuing to support the Guillen family.
And finally, we have the family of George Floyd. We are in 3rd Ward, Texas, in Emancipation Park. We're going to give them a big round of applause.
How you doing? My name is Cal Wayne, Floyd's next door neighbor, with George Floyd's brother. They asked me to speak, and I'm honored, you know what I'm saying, because they was also my brother, but also my mentor, and I understand. And I thank y'all for letting me speak on behalf of him. And Miss Sissy, his mother took me and my brother in, my deceased brother in when we were young, you know what I'm saying, and raised us like our own HIJ. You know what I'm saying? She raised us, Floyd's sister, and, you know, so I learned a lot from him. But this is what I want to say. First, I want to thank y'all for y'all supports, y'all prayers, and most importantly, we want to thank y'all for not letting our brother die in vain. I say most people don't know this, but Floyd was very deserving of this love. You know, certain people, they have like, I talked to somebody, he said, you know what, Wayne, this is what Floyd was sent here for. You know, so everybody have a mission when they come here. And if you ever knew Floyd, like I say, despite anything that you ever heard, he actually was deserving of this. Like, he was larger than life, his personality and everything. Like I say, they asked me how I felt about it. I said, it's kind of like Jesus. I say, he died for us to be able to live, all right? And my son, my 10-year-old son, he asked me, he say, why did they kill Uncle Floyd? It took me a while to explain it to him. At the end, I said it was just a reminder that we still got a long ways to go. And it helped us understand the Martins, the Malcolms, the Fred Hamptons, and everybody else that laid down their lives for the simple things that we take for granted. Like even the luxury of being treated like a human being. Said it's bigger than marching, it's bigger than saying their names. This is like the awakening. And then I asked, I say, what are the benefits of racism? What are the benefits of having a biased view against another race? It's like it don't benefit you nothing. I don't care if you're another color, you know what I'm saying? It don't matter. You know, and that's how Floyd was, you know what I'm saying? I've been in all kinds of situations with Floyd, and he never, them type of things didn't matter. So like I say, it's bigger than even Floyd now. Like we see all the faces out here, all of those people, all the people led or they contributed to the awakening. You know what I'm saying? Of people, cause like I say, a lot of us are not really as conscious, like they understand, but they don't really get it. But I think this kind of helped them grasp what was going on. This situation is the crocodile in the mud. Every animal got to go to the water and drink one day. It might be seconds, minutes, days, weeks, years, but one day every animal got to go to that water and drink. And when you do, the crocodile gonna bite and the whole world gonna hear the scream. You know what I'm saying? That's what happened. The whole world heard the scream. I say these deaths, are the mirror effect for the oppressors of whatever nature, whether it be police, government, or any powers that be. So thank you once again, big bro, for being that vessel. I thank you, Floyd, for being that vessel. Every time I see the commercials and I smile and I picture what Floyd be saying, I say, and Floyd, you know, Jaja, he'll be saying, all this behind me, like all this behind me, but yeah, all this behind you, because he deserved it. He deserved it. Everybody that know him know. We call him 3rd Ward Floyd. Like I say, he was large in life. He always said, I'm gonna do something big. So I said, man, I know you're up there with Miss Sissy right now. Thank you, Miss Sissy, too, for taking me and my brother in. You know what I'm saying? I know she hugging him strong right now, you know what I'm saying? And she's saying, baby, you did it. You know what I'm saying? I'm just hoping that now everybody continues to keep going. Like I say, this is just a reminder. Now we know why those people marched. Now we understand it, because it can be so far in the past to where we feel like it don't affect us. But like I say, it still happens today. So say we can only pray we have an impact on life like that, man. Thank y'all for accepting the situation. Thank y'all for standing up all over the world. Thank y'all, man. Every time I see a George Floyd mural, I just be like, man, Like, you know what I'm saying? 'Cause if you knew him, it's different, man. I thank y'all, man. I thank the family. You know what I'm saying? Everybody, man, like I say, we grew up as brothers in the same household, man. Thank y'all.
How y'all doing? Thank y'all for coming out to Trey World. You know, we got Trey right here. My big bro Floyd actually had a screw tape called Trey World. And just to share something with y'all, Floyd was 6'6" tall stature. You know, he loved working out. That was his hobby. You know, he takes his stress out in the gym. If you knew Floyd, you see his videos online right now. They always see he loves the gym, love positive messages. You know, no matter what goes on, you know, local community in our area, he always trying to squash these little beefs between these youngsters and give them some guidance. You know what I mean? I hope that can carry on to the police force as well. Somebody step up and just squash these little beefs and have a sit down and have a great, intelligent conversation collectively about how we can get on the same page and look at each other as equal. And, you know, I'm looking out in this beautiful crowd. Family here, hey, y'all. Nieces, nephews, and so on. Hey, Ari, I see you, baby. Okay, so again, you know, on this movement with my brother, 6'6" stature, big guy, and the saying is, if a tree gets cut down in the forest, if nobody's around to hear the sound, when it falls, would it make a sound? And apparently, Big Floyd was that tree, and he definitely made a sound across the world. And everybody saying his name, George Floyd, and we here trying to hope his death makes a difference in the injustices we're receiving. And you know, it's very hard on us as a family. We still in pain. We still mourning y'all. And I mean, deeply every day. But it's the encouragement we get from people around the world, local people in our city, around, and again, the great support we get from Miss Sheila, Trey the Truth. Everybody here, friends, family, the mayor, great support from the police as well. And, you know, thank y'all for standing with us, fighting wars, and we still here fighting on the battleground. When y'all don't see us, we still fighting. We always fighting, and we're going to keep on fighting. So we're not letting up.
How everybody doing? On behalf of my family, I'd like to start by just saying thank you for coming out. Thank you for the continuous support, the prayers, text messages, social media posts. We appreciate everything. I wasn't gonna say much, but I think it's only fitting being in Third Ward and with what's going on, especially in the world today. So I want to give thanks to my big brother, Trey the Truth, who doesn't get the recognition he deserves, and he does a lot. And he never wants attention for it, but, you know, I feel like you should always give people their flowers while they're living, so thank you, bro. Also, Miss Sheila, who I've had, you know, the pleasure of growing a relationship with. Also, Mayor Turner, thank you as well. And everybody that was involved in putting this together, we appreciate it. But back to what I was saying, I feel like, you know, it's definitely another pandemic in this world other than the COVID. No, and that's the social and racial injustice. And being that my uncle did lose his life to that, I would just like to say that, you know, I hope this sparks the change that we need in this world. I hope it, you know, motivates everybody to get to the polls and vote. Use your voice, because there's only one way to stop it, and it's us getting up there and fighting and not quitting. You know, it's us getting up every day and doing whatever it is we can do to put an end to what's going on. And I just hope that this is the start. It's gonna be a long journey, but, you know, it's gonna take sacrifice. It's gonna take us holding people accountable for their actions. It's gonna take better policing, better training. It's gonna take a lot, you know, but in order to not keep adding names to these memorials and families to go through what we've been going through, because, you know, after all of the news articles and the cameras, You know, it's a lot of sleepless nights still for us. You know, it's a lot of painful, hurtful days. You know, you can't forget about the family members and the kids, you know, who's losing uncles, fathers, mothers. If you just take a second to think about the whole Breonna Taylor situation, I won't say much about it, but we all know what's going on with that situation. And anybody who can't see what's going on with that situation, you're obviously blind. So thank y'all again. We appreciate it.
How y'all doing? My name is Phalonis Floyd. Thank you, Miss Congresswoman Sheila Jackson Lee, Mayor Sylvester Turner, Trey the Truth. I don't know everybody's name, but everybody that came out to speak today, and everybody who came out to hear us. Everybody up here, we're crying right now, speaking on life, because life is valuable. You can't get that back. We go to doctors every day to get medication. We bring our kids the time that they're born. They stay in the hospital to get nurtured. But soon as they come home, as they're growing up, we're losing them. At ages 16, 17, 18, and on up. And I didn't want to say this, but all these people that came out to speak today and see us right now, we need to have this all the time, just like a pack of wolves. Because wolves, you look at them as violent creatures, but they nurture each other. The older ones, they put them in the middle of the pack. The younger ones, they make sure that they take care of them because they don't want to become an endangered species. And right now, we're becoming an endangered species. Michael Vick, when you look at him, he went to jail for dogs. The dogs got justice before Breonna Taylor got justice. And that's a sad situation. And everybody here need to start voting starting November the 3rd. We need to come together because it's a time for change, and that change is now. If you don't want change, you're going to be right out there on Cullen somewhere in a casket somewhere because you have to bring in the right leaders. These people didn't come here today just to stand here. They came here because they wanted change. So I don't know. I keep looking at Bun because I don't know, man. I grew up and it was somebody I admired, went to college and talked to people and stuff. I keep looking at them. But my thing is we have to vote, and we have to start voting now. Don't look at it as an issue as, oh, we knew Hillary was going to win. Hey, everybody thought Hillary was going to win, but everybody still needed to vote. I'm voting, and I expect everybody to vote. I'm walking people to the polls. I'm going to figure out where I'm going to be at in certain situations, but I'm going to be in different places, and I'm going to make sure we all can come together and do what we have to do to remain here. Because, like I just told you, we're endangered species right now. So everybody out here, I thank you all for coming out. And it's a blessing just to see so many people. But before I leave, I need to say this. What's his name? George Floyd. What's his name? George Floyd.
So what we're about to do in a minute, especially with Floyd family and a lot of us, we're actually going to escort the podiums back over there. And for everybody that came today, you're going to actually get to see it early before it's open to the public. So once we escort these back over there, everybody will come on this side. And once we cut the ribbon, it'll be open to the city. But before we do that, I wanted to bring my brother Bun up and let him close because I know he has some thoughts. One other thing I do want to say, man, I've been living in Louisville day in, day out with my Until Freedom family, and we've been fighting for justice for Breonna Taylor. no matter what was said by the grand jury a few days ago, it's always someone of a higher power than them, and it's always someone of a higher power than all of us. So we're not gonna stop fighting for that. We gotta get justice for it, because more and more situations coming out daily showing that they were dead to the wrong, man. So it's very important we say their names in every aspect. Anybody who's a victim of injustice, we're gonna continue fighting and doing whatever we can by any means necessary. Everybody, each and every single person who out here now, I salute y'all. I thank y'all, because at the end of the day, you could be anywhere else and you could be doing anything else right now. But the fact that you even took the time to care and understand what this means to us, what this means to the families, what this means to the world right now, I salute y'all and I thank y'all. Bun, I'm gonna let you close it. To the family and all of us, we're gonna make sure we escort these back to within the memorial. And then after that, once we cut the ribbon, it's gonna be open to the city of Houston. And every day for the next few weeks, this memorial will be open. I promise you, it'll make you feel a little bit different. You should bring your kids out. You should bring your family out. You should bring your grandparents out, because it's everybody from this generation all the way down to Emmett Till, Martin Luther King. Everybody's within this memorial. And to everybody who's a family member, anybody who lost their lives, I want to tell y'all we sorry, and we're going to do whatever we can to continue pushing, to continue uplifting y'all and having y'all back the way that we want the world to have ours, man. So it's much love on our end. Salute.
How we doing this evening? God is good. Bring all the time. I'm so happy to be here with all you beautiful people today, standing on this hallowed ground. I don't know if everybody understands this, but this is a historical landmark right here, Emancipation Park. Represents a lot of progress. It represents a lot of humanity, but unfortunately, it also it represents a lot of pain. You know, this was founded by former slaves who saw their family members killed, worked to death, raped, beaten, hung by trees, and they wanted to try to create something for the betterment of their people, and that's where you stand today, historical Emancipation Park. I'm so glad to have my brother Trey the Truth here, representing, as he always does, the betterment, the better side of Houston, Texas. He's a gentle giant, but don't play with him at the same time. He's not for it. I've been with him all over this country. He gets down for his people, and people don't really give him the credit that he's due. Wherever people need to be represented, wherever people are hurting, wherever people are being victimized and brutalized, Trey the Truth is there. He does it out of his own pocket. He doesn't make any money off of anybody for doing anything. He takes time away from his family, his friends, his career to stand up for us, and I think that's something that we should all applaud to right now. God bless you, Trey. I'm happy to be with our esteemed Mayor, Sylvester Turner, our Honorable Congresswoman Sheila Jackson Lee, Lee Merritt, the Jean parents, and everyone that was fortunate enough to come up here and represent with us and for us today. I know it ain't easy, folks, but it's necessary. It's not a quick fight. This is not a fist fight in the parking lot. This is a battle. We are at war against the powers that be. But we give the power to those that proclaim to be the powers that be. So why would we constantly give the power to those that use that power against us? It's time for us to understand what we're really fighting against. We're not fighting against each other. And this is third ward. When I say we're not fighting against each other, I mean that. Because there's a lot that goes on in the streets of third ward. If you're from here, you know what I'm talking about. We have opportunity right now to change the pattern, change the standards, change the direction, change the path, and change the world for our children and our grandchildren, and most importantly, ourselves. Use your vote on November 3rd. Vote locally, vote statewide, vote federally, but please vote, because there's no need for memorials like this. We shouldn't have to do this. Justice should be there to stand up for these bodies that lay here, but unfortunately, the justice system failed a lot of these people. Well, we're not going to fail our people. We're going to make sure that no one whose memory will be shown here has died in vain. We're going to stand up for these people who didn't have the opportunity to stand for themselves. We're going to stand with the Floyd family because they need us right now. This family's in pain. This family needs our help. They need our love. We're going to give it to them. We're going to pray for them. We're going to pray with them. and we're going to be there for that family, because everybody said it's going to be there for people when people pass, and after a week or 2 weeks, the phone calls die down, the visits slow up, and people are left alone to grieve by themselves. We don't want this family or any family to have to do that by themselves, because you wouldn't want to have to grieve by yourself if, God forbid, one of your family members, somebody that you love, had their face on a mural in this park. So we're going to go over here, we're going to cut the ribbon, and man, I'm so glad that Trey was able to bring this here from Dallas. You know, I think Houston needs it. I think we all need it, collectively, a place to come together and think about what's happening in this world and remind us that the things that our parents fought for, our grandparents and their parents, all the way till the first ships got here, we're still fighting. Don't let that PlayStation fool you. Don't let that Gucci belt fool you. You know what I'm saying? Don't let that big nice dinner at Turkey Leg Hut fool you. The fight remains. We still have sacrifices that we have to give for the future generations. We got to sacrifice a level of comfort. And I know a lot of people don't want to hear that, but it's true. We've been living good out here. We've been eating good out here. But it's time to stop worrying about that. Stop worrying about ourselves. We do a lot of things for ourselves in this world, and it's time for us to start sacrificing for the young people, because I don't want my grandchildren to grow up in a world where they could get murdered just for being pulled over on the street. I don't want my grandchildren to die in an apartment while they trying to eat ice cream after they have dental surgery. I don't want my grandchildren to be murdered simply for being black. That shouldn't be something that they're worried about. People died for them to not worry about that. People marched, people protested, they went to jail. They put their lives on the line so that they wouldn't have to worry about that. Yet here we are today, still fighting that same fight. We need everybody involved with this fight. I see my white brothers and sisters out here. I thank y'all for being here. Thank y'all for being allies in this fight, because we can't do it alone. I thank my brown brothers for being here, because they get victimized in the same way that black people get victimized out here, and they can't do it alone. I wish there were bigger numbers out here, but I know this ain't the time for everybody to really gather, but I hope everybody tells somebody about what's happening here today. I hope you take pictures and post it and invite people to come here and see it. It don't cost a dime. It don't cost no money to come here and pay honor and respect to those that died before us. And you'll be surprised what you'll learn out here today. You'll be even more surprised about what you feel out here today. This is holy ground. Make no mistake about it. Don't have to be a church here. Don't have to be a cross here. This is holy ground. This is our holy ground. We're going to protect it. We're going to honor it. We're going to honor those here. We're not going to desecrate it. You know what I'm saying? We don't need to see no Swisher tobacco dumped out around here. You can go 2-3 blocks down the street if that's what you want to do. We're not going to do that here. I don't want to see no empty beer cans in the grass. You can do that 2-3 blocks down the street. We don't want to do that here. We're not going to dishonor this space. This is holy ground, y'all. God bless y'all for coming tonight. Let's go cut this ribbon and honor these people the right way.
Alrighty, so you are taking a look at that Say Their Names event. I'm going to break down a little bit of what happened while they get ready to actually put the installation. Again, this is the installation of the Say Their Names Memorial exhibit in Houston, Texas. That's Emancipation Park that you're seeing right there. Hopefully the cameraman will kind of level out so you can see exactly what's going on pretty soon here. But this memorial that you see behind you is a national grassroots initiative featuring 200 photos of black victims who lost their lives to racial injustice. Right there you saw families of victims who have been shot by officers in the past, some of those being George Floyd's family members. You saw several of them get up there and speak. There was also some members of the Latino community who came forward too. So this is definitely a big initiative that they're making. And again, this picture right here is from Houston, Texas. They should be putting up that installation pretty soon here, so we'll continue to monitor that. But as we keep an eye on that, I want to take you over to an event that happened earlier today with Senator Kamala Harris. So let's check that out. This is her first time addressing reporters in quite a while, so we'll head over to that while we wait for this installation.
I'm sure that's going to happen. We'll have to see how everything works out.
And do you intend to?
I haven't made a plan one way or another.
Will you be?
But I am definitely going to be involved in the hearings and performing my role and responsibility on the Senate Judiciary Committee.
Do you have a message to Judge Barrett specifically, given the circumstances?
I have a message to the American people, which is there's a lot on the line. Not only the fact that our democracy would dictate that 36 days before the election, when people are actually voting right now, that the president, the new president, be in the position of being able to nominate who would be the next lifetime appointment to the United States Supreme Court. I mean, people are literally, almost 1 million people have already voted and are voting right now, voting next week, voting the week after. So that's one message. The other message is that what's at stake is the Affordable Care Act. We're in the middle of a pandemic. 200,000 people have died. Over 7 million people have contracted this virus. It is a pre-existing condition for those 7 million, not to mention those who are at risk of dying from it. And yet we have a president of the United States who's in the court right now trying to get rid of the Affordable Care Act. In court. And it will be the United States Supreme Court that makes that decision. So these are the issues that are before the court and before the American people, and the American people have it within their power to do something about it.
Senator, beyond making the case about this to the American people, is there anything that you think that Senate Democrats still have the power to do to slow this down? And if not, if Biden and Harris get in the White House and the court is 6-3, what then?
So I'm going to focus on what's within our power in these next 36 days. And what's within our power is to elect Joe Biden President of the United States, somebody who not only is responsible for the creation of the Affordable Care Act, but has made a clear pledge to expand its coverage, to protect people with pre-existing conditions like everything from diabetes to breast cancer. He has been clear that he is going to make sure that the United States Supreme Court is not political in the way that he approaches whatever may be his responsibility regarding the court.
Great, thank you guys.
Thank you on the debate.
Thank you.
Where are you watching the debate tomorrow night?
Again, that was Senator Kamala Harris in Raleigh, North Carolina at an event today. We're going to head back to that live picture at Emancipation Park in Houston, Texas. It looks like they're starting to put that installation up. Just again, for a little background on exactly what's going on over there, this is the installation of the Say Their Names Memorial exhibit in Houston, Texas. Let's see if we can get a little sound, some audio about what's going on right there in Houston, Texas.
That founded this park. We're calling on the names of those who will never be known, who served in bondage for over 200 years. We sadly connect to the brothers and sisters, and we call them brothers and sisters because they're part of humanity. We're grateful for all of those who had the vision. These women that are standing here, from Veronica to Joy to Emily. We're grateful for our brother by the name of Trey. We're grateful for all of those who are in his extended family, for our mayor and the families that are standing here. But as we cut this ribbon, it is our commitment to remember not in words, but in deeds, to be able to give life to these who lay in the ashes, that their memory will never be lost. We cut this ribbon in the name of the people of Houston, Harris County, this great state, and this nation made better by these lives and these families. We will say today, with your blessings and your grace and mercy, we shall never, never forget.
Amen. Here we go. There we go. And now it's open to everybody else.
Thank you so much. That was beautiful.
So there you have it. That was Houston, Texas. It looks like they just put that installation up. That's again Emancipation Park right there. So we're going to switch gears a little bit and move over to some coronavirus news. You're watching News Now from Fox. Thanks for tuning in.
Good afternoon, everyone. Thank you very much for bearing with us with a later start today. I'm joined by the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right, another familiar face, the state's epidemiologist, Dr. Christina Tan. Thank you both for being here. Guy to my left needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. We have the Director of the Office of Homeland Security and Preparedness, Jared Maples, is with us, Deputy Counsel, Paramel Garg, and others. So, beginning over the weekend, our team was in touch with the White House to further discussions on rapid testing resources for New Jersey. And following those conversations, and as was laid out in a video meeting three of us just came from, we've been notified that New Jersey will receive a total of 2.6 million of the NewsNOW rapid tests being produced by Abbott Labs. This is an antigen test that can provide results in 15 minutes with a very easy nasal swab as opposed to the straight up turn left variety that we all started with. The first 170,000 of those tests will be coming within the next 2 weeks. These new tests will significantly scale up our testing capabilities through the Department of Health, obviously under Judy's leadership. We'll be working with our federal and local partners on a distribution plan. So this could be, if it comes to pass in the way that it has been described over the weekend and in the call that we all just left, this could be a game changer. When you do the math, it's just shy of doubling our daily testing capacity for about 12 weeks. And that allows, Judy, we talked earlier, you could plus up testing immediate overnight resources into a hotspot, such as we're seeing in Ocean County, which I know you'll talk about. You could envision it being a big weapon in schools, a school setting, a big weapon in augmenting our already ongoing efforts with healthcare workers or vulnerable populations. So a potential game changer. I want to thank the administration. I also want to thank Abbott CEO Bob Ford was on that call that we just got off. As we learn more about this, we'll keep you posted. But this is a big deal. Next, working under a timeline that's put forward by FEMA, I have sent President Trump a request for a formal major disaster declaration and recovery funds for counties battered by Tropical Storm Isaias in early August. All totaled, we are requesting just shy of $34.2 million in major disaster recovery funds. These funds are necessary to help state, county, and local officials recoup the cost of the cleanup from this storm. The damage from Isaias led to roughly 1.4 million New Jerseyans losing power, and many of those outages extended, as you'll recall, for multiple days, along with multiple disruptions to mass transit and road closures due to downed power lines and trees. Numerous water systems also had to move to alternate power, among other problems. Because of the amount of storm damage, the state had to open 13 temporary debris management sites. In particular, we're requesting a major disaster declaration for the following counties: Atlantic, Bergen, Burlington, Cape May, Cumberland, Essex, Gloucester, Monmouth, Morris, Salem, and Sussex counties. Storm damages in these counties range from $3.87 per capita, and that's in Sussex County, to $32.42 per capita in Salem County. Both of those far exceed the baseline mark of $1.53 per capita to qualify for assistance. Cumberland, Gloucester, and Monmouth counties each also exceeded $10 in damage per capita. The statewide per capita impact of Tropical Storm Isaias was $3.89. We are hopeful for the swift consideration of our request. I want to thank the guy to my left, Colonel Pat Callahan, and the team from the Office of Emergency Management under the leadership of Executive Officer Captain Scott Polton for pulling our request together and getting it within FEMA's time frame. Next, switching gears again. Earlier today, I was honored to join with legislative sponsors and advocates virtually to sign a new state law permanently exempting military combat pay from state income taxes. That's Senator Mike Tester on the upper left, General Jamal Beal on the upper right, and Assemblywoman Annette Quijano on the lower right. And both the senator and the Assemblywoman were two of the bipartisan group of sponsors. To say this is long overdue does not serve this point justice, this measure. We are the last, I think this is shameful, we're the last American state to have done this. One or two, to be 50, just jaw-dropping. But this is a long overdue measure for our active duty military women and men who literally put themselves in harm's way in service to our nation. And this is, at long last, a statement of our New Jersey values, values that honor service to our nation and to our fellow New Jerseyans. And this new law is a worthy complement to our ongoing efforts to ensure that the service of our military men and women is properly honored once their days in uniform are over, whether that be in providing educational and job training opportunities, in health care and housing, or any of the services they and their families need. So to every New Jerseyan who wears our nation's military uniforms, thank you for your service, and we also thank every single one of our veterans. With that, let's move on and take a look at the overnight numbers. We're reporting today an additional 561 positive test results for a new statewide cumulative total of 204,107. As Judy will remind us in a few minutes, the numbers over the weekend were also quite high. We continue to see the statewide number driven in large part, not completely, but in large part by significant new cases coming out of Ocean County. 242, for instance, of the 561 today, about 40%. And that's today's number, and we're maintaining our lines of communication with county and community leaders as we work together to mitigate these outbreaks. Now, by contrast, there were also 54 cases reported today from Middlesex County. That was number 2, but all other counties were 35 new cases or fewer, and that's a good thing. For all tests recorded on Thursday, September 24, the positivity rate was 2.48%. Statewide rate of transmission is currently down a hair. It's, I guess, bouncing around in the same neighborhood, 1.12. In our hospitals as of last night, 236 confirmed COVID positive patients, 185 persons under investigation awaiting test results. The total is 421. Of these, 91 were in intensive care, 39 ventilators were in use, and sadly, we are reporting one additional death, bringing the total of confirmed deaths to 14,316. The number of probable deaths remains at 1,791. And again, at the risk of comparing apples to oranges, Judy, I've got 16 deaths reported in our hospitals yesterday. Again, those are not part of the confirmed numbers. Now, as we do every day, let's remember 3 more who this pandemic has taken away from our extraordinary New Jersey family. We begin in Fort Lee, the home of Francesca Porco, who was a recognizable face in Fort Lee High School's cafeteria as one of the dedicated food service workers. She was 72 years old. That she loved her job would not be a surprise to anyone who knew her, as Francesca always made sure her family and friends were welcomed with open arms and very often with a good meal. She loved giving back and she loved helping others, and she was loved by the students she served and the colleagues she worked alongside. Francesca had an abiding passion for gardening, and the tomatoes she grew were often the basis for those home-cooked meals she so willingly served to family and friends. Alongside them were the roses that she tended to, and after her passing, her family noted that they hoped Francesca found a place in heaven where she can prune and pick roses and grow tomatoes. She'll also be remembered for her tremendous talent for dancing and how she and her husband, Antonio, could basically clear any dance floor as others would watch them with awe. So Francesca leaves behind her husband, Antonio, and their sons, Guzzo and Dominic. And I had the great honor of speaking with Dominic on Saturday morning. She's also survived by her brothers, Giovanni and Pietro, both of whom live in Italy, and numerous nieces and nephews, both here in New Jersey as well as in Italy. We certainly hope Francesca has found that special place in heaven. May God bless and watch over her and her loved ones. Next, we remember on the left, Yvette Elizalde. I want to make sure I get that right. Elizalde of Fairview in Bergen County. Yvette was a native of Union City, raised by a mother who was a Colombian immigrant and a father who hailed from Puerto Rico. Yvette, by the way, was only 47 years old. She earned her degree in speech pathology and audiology from St. John's University, and for the past 2 decades was an educator at Union City's Robert Waters School, where she had garnered Teacher of the Year honors. In every aspect of her career, she stood out, whether it be from her quick wit, the relationship she built with her colleagues, or with the easygoing nature that allowed her to garner enormous trust from her 4th grade students. But it was a love of family that set Yvette apart. Her father passed away several years ago, and Yvette would take time after work every day to visit her mother, who lived only a few blocks from the Robert Waters School. At home in Fairview, she was dedicated to her husband of 18 years, Juan, and that's Juan on the right. I had the great honor of speaking with him on Friday. They met in college, and she was devoted to that guy in the middle, her 10-year-old son, Nicholas, often helping him with his homework, and when school was out, taking him to the pool in North Bergen. She leaves them all behind, along with so many family, friends, and colleagues, and of course, her beloved students. We thank Yvette for her years of service to the children of Union City and for her devotion to her family. May God bless and watch over her and her loved ones. And finally, for today, we recall Don Batayola of Springfield. Don, you'd think Don was a proud American? God bless that guy. Don was born in the Philippines and came to New Jersey 13 years ago to pursue opportunities in the healthcare field. Don was an occupational therapist at South Mountain Healthcare and Rehabilitation Center in Union Township. He passed away the day that he and his wife, Nina, were to leave on a vacation to Europe. Don and Nina spoke at least once a day while he was being treated, and she was self-quarantined. His passing was sudden and unexpected. That vacation, had it happened, wouldn't have caught anyone by surprise. Don loved to travel, whether a getaway with Nina or a whole family vacation with their 11-year-old child Zoe and 9-year-old guy Zeth. Don was also once able to merge his love of travel with his love of reggae music, taking a trip to Jamaica to visit the birthplace of Bob Marley. Don was only 40 years old, so 2 of our 3 fatalities today, 47 and 40 years old, and I asked his wife Nina, with whom I had the great honor of speaking on Friday, did he have underlying health issues or conditions, and she said no, he was in very good health. So he leaves Nina behind, Zoe and Zeth, along with numerous other family members across the country, several of whom, by the way, also work in healthcare. Our hearts go out to them all. We thank Don for choosing to make New Jersey and the United States of America the home for his family, and may God bless and watch over him and his family. So Francesca, Yvette, and Don reflect the tremendous diversity of our state, and they show how indiscriminate and cruel this virus is. Their memories and the pain felt by those left behind should be what spurs us to fighting against this pandemic. We are not out of the woods yet, and the numbers we've been seeing the past week or so, Judy, at this point, bear that out. We are all experiencing some level of understandable fatigue. That's only natural after the past nearly 7 months, but now is the time we have to dig deep and find some added resolve. So please remember, wash your hands, wear your masks, keep a social distance, stay away if you don't feel well, get tested. We cannot let up. Now finally for today, let's meet another of the entrepreneurs who's partnered with the New Jersey Economic Development Authority to help set the foundation for the stronger, fairer, and more resilient New Jersey we know will emerge from this pandemic. This is Jim Schatzel, president of Team Life, a Colts Neck-based company. By the way, I think he said he founded it 26 years ago, that not only markets and provides automated external defibrillators, but also leads training sessions for healthcare professionals, emergency workers, and everyday residents in CPR and AED use. Team Life sprang from Jim's own 30-plus years of experience as an EMT and paramedic. And because of the training that he and his team provide, countless New Jerseyans have learned valuable life-saving skills. To keep Team Life strong and ready to continue its mission, Jim worked with the EDA to receive both an emergency assistance loan and a grant that has allowed him to pay his business expenses. I had the opportunity to check in with Jim on Friday. Among other things, I realized and learned that he was the brother of a dear family friend, Cindy Westendorf, so shout out to Cindy as well. And I thanked him for all that Team Life is doing to help others. Check them out. They're at teamlife.com, teamlife.com. And I once again encourage all small business owners to go to that website, njeda.com, to see what programs may be available to help your business. And that's as good a place as any for us to wrap up for the day. Please, with no further ado, help me welcome the Commissioner of the Department of Health, the woman who needs no introduction, Judy Persichilli.
Thank you, Governor, and good afternoon. In the past 6 days, we have reported about 3,660 cases, new cases, and 28% of those new cases are in Ocean County. In response to this level of new cases, our hotspot team has increased the testing capacity in all sites in the county, and tomorrow, 20 contact tracers will be deployed to support case investigation. Our goal with this increased testing and contact tracing capacity is to contain the transmission of the virus in that county. Also, we continue to monitor cases closely to identify other areas of the state that may be experiencing an uptick. As part of the overall CDC surveillance, the agency has been working to estimate the percentage of those in the United States with COVID-19 antibodies. They have collected lab results from every state and the District of Columbia and Puerto Rico. In the first round, the testing of samples took place between July 9th and August 12th. New Jersey reports the second highest seroprevalence at 14.7%, New York being the highest. According to the CDC, estimates were highest among children and younger adults from the ages of 18 to 49, and lowest in the 65-plus age group. The finding of the data is limited because we don't know if it is truly representative of the state. However, it is unknown whether the samples come from an area of the state with high or low prevalence of COVID-19 cases. At this time, there is still a lot we do not know about serology. Since this is a new virus, we don't know if a person who is exposed is immune to future exposures of SARS-CoV-2. But these tests are valuable for epidemiology and research studies. What we also do not know specifically is false positive results may occur with any serologic test if a person has previously been exposed to, for example, a seasonal coronavirus, which circulate yearly in the United States and cause mild cold symptoms. We do know that a seroprevalence of 15% is not sufficient for community protection, also talked as herd immunity, but what we really talk about is community protection. CDC plans on doing additional rounds of data sampling in the coming weeks. They plan to post this data on their website. I would like to give you some further information about the Abbott by NewsNOW test. It is an FDA-approved point-of-care antigen test for COVID-19. No equipment is required. The sample is collected via a nasal swab and run on a card that uses what they call lateral flow technology. It has a 97.1% sensitivity and a 98.5% specificity. That was from a clinical trial of 102 individuals. Results are delivered in 15 minutes. And although the federal government is sending us the tests for free, the actual cost of the Abbott test is about $5. Moving on to my daily report, as the governor shared, our hospitals reported 421 hospitalizations, 91 individuals in critical care, which is slightly up, and 43% of those are on patients are on ventilators. We are reporting one new case of multisystem inflammatory syndrome in children. So there are now 58 cases in our state. The children affected have either tested positive for active COVID-19 infection or have antibody tests that are positive to a COVID-19 exposure. In New Jersey, there are no deaths reported at this time. The ages of the children affected range from 1 to 18. None of these children are currently hospitalized. The breakdown of race and ethnicity of these cases is white 17%, black 35%, Hispanic 39%, Asian 6%, and other 4%. The governor reviewed the new cases and deaths in terms of race and ethnicity of the mortalities. White is 54.1%, black 18.3%, Hispanic 20.3%, Asian 5.5%, and other 1.9%. At the state veterans' homes, one resident at the Vineland facility has tested positive, bringing the total cases among patients to 390. There are no new deaths. At our state psychiatric hospitals, the numbers remain the same. New Jersey reports an overall positivity as of September 24th of 2.48%. Northern part of the state reports 1.62%. The central part of the state, which includes Ocean and Monmouth, report 3.70%, and the southern part of the state reports 2.58%. That concludes my daily update. Please stay safe, wear your mask, wash your hands frequently, socially distance, and remember for each other, for us all. Please take the call.
Judy, thank you. You made I'd love to go back to the CDC study. So again, to reiterate what Judy said, I think what they did was they went back to all blood that had been tested for any reason over the past 6+ months. So not just COVID related, but you went in to get a blood check for surgery or see if you had strep throat, whatever it might have been. 14-ish% of New Jersey's population was deemed to have been exposed to this. You made the very important point that this does not translate into immunity, which is still, Tina, still being fiercely debated in medical and science circles around the world. But even if it were, even if we found out that that were to be the case, when people talk about herd immunity, they're talking in the 50 to 70% range in most of the conversations, right? This is, even if every one of those people are immune, and it's pretty clear they're not, or at least it's being debated, it's at 14+%. Second largest only to New York City, I believe, right? I want to make sure it's less of a question than I want to make sure, did I get that right?
Yes.
And that underscores a pretty important point. We're number 2 with a long way to go, even in terms of exposure. So it also underscores that while the vaccine may not be the panacea or the magic wand, it's a big step if you get that number, again, meaningfully higher. So thank you. And thank you always for reminding us of the inequities, whether it's infant syndrome, whether it's COVID-19 overall. Pat, good to have you. Thank you for everything again. Thank you to you and your team, Captain Polton and the rest of them, to get that FEMA. Dan Kelly was part of that in our office for getting that application together. Would love to got on compliance. I'm not sure there's anything else in FEMA. how are our firefighters doing, and anything else you got?
Thank you, Governor. Good afternoon. There were no compliance issues reported to the Rock over the weekend. With regard to the forest fire crew that's out there, the 10 that went out for the past 2 weeks arrived home safely yesterday. That was confirmed with us. And the 10 that took their place went right to work almost immediately and fought in a very heavy fire day yesterday. And the task force leader out there has also confirmed that they are remain safe and healthy. So we keep them in our prayers as well. And we get daily updates, Governor, with regards to how that forest fire crew is doing out there. And as you could just see on the news, they are certainly busy in supporting all efforts to bring all of those wildfires under control. That's all I have, Gov.
Thank you, Pat. And I know we'll do one more commercial at the end of the week for the Semper 5 in Seaside Heights this Saturday. I completely butchered the name of our good friends, the Josephsons, on Friday. I think I transposed a different last name, but it was a very successful 5K in memory of Samantha Josephson, who's the young woman who got into an Uber in South Carolina and ultimately was killed. The Say My Name 5K, which is the name of the law that is now requires rideshare companies to be able to say who you are before you're required to get in the car. The 5K on Saturday in Robbinsville was a huge success. I know that because my wife ran in it and ran a decent pace, I might add. I'm not quite there yet. And our Jewish brothers and sisters are not with us, and they're probably not watching, but I want to say in absentia, they are celebrating and observing Yom Kippur, one of the holiest days of the year, and we are with them in spirit and prayer. This week, unless we hear otherwise, Mahan, will be on the Monday, Wednesday, Friday in person. Today we were a little bit later. By the way, the White House call was almost entirely on testing. So we've addressed that to some extent, but expect that we'll be virtual tomorrow and be with you in person on Wednesday at 1 o'clock. And with that, Matt's with us with the microphone. Hello, Dustin.
Hello. You signed a bill in April to gather and analyze local and county data on ethnicity, age, and gender, but we're almost at October, 6 months later, and there still isn't any of that data publicly available. Can you explain what the holdup is, and how can any meaningful policies be made to address racial disparities and other inequities if you don't exactly know what and where they are? On a potential vaccine, have you narrowed down what your priority populations will be? And are you confident you'll have enough PPE to administer the vaccine once it comes? And finally, is the DOH investigating the cause of death at the veterans' homes that are not lab-confirmed COVID cases? If so, how many of the 1,800 probable deaths statewide are from veterans' homes?
Stay close with the mic. Dustin, I literally didn't understand the first one you asked me about.
On having the state gather and analyze local and county data on things like ethnicity, age, and gender.
This is related to COVID?
Yes.
Okay. I don't have a quick answer for you in terms of, you're saying you can't get the data, or you don't see where the data is?
It isn't publicly available as far as I know.
Okay. Paramel, do you have a crisp answer to that, or if not, we'll get back to you?
We'll look into it and circle.
Judy, is that all right? We'll get back. Can we come back to you on that? Judy should go over vaccine in terms of, I mean, we had to say we had an elaborate meeting a week ago Friday, I guess. This is a very, it probably is not a bad idea to hit the high spots of that at one of our upcoming press conferences. But the answer is yes on PPE. That's part of the big reason why we're building the stockpile that we're building. But I'll have Judy come to you in a second on broadly describing the broad populations and priorities. And I think we're going to need to come back to you in terms of how many of the 1,791 are related to veterans' homes, right? I don't have a quick answer, but we can come back to you on that. But Judy, anything on that or on the vaccine priorities?
On the vaccine priorities, we've just received the playbook, as you know, just about a week ago from CDC, and we're looking over it along with the advisors that are providing us information on what those priority populations may look like. So we don't have that yet. We know it's broadly, there's a two initial priorities, 1A and 1B, things like essential workers, broadly individuals over 65 that are vulnerable individuals, but we don't have the breakdown specifically at this point.
But broad categories we can go
Broad
through at some point,
categories.
right?
I think with a full vaccine
Yep.
presentation, we can break it down even more.
And can you follow up on the veterans' homes in terms of the process?
Yeah, I don't have the probables, but I'm sure we can get a breakdown
Come back
of
to
that.
that. Thank you, Dustin. Matt, good afternoon.
Good afternoon. On the Abbott testing, can you just give a little bit more information about what we're talking about here and when the 2.6 million would come to fruition? Judy, I take it, so these aren't the machines, these are the cards, and maybe a little bit more color about where they're going to be distributed beyond just schools and nursing homes. And I think you said, Governor, you've said recently that, or said over the course of a couple of weeks here, that compliance with indoor dining has been good. But my colleagues have gone to several restaurants around the states and have found kind of quite the opposite, that, people aren't wearing masks when they're not eating. Tables might be a little bit closer together. Just curious, who is checking on the compliance of restaurants? Are any spot checks being done by health officials? And kind of what's been your observation or observation of your administration? And maybe just putting on your DGA chairman hat here, I'm just curious, assuming that you read the New York Times story about President Donald Trump and his tax returns, curious to get your reaction on him paying little to nothing in income taxes over the past, 24 years.
The past forever, it looked like. That was the longest article, I'd say to the journalists, that I've ever seen in my life. 7 pages, I think, of that newspaper. So the Abbott tests, 2.6 million in total, 100.
All right, sticking on coronavirus news, we're going to head from New Jersey to Kentucky to hear from Governor Andy Beshear about what's going on over there with COVID-19. You're watching News Now from Fox. Thanks for joining us.
Wealth, the challenge of our times. You know what? I'll start the way that we used to always start, because we all need to hear it, especially as it looks like we're going to go into a very difficult fall with this virus. So we're going to get through this, and we're going to get through this together. We're going to talk later about how that's going to need us to react and respond with urgency to make sure we're doing our part, and mainly to make sure we are wearing our masks. We are not seeing enough of it at the moment. I can plead, I can beg, but I can also tell you that for a fact, the amount of our economy that's open, the ability to get our kids back in school, and the number of lives we lose or do not lose depend on a number of things, but primarily the number of people willing to wear these masks. So today, I'm wearing the Barberville Tigers. That's Barberville Independent. Thank you to their Frisky director, Samantha Daniels, for sending it. Appreciate them trying to keep their kids safe. All right, our fast for today, those things we start with to make sure you see a number of different things going on in the state, starts with what we did yesterday, dedicating a Gold Star Families Monument here at the Capitol. The final Sunday of September is set aside as National Gold Star Family Day, a day to venerate the many brave U.S. military members who made the ultimate sacrifice in defense of our nation, and to recognize that every one of those individuals we lose was a part of a family, and that those family members also carry the trauma of losing a loved one, and that they sacrifice too. So yesterday, the Gold Star Families Memorial Monument was unveiled on the grounds of this state capitol before dozens of families. The memorial helps us honor Gold Star families. The Registry of Gold Star Families includes nearly 10,000 Kentuckians that are a part of that fellowship. These are our sons and daughters, our brothers and sisters, our husbands and wives that answered the call and then didn't return home. They fought for all of our freedoms, and the gold stars bestowed with an honor those families that no one seeks, but makes them a part of a special fraternity. Yesterday, we celebrated the lives of those Kentuckians. We lifted up their families, and now we have something on these Capitol grounds that show a little bit about our values and that we valued each and every one of these individuals. I invite Kentuckians to come and to see this memorial. It'll add another part of Kentucky history, but also part of who we are at our core right here on the Capitol grounds. All right, next, we are now in the midst of this election coming up in November. Early voting in person hasn't started yet, but absentee voting is underway. This is my absentee ballot. It means that they are being mailed out. It means you have the opportunity to fill them out, and you need to make sure you do it appropriately. There are instructions that come inside of each absentee ballot about not only filling out the ballot, but what you have to do with the internal envelope, signing it, sealing it. What you have to do with the external envelope, signing it, sealing it. Make sure you follow those instructions. You then have two different things that you can do with this absentee ballot. You can mail it, and if you're going to do that, mail it soon. I'm mailing this today. I will have voted. Or you can drop it in a drop box, which the First Lady's going to do, and we're going to show people what that looks like. So remember, you can register to vote until October 5th. You have until October 9th to request one of these, an absentee ballot. After that, early in-person voting begins on October 13th, and we want everyone that's going to vote early in person really to do so before Election Day because you can spread out and stay safe. But there is no excuse, folks. Voting is a part of who we are as Americans. It is your duty, if you have the ability to vote, to do so. And now you have more opportunities and less excuses than ever before. I want to see a record turnout. Regardless of how the elections go, I want a record turnout here in Kentucky. And I think that we can and we should do that. All right, a little bit of good news, and that's today's jobs announcement, and we're going to have one at least the next 3 days. It shows that we are continuing to make sure that we are attracting the types of jobs here in Kentucky that we truly need to compete in this next 10, 20, even 30 years. So today, I'd like to congratulate Summit Biosciences for receiving final approval earlier this year from the Kentucky Economic Development Finance Authority. Summit is a homegrown Kentucky company that was founded in Lexington in 2009 and is located at the UK Coldstream Research Campus. The company is investing more than $19 million new dollars and will create 78 full-time jobs with this project. The expansion is near completion and will support clinical and commercial production of several new nasal spray medicines, including one for COVID-19. In May, Summit was awarded a contract from Seattle-based pharmaceutical company Atosa Therapeutics to accelerate the development of a nasal spray medicine to prevent and or to mitigate a COVID-19 infection. Summit was selected for the contract based on its specialized capabilities, established infrastructure, and proven track record in the development of nasal spray medicines. This product will be an at-home, easy-to-administer treatment option. Summit's grown significantly in recent years, with 45 employees in 2016, growing those to 125 currently. So congratulations to everyone at Summit Biosciences, including President COO Greg Puchinski, for the great work the company is doing overall and in the fight against COVID-19. Just another company doing their part. You think right now it's Kentucky companies that have propelled us to where we are, from testing to even looking at those next steps we can do to protect our people. And finally, Mask Up KY. We'll be announcing the details, I believe, tomorrow, but we are going to be starting up a Mask Up KY contest here in Kentucky. The idea is that we need more positive examples out there of people wearing their masks. So starting next week, it will move from simply us wanting you to fill up social media to us presenting 3 winners each day that'll receive a free Team Kentucky mask that they can wear for being such good members of Team Kentucky. So we're asking everybody to make sure, whether it's Facebook or Twitter or any of the other parts of social media, Instagram, get out those positive messages. Here are a couple of folks that did so for this week. The first is Regina Hudson, and this is the Threads of Hope PPE delivered on a promise to myself, my wife Brittany, Mask Up Kentucky, and Covering for Kids. It's 530 reusable masks to Silver Creek Elementary for students, teachers, and staff. Also sent 100 to the Berea Food Bank. I want to thank them for their work in making sure that we are safe in this return to school, and for those who are ensuring that everybody is fed during this pandemic. The next is Mrs. Duvall getting ready for the start of school, and this would be today. She says 9 hours and 2 bottles of disinfectant later, she thinks her classroom is COVID ready. We wish her the best. We thank her for being patient and knowing how critical this return to school is. We're going to talk in a little bit about where we are. I believe we're at least the start of another escalation of COVID cases in this country and in this Commonwealth. And it's going to be more important than ever that we do this right. And if you want to make sure that her classroom is safe, you got to make sure your community is safe. Because the individual who brings COVID into a classroom got it somewhere else. And so if our kids are going to be wearing masks in a classroom, we need you to do so in your community. Set that good example. Remember, it might be uncomfortable, and we might not want to spread out like we need to with social distancing. We might not want to follow all those rules. We might not want to cut down on our numbers of contacts, but our kids in that classroom are counting on you. The likelihood that they can continue is based on what we do every day in our communities. Surely we can sacrifice for those kids. Okay, and finally, this one we were going to do last week but couldn't fit in. Again, this is an attempt for our kiddos to get back to many of the things that they do. I've been to a number of these classes pre-COVID when my daughter was doing ballet, and we appreciate them trying to do it and do it right. All right, next up we have Secretary Eric Friedlander. He's going to talk about pandemic EBT, which is our commitment to making sure that our children and all Kentuckians are fed, have their basic needs met during this COVID crisis.
Couple of quick updates. First, I want to begin with the hard work of the folks who have worked at the Cabinet for Health and Family Services to get people eligible and through our systems to be eligible for services. As of today, more than 1.6 million people have enrolled in Medicaid. This is about a little more than 1 in 3 Kentuckians, and we have added over 250,000 people to receive Medicaid. This is important. If we're in, and we are in, a pandemic, it is vitally important for individuals to have health care coverage so that we can pay doctors and nurses and hospitals and make sure that the folks who are providing health care can get paid for the services they're providing. Next, we have provided over 100,000 households access to food through the SNAP benefits. This is an important piece to keep people fed during a pandemic. Many people have lost their jobs, and this is a way that we can provide those services. Folks who have lost their jobs, we have outreach to many of those folks to see if they need SNAP benefits, to see if they need Medicaid benefits. We are actually the only state in the country that I know of that have proactively reached out to those folks who have had to get unemployment benefits. Lastly, we know within the next week or so, since the beginning of the pandemic, we have provided or will be on the verge of providing over 2 million meals, 2 million additional meals to seniors across this Commonwealth, and we would not be able to do this without our partners. So the next piece that I want to talk about is the pandemic EBT piece. We talked earlier about pandemic EBT. It goes to individuals and children and families who otherwise would be receiving meals in schools, but because schools have not been in session, they haven't been able to access those meals. To date, we had a first phase, and we provided those benefits to over 500,000 children across Kentucky. Our partners in the Department of Education helped us do that. We took applications, and we have now just entered the second phase of that pandemic EBT service provision. What we've done is we've again worked with our partners in the Department of Education. They have provided us with information about folks who are eligible for free and reduced meals throughout the educational system. As of this weekend, we sent the files in order for individuals to receive these benefits as well for August and September. That is over 625,000 children who are going to receive these services and receive meals and receive food. This time you don't require an application. We will be sending these benefits to you. There'll be new cards that arrive sometime in the month of October is what we're aiming for. The mails have slowed us down a little bit, but we expect that individuals will receive those cards in October. If you have questions, we have provided our staff with the information they would need to respond to your questions. And you can call 855-306-8959. That's 855-306-8959 and select the food benefits option, and you will get information about the cards that will come to you in your mail. You'll need your birth date and some other information to activate the cards, but when you receive them, know that those services will be provided. It's related to the number of days that you're in school or school is in session, and so that is different for each school, but we have the information to provide the right amount of benefits on those cards. So to date, over 500,000 in the first round, over 600,000 in the second. We've signed up we've delivered benefits to about another 1.5 million benefits to individuals in Kentucky during a pandemic. Having food, having health care is very important for the individuals. It is also very important for our communities. So thank you to the Department of Education. Thank you for the workers in the Cabinet for Health and Family Services. If you're calling those lines and you're calling those numbers, thank you for reaching out to us. Avoid Mondays. Again, thank you. Thank you, Governor, for this opportunity.
Thank you so much, Secretary Friedlander, and I can attest to the hard work that the folks at the CHFS have done and in the Education Cabinet as well to make sure that our kids are fed in the worst of times. And so without your leadership, that wouldn't be possible, so thank you. So today I'm here to talk about the new school reporting link that has gone live. Today is September 28th, so it is the first day that the governor recommended in-person classes resume. And so today we knew that the reporting link for schools would go live. And so our schools are asked to self-report Monday through Friday for each day that their school is in session. And the reason this information is so critical is because it's about our communities. First and foremost, our parents and caregivers, they deserve to know this information. They deserve to know how the COVID pandemic is impacting not just the greater community, but specifically the school building that they send their children to every day. It also is very imperative for our teachers and our school staff to know how this COVID pandemic is affecting the children and other adults that they interact with every day. And so I'm going to show you an example of a dashboard and what it looks like today. It is populated by the schools self-reporting, as you can see on the screen. The dashboard is updated daily. Anything that is reported over the weekend will be included in the Monday reports. The data will be one reporting day behind. Dr. Stack explained that earlier, that reports are due by a certain time in the day, and it will be updated by the following day. So it will reflect the data from the previous day. And you can always find the date of that specific report at the top of the table. So for example, if you look today, Monday, September 28th, the last reporting day was Friday, September 25th. And so at the top of that table, you will see as of September 25th, 2020, and that will be the indicator for what those numbers are. If a school has not reported, that will also be noted on the dashboard. If you look at the left side of the screen, you can see in that chart that you can filter at the state level, at the county level, at the school district level, and down to the actual school building level. So you can look at any kind of a filter for your community or greater region in your area. If you have questions about your school's self-reported numbers, then you need to contact your local school or the school district itself. And if you do not see your school listed, we ask that you reach out to alert that school, but also to let us know by emailing chfslistens@ky.gov. And I will close today by saying that this is the first day that this is live. Our schools are getting used to this new reporting system, as we will get used to reading this data, making sense of this data every day. And so I'm going to say what I always say: please extend grace to our school leaders, to our teachers, to parents that are trying to navigate these waters that are very unfamiliar for all of us. Thank you so much.
Lieutenant Governor, I think we've got your or the Secretary's folder. All right, want to thank Secretary Friedlander. I think the steps that we have been able to take during this pandemic to help people have been so necessary. And in most instances, I think that this state has done a very good job. Does that mean in others that we couldn't have done better and that we can't do better in the future? It doesn't, and we should. These are the times where we have to be there for each other. And I know our mission as a part of the state is to try to be there for each and every Kentuckian that needs us. All right, today's, if I'd call it a word for the day, what I hope really sinks into everybody watching is the word urgency. I believe that since maybe the traditional start of school, we have become more casual in our approach to COVID and our concerns about COVID, and in how well we follow those rules and guidelines that are out there. It can be natural. It's been 7 months, and most of us have never had to deal with something like this for 7 months. It's probably also psychological in that we have seen specific days and times that maybe our rhythms run on each year, the traditional start of summer, the traditional start of school, where we see kind of changes in behavior, maybe wanting so badly to go back to pre-COVID norms that maybe we at least try to pretend like it doesn't exist. But the virus is here, and it waits for us to get casual. I believe it's a lack of urgency and some poor decision-making that led to what we saw in Florida, which I think just passed 700,000 cases. It's what we saw in Texas, where there wasn't room in some morgues for what they were dealing with, in Arizona, in South Carolina, and in many other places. And when we get casual, when we don't show urgency.
All right, you've been listening to Governor Andy Beshear in the state of Kentucky give an update on the coronavirus and numbers there. We want to take you over to California, where many acres of land are burning amidst wildfires there in the northern area of the state, especially in Sonoma and Napa counties. These are some aerials from earlier today up there in Northern California. You can see the air quality is just terrible, but officials are giving an update in Sonoma County on the fire containment efforts there. Let's go to that right now.
We are not tolerating anybody being in an evacuation zone who does not belong there. Number one, we're asking everybody to evacuate on the basis of mandatory evacuation order. If you hear the high-low siren, it's time to go. If you don't live in that area and you decide to come around that area and enter an evacuation zone, you are subject to arrest, and we will enforce the law completely and make arrests in that case. We have not put out a press release because I just got word of this, but we will be doing that soon. And again, I just want to thank everybody for their patience. I know this is trying on everybody. Please keep your eyes and ears open and call law enforcement if you need us.
Thank you for that update, Sergeant. Next, we're going to go to Santa Rosa Police Chief Ray Navarro. Chief?
Thank you very much. So not a lot has changed for the police department since this morning. We still have mandatory evacuation zones that are still active and are not safe due to the serious threat of the fires. So as Sergeant Crum has mentioned, we do take these seriously when people come into these areas. We do have officers that are patrolling the areas for looters, and we are taking a zero tolerance approach to this. Everything east of Brush Creek, Mission Boulevard, and Summerfield Road is still closed, and no one is allowed back in right now. We are, again, asking for the public's help when over the next several days as we are addressing the evacuated areas, and it's very dangerous to go back in there, and it gets in the way of the public safety resources who are in there trying to fight the fires. That is all I had to report.
Okay, thank you, Chief. We may have some questions for you in a little bit. And for an update of what's happening at the County Emergency Operations Center, let's go to Chris Godley, the Director of Emergency Management for Sonoma County. Chris?
Good evening, everybody. Chris Godley here. Real briefly, evacuation numbers and zones remain relatively steady as briefed by Sergeant Crum. We are looking at 6 shelters currently operating in the county at this point, as well as we're aware of several others that are being operated by local community-based organizations. We are working with the American Red Cross to open a 7th shelter at Sonoma State University. Our focus remains on community sheltering, communications, and engagement. We are starting initial damage surveys at this time informally. Formal damage assessment, of course, will be conducted by CAL FIRE. And as always, we're urging our residents to touch base with socoemergency.org to receive the latest information both regarding the evacuations, the maps indicating which areas are being impacted, as well as information.
Hey Charles, this is Laura Trump calling from the Trump campaign.
Assistance or shelter at this time. Oh my God! Starting initial damage surveys at this time informally. Formal damage assessment, of course, will be conducted by CAL FIRE.
We are also pleased to welcome Congressman Jared Huffman, who's joining us today. Congressman?
Yeah, thank you, Paul. Just want everyone to know that Congressman Mike Thompson and I are fully engaged, as we always have been in these situations, to make sure all the federal support available to our community happens quickly. We're working very closely with all of the other elected officials at the state and local level to make sure that happens. I'll just mention one thing and then let's get back to the first responders and others. If you are under an evacuation order and you need to incur expenses to house you and your family until you can get back to your house, save the receipts. If you can document those expenses, either Congressman Thompson or I and our teams would be happy to work with you to try to get some federal reimbursement. It's only a few $100s, but it is available to folks who are subject to those evacuation orders. Thanks a lot.
Great, thank you very much. Yes, save your receipts. And we're also pleased to have with us both State Senator Bill Dodd and State Senator Mike McGuire. Senator McGuire, let's start with you.
Thank you so much, Mr. Goldson, and good evening. Good evening to the Board of Supervisors, Madam Chair, Congressman Huffman, Congressman Thompson. Thank you for your incredible dedication to this county. Always honored to be on with Senator Dodd and appreciate all of his hard work and his partnership, and of course to the Assembly members as well. This fire is the biggest threat to public safety in Northern California. And as we all know, additional strike teams arrived last night, both into the Sonoma as well as the Napa side of this fire. The state continues to be in direct coordination with both the city of Santa Rosa as well as the county of Sonoma. I want to say how grateful we are to Mayor Schwedhelm, his incredible team at the city for all of their work. And the state is going to ensure that all needs are met, not just short term, whatever needs are going to be need to be met here with sheltering and/or long-term with debris cleanup. Senator Dodd and I assure you that we are squeezing every resource out of the mutual aid system. That is our top priority, working with CAL FIRE, and we are grateful for their hard work. And what I want to remind folks is we do have significant fires across the state. One continues to burn north of us with the August Complex fire, where we saw significant structure loss in both Humboldt and Trinity counties last night around Ruth Lake. And as difficult as last night was, again, as Chief Nichols said, he got it right. Firefighters saved much more than were lost, and our thoughts are with those who lost homes last night. My last item, Mr. Goldson, if you did lose your home, please contact your insurance carrier immediately for assistance. And of course, Senator Dodd and I would be here for any assistance that you may need in the weeks and months to come. Thank you, Mr. Goldson.
Thank you, Senator McGuire. We certainly appreciate your experience in these fires. That's what we all have is experience. And Senator Dodd, thank you very much for joining us. You have some thoughts?
Well, quickly, I appreciate Senator McGuire giving the lion's share of really a state response. The governor did declare an state of emergency today in both these fires in Napa and Sonoma County. And again, this is, people look up in the sky. There's not a lot of resources. We got to remember, it was a call that I made today that, the smoke was just too thick for those big planes to be flying through. They need to be safe as well. We get some clear weather, they'll be back. I know that we did have some helicopters in and around the area today. And again, we will get ahead of this, and we will start the recovery process. Unfortunately, we do have a lot of experience in this area now, and we know how it works, and we'll be there. And I think it's important to know that if anybody, city, county, or any special agency district needs anything, they can call our staff. We're working 24/7 practically, both Senator McGuire's and my staff, ready and standby, willing to help. Thank you.
Thank you very much, Senator Dodd. We also have with us Susan Gorin, Chair of the Board of Supervisors, and Mayor Tom Schwedhelm from the City of Santa Rosa. Chair Gorin, do you have any thoughts you'd like to share? You're on mute.
There you are. Thank you, Paul. And thank you to our federal and state legislators once again, right by our side with the assistance that we need and the heartfelt understanding about what our survivors are going through. All too terrifyingly familiar for us. And I watched the glass fire and the air resources being poured in on Sunday. We were enveloped in smoke, never recognizing that fire would ember and come cascading down the hill and over the ridge the very next or the very next evening. In a very similar way to what happened almost 3 years to the day in 2017. And my heart goes out to all of the folks who lost homes. And thank you, Mr. Godley and CAL FIRE, for starting to work on the damage estimates. I know I'm receiving a lot of emails, anxious to learn the fate of their personal homes and their outbuildings, and of course, any livestock or pets that they may not have been able to evacuate. You can please call my office at, or email me at susan.gorin@sonoma-county.org. I'm evacuated in Nevada with a lot of friends and neighbors. We were lucky to get a motel room. They're hard to come by. I really want to thank everybody who is volunteering at our evacuation centers. And we are standing up more evacuation centers today and during these fires because of COVID pandemic that we're experiencing. Kudos to all of the folks in Petaluma and Santa Rosa who are volunteering at the evacuation center, and we're working to ensure that we have adequate supplies of personal protective equipment and blankets and food, everything that our evacuees need. And know that there are many of us willing to and able and want to help you with this journey of recovery. And as you know, I know this from personal experience, we will persevere. We are Sonoma Strong. So thanks everybody and a special thank you to the first responders for holding the line in Oakmont and many, many other communities. We did lose homes in Oakmont. We did lose homes in Skyhawk and along Calistoga Road. We will recover, but because of your heroic efforts, there are fewer houses lost. So thank you once again, and to the great work of police and sheriff for evacuating safely. It was very gratifying to me to see the Santa Rosa Police Department whizzing through Oakmont and assuring that everyone was safe. Even though it took me about an hour and a half to get out of Oakmont, I am safe, we are safe, and we will move forward. Thank you.
Thank you, Supervisor. And Mayor Schwedhelm, you have some thoughts for us?
Yeah, thank you, Paul. It's unfortunate that we're meeting this often, but for everyone who is watching it, it's this type of collaboration working together that will get us through this. So as we approach the evening hours, we know there's many questions about the availability of overnight shelters. Mr. Godley mentioned some of that. So amid the COVID-19 pandemic, residents in need of shelter should proceed to a temporary evacuation point, which is different than we've experienced before. And there an assessment and potential shelter referral will be made. So a list of the temporary evacuation points in Santa Rosa and throughout the county can be found at either the county site or srcity.org/glassfire. And on a separate note, to further assist our firefighting effort, our city is asking residents to conserve water indoors and outdoors. And please do not leave your sprinklers running. By reducing demand on the city system, we can preserve water for critical drinking and firefighting needs. Thank you for doing your part to help this firefighting effort. Thanks, Paul.
Thank you for those important reminders, Mayor. We're going to go to questions now, but before we do, I want to remind our members of our media to raise their hand if they have questions, and I will call on you. And before we get to questions, we have another reminder for our Spanish-speaking viewers. Sylvia?
Sí, buenas tardes. Si nos acaban de acompañar, esta conferencia de prensa está transmitida en español en la página del Facebook del Condado de Sonoma. Esta es una actualización sobre los incendios Glass y Shady que están afectando al este de Santa Rosa y al Condado de Napa. Muchas gracias.
Okay, we'll start with Mary Callahan of the Press Democrat. Mary?
Thank you. Clarify the number of people under evacuation order and indicate whether you expect any additional evacuations tonight, particularly in the Montecito Brush Creek area.
You were a little garbled, Mary, but your question was mainly about whether they anticipate any more evacuations. Is that right?
Mainly to clarify the number under order.
Chris, could you clarify the number of those who are under evacuation order?
I refer to the more recent numbers provided by Sergeant Crum.
Okay.
Okay, thank you.
Mary, according to our numbers, we have about 68,000 people evacuated. And as far as more evacuations for tonight, I don't have that answer for you right now. Those decisions are made at the incident command post at the fairgrounds. It's made in conjunction with CAL FIRE meteorologists, and we'll see how the night progresses. It sounds like, from what I'm hearing from the fire folks, and Chief, if you could pipe in here too, it sounds like the winds are down right now, so I don't think there'll be more evacuations, but I don't want to be held to that.
Okay, thanks, Spencer. Nice to see you.
Good to see you.
Can anyone clarify how substantial the housing losses were today?
I can report out on that. So as far as during the after daylight today, the bulk of the structures that have been damaged and destroyed during this fire event have been under the cover of darkness. So daylight allowed us the opportunity to get into those areas. The wind dying down created less opportunity for those homes to be exposed to that ember cast and more critical burning conditions. And so the bulk of the structures that were destroyed and or damaged were over the night last night, and the resources out on the line today are in what we call a tactical patrol. So they have a designated area that they drive back and forth in to monitor for any hot spots that may pop up that unchecked may cause a home to burn down. So a lot of tactical patrol for the resources on the line today, and then line construction for the bulldozers and other resources to contain the fire to begin the process of extinguishing it.
Thank you.
Okay, Nacheli Chavez.
Hello. I had a fire-related question regarding the acreage that was provided at the beginning of the meeting. I'm hoping to get that number again and understand if that represents one or multiple fires. And then the second part of the question has to do about the perimeter for both the shady and glass fires. I'm trying to get a better understanding as to where each fire is located.
So Nacheli, the updated acreage this evening going out is 36,236 acres, 0% contained. And as far as the overall fires, while our investigators are looking into the shady and the other fire that originated near the shady last night, at this point we believe that due to the wind that had gotten down to the valley floor and material burning out from the initial glass fire perimeter that allowed embers to be cast across the Napa Valley at the point that it came across, which got fires established on the west side of the Napa Valley, which then had the wind that was able to push them to Santa Rosa like we saw last night. So overall, while the individual fires were named differently, it's because that's our department process for new fires that we name those fires. But as our investigators work those fires, I believe that they will be folded under the glass as a whole. So all the two fires that originated on the western slopes of the Napa Valley last night burned together before the shady impacted Santa Rosa last night.
I'm sorry, can you repeat that? I believe you're talking about the Boysen fire. Is that the one that you're referring to?
Correct.
Okay. And do you have a better idea as to the perimeter as to which fire is located where across Napa and Sonoma counties?
Well, as I said, the three fires are basically one footprint. If you look at the map, The reason why there's a separation between the fires is because of the Napa River and the vineyards in the valley floor of Calistoga there, where the fire originated from. So the group of perimeters that you see is tied to the one glass fire.
Great. Thank you so much.
Okay, thank you. Next, we're going to go to Carl Van Amberg of News of the North Bay. Carl, are you with us?
Yeah, hi, everybody. I had a question for Chief Nichols. Chief, we were out at Channel Drive where the fire, presumably, or part of it, got into Annandale this morning. And we're also at Spring Lake and Annandale this afternoon. And we could see a little bit of the backing fire up above Spring Lake and a little bit more to the south as well in Annandale. The question some of our viewers had after we did a live out there was, is there a decision to bring over, or will there be a decision to bring over a helicopter to do a water drop, because Spring Lake is so available and right there, and it's been used to such good effect over in the Napa Valley with, we saw that, many people saw that on Sunday morning with the glass fire as it was getting underway.
Ultimately, yes, there may be the opportunity for helicopter support there at Annandale Park. But remember that we now have 32,000 acres, 36,000 acres that we need to mop up. And the helicopters as a tool are not necessarily best suited to mop up hot spots. They're to knock the heat out of a running fire that allows our ground resources to get in and put that out. The most effective way to mop up hot spots and ensure that all of those hot spots are extinguished out there is a hand tool and a hose from a fire engine. That the helicopter application of retardant or water from altitude, especially through the canopy of mature timber, there's not a good coating of water or retardant that makes it all the way down to the ground that will soak into the ground and extinguish that hot spot.
Okay,
but you can expect to see helicopters here in the next week or so, throughout the next.
Great, thank you.
Okay, thank you, Carl. We next have a question from Dan Weir of KSRO Radio. Dan, are you there? You might be muted. No? Okay, we'll come back to you. We'll figure that out. Let's go to Yosef Beg from the Press Democrat. Yosef, did we lose you too? Okay. Julie Johnson.
Hi there, is this working?
You're on, Julie, thanks.
Great. All right, I'm gonna shoot two questions out, if I may. One is, I'm wondering just basically what time and at what location did the fire first hit Santa Rosa city limits? And then my second question is, I'm hoping someone can tell me about injuries and burns. We've heard there have been a fair amount of those with residents and perhaps firefighters as well.
So Julie, Ben Nichols here. The first report that I heard of the fire entering into the city limits of Santa Rosa may not be quite as accurate as Chief Gosner would have, but at 1:31 this morning, there was a radio report that the fire was across Highway 12 and into Oakmont. As far as the injuries to civilians and firefighters, I know that there have been, but I don't have solid information for you on those injuries. Those will be coming as we get more information as we investigate those instances during the event. As you might expect, during the initial stages of the rapidly expanding incident, there was multiple rescues occurring at the same time, and so it's going to take time to put that information together.
Thank you. Quick follow-up. Is there a general sense of where the rescues were happening? I know Sergeant Valencia earlier mentioned Los Alamos Road was a place where rescues were taking place.
I don't have specific locations for you. I know that there were rescues that were taking place on the east side of Silverado Trail the first morning of the fire. And I heard rescues yesterday. I just don't have exact locations for you.
Okay.
Okay, Dan, aware of KSRO was having some audio problems, but his question is for Mayor Schwedhelm, and possibly Chris Godley might be able to help with this too. He says, can the mayor re-explain, we're going into more detail, the difference between evacuation or temporary evacuation points and evacuation shelters, and why there is a difference? I think that's a good point you brought up. I think there's a lot of confusion about that.
Right, because it's something new that we didn't experience in 2017. And Chris, I'll let you go more in depth, because for me, let's just take Place to Play, which is a temporary evacuation shelter on 3rd Street in the city of Santa Rosa. There will be staff who will evaluate your situation, depending upon where you fit in regards to the pandemic. And based on that assessment, we'll give you the appropriate referrals for shelters. Chris, do you have anything to add to that?
No, it is a new concept. We're following along with the state in order to have a uniform approach across the state for wildfires to protect our residents from the COVID-19 virus. The TEPs really are designed to serve as kind of, if you would, that initial landing spot, allow for people to identify what kind of resources they might need, but also that allows us then to identify where people might need to go in terms of if they're seeking shelter, food, or just information. It allows us to kind of keep people socially distant from one another, and then also making sure that we're addressing people to just the right resource. Because as we've talked about, managing evacuations and sheltering in this COVID environment is so challenging. We want to maximize all the resources we have available, and those TEPs are kind of a great screening tool for us to make sure that we really benefit the public as best we can in as short a time of period as we can.
Great. Thank you for making that clarification. Let's next, we're going to go to Ted Williams at KZST. Ted?
And thank you, everyone. Spencer Crum, nice to see you, PIO for the Sheriff's Office. It's been a little while. Question for you. Do you foresee enacting any curfews for civilians around the fire lines?
That is a topic that has not been discussed at all.
Okay. We'll stay on top of that one. Have you done, and this probably goes to the county itself, infrastructure assessments for roads and bridges that might take a little bit longer to get recovery back up?
This is Chris Guile. I could jump on that. That is correct. Our county department, Transportation and Public Works, is already starting to put crews into the field to identify damage to infrastructure, whether it's roadways, road surfaces, safety devices like guardrails, signage, as well as disruptions to water control and storm drain control facilities. After all these fires, I'm afraid we've got a crew that's especially good now at looking for and identifying damage very quickly, because as you know, we've only got a short period of time before rain becomes a challenge, and we want to make sure we get on top of this as soon as possible.
Okay, thank you. And then one last one. How can people help with the evacuees? If they're not an evacuee themselves, how can they best serve those who are evacuated?
Well, this is Chris. I guess I could jump in. The first is, of course, connection. You may know of people that are evacuated or under threat of evacuation. They need to be warning. So it's important, as socially distanced as possible, to make those connections, to let people know they're not alone. There's a lot of significant angst going on right now, if not actual a reimagining or reliving of many of the traumas that this community has been through over the last several years. So that human connection is probably the most and the greatest value that can be provided. We're also looking for our community to help support our community-based organizations, our nonprofits, our faith-based organizations that are really stepping up to meet the needs of those that have been evacuated and those that have lost. And the best way to do that, of course, is cold, hard cash. That energy that cash represents allows people to start anew, invest in their lives, and get moving ahead down the road to recovery just as soon as possible.
And I would add, thank you to Transportation and Public Works. You're always on the spot, recognizing the replacement of guardrails and cutting down the dangerous trees that might be in danger of falling on the roadsides. We appreciate everything you do on the spur of the moment. And I know that Supervisor Zane wants to chime in, but every evacuation center needs some volunteers. And if you do have a spare room, even in COVID, and you have a friend who has been evacuated, please offer them your home and your friendship. It is a very, very challenging, emotionally difficult time, and they will need your friendship to get through this, even as they evacuate, even if they haven't lost their homes. And yes, please direct those donations to the Redwood Empire Food Bank, always filling the need for hunger insecurity. So thank you.
I just wanted to add also that you can go on our SoCo emergency website, and there's a list of volunteer options, but even better, call the Volunteer Center. Marin County is taking care of that at this point. You can also call 211 to get information. And Supervisor Gorin is right. There's a real need in terms of food distribution and also in terms of shelter. And again, there's lots of opportunities. The only thing that will limit you, I will say this, frankly, is your age, because we're being very cautious with our older adults right now in terms of their exposure to COVID. So if you are over the age of 65, there will be definite limitations, but there's still opportunities. Petaluma People Services does over 1,000 calls every day to homebound isolated seniors, and they need more callers. So take a look at the website, socoemergency.org. Think about being one of those volunteer callers, or maybe a delivery person for home delivered meals. Lots of opportunity, and really appreciate the generosity of the community right now.
Okay, thank you, everybody. Great job. Great answers.
Yeah, thank you for all those great suggestions. Mary Callahan, you have a follow?
Howdy. I think I'm figuring out how the evacuation number is so significantly different this morning. I wanted to check in and see if there'd been any progress on a north-south fire line or something through Annandale. Can anyone speak to that? Ben, are you still there?
Yeah, I'm still here, Marie. Looking at the mobile data terminal and the pickup here, we have an engine back behind Spring Lake on the north end and a bulldozer working deeper in the park. We reached out to State Parks this morning to make sure that any bulldozer work that was done would meet what they needed to do for management for the park. But we do have that dozer and the engine company working on those control lines in the park to keep it in the park.
Okay. And can you say anything about, I believe it might have been yesterday that this fire was described as being priority for the state because of the number of structures that were at risk. Can you address that?
I can't speak to the fact that it was the priority fire, but I know that we got a substantial amount of resources that we asked for when there wasn't a lot of resources to give.
Thank you.
Okay, let's go to Rafael Vasquez. Rafael, you have a question?
I do. I actually have two questions. Thank you. The first one is, are there any plans to add additional hours for the warm line? I know that last night when we were reporting on KBBF, even until 2 a.m, people were reaching out to us because they needed to talk to somebody. And obviously the warm line is only open from 10 a.m. until 7 p.m. daily. Are there any plans by the county or for the city of Santa Rosa to create a similar warm line for people to check in?
I don't know, Chair Gorin or Supervisor Zane, do you have some thoughts on that?
I believe we still have our warm line
We do.
operational, and
We do.
I'll let Shirley talk about that. But also, you can call 211 or go on SoCo Emergency for any of the information that you might need about this.
Yeah, the warm line is still going, and we're getting, the calls go up and down depending upon what we're experiencing any given day. Obviously, there's a tremendous amount of people in anxiety and stress right now, and the PTSD that gets triggered with the sirens and the smoke and everything. So we want people to use the warm line. Please, please call it. You can have Spanish-speaking therapists as well as other languages, and it is available 7 days a week from 10 o'clock in the morning until 7 o'clock at night. And I'll give the phone number again, and it's really important that people reach out right now and get the help they need. 565-2652, 565-2652.
All right, we want to take you over to a structure on fire in Los Angeles. On the topic of fires, actually, you're seeing right now, firefighters are responding to, looks like a home on fire in Jefferson Park in Los Angeles. I want to put this up for you right now. Some compelling visuals right now coming out of Los Angeles. It's almost 6 p.m. here on the West Coast. And what appears to be a home on fire. You see firefighters on the roof of that structure. No word yet on what might have caused this, but this is coming to you from the aerials of our sister station, Fox 11 KTTV in Los Angeles.
Okay, copy that, Courtney.
And you can hear the
Go ahead.
aerials of the chopper. We're going to bring those down 1 second. So we'll be monitoring this for you throughout the evening, but it looks like firefighters are extinguishing a blaze at this structure in Jefferson Park in Los Angeles. We were just showing you an update on the forest fires in Northern California in Napa and Sonoma County. We're going to go back to that in just a minute, but we're going to hold for this right here. Looks like dozens of fire trucks are responding to this. The streets are blocked off right there. Well, we're going to monitor this story coming out of Los Angeles and possibly find out a cause of this structure fire. But I want to take you back out now to officials in Sonoma County near Napa talking about their containment efforts and what they're telling citizens as these fires ravage Northern California.
Assisted living center, Oakmont Senior Living there in Oakmont, then the management has to have, per California law, thank you, Senator Dodd, for introducing that. They have to have basically an emergency evacuation plan with people to care for them in those sites if they don't provide the sites themselves. So they have to actually send caregivers to those sites. She lives independently. That's trickier, and you might want to ask. I think our chief is on here, Ray Navarro, about what you would find.
I understand that folks from the Oakmont Gardens were evacuated by bus. If they needed assistance with evacuation, they were first taken to the Santa Rosa Veterans Building, along with the residents of Los Locos Village. And I believe, and maybe Chris could confirm this, that they were then transferred to the Petaluma Fairgrounds to get them out of harm's way. So I would encourage you to outreach to the Petaluma Fairgrounds first. I suspect they are there.
And we'll be visiting that center tomorrow. Paul Dunaway, the Director of Aging, and myself, we're going to be visiting to make sure that they are complying with the new state regulations in terms of evacuation plans and support at the evacuation centers as well. Yeah.
And I will be visiting with my friends and neighbors there and potentially at a number of the evacuation centers. The Oakmont residents are resilient, but we are seniors.
Okay, thank you for working through that. Joseph is having problems with his audio as well. So he asks, his first question is to Chris Godley about the potential capacity at Sonoma State Shelter and when that would be achieved or activated.
Sure. Briefly, Sonoma State is offering 2 separate sheltering solutions. This is a significant contribution by the state of California, a real significant coordination effort. And Sonoma State has really stepped up again and again this year during the COVID environment, our most recent, a fire event near Walbridge, and now they're looking at offering dorm suites, if you would. These are not individual dorm rooms, but instead we can shelter up to 5 or 10 people in a suite. We have about 50 of those that we can provide to the most significantly vulnerable individuals or families that are seeking shelter. And then, of course, the congregate or larger scale shelter operation that the American Red Cross has agreed to spearhead, that should provide an additional up to 300 bed spaces, because we're making use of the university's new and very large sports facility complex. So we believe we can provide a safe environment for up to 300 individuals at that location.
Okay, great. Way to go, Seawolves. Second question is for Chair Gorin. It concerns about constituents putting themselves at virus risk when they fled the fire and risk getting on buses and going to shelters, more exposure for COVID. Have you heard from your Oakmont neighbors about any angst they're feeling about forced to flee after months of trying to shelter in place? Many of them have been really locked down. Have you heard much?
Well, I've been talking with former neighbors and acquaintances that are sheltered here with me at the hotel, motel, and of course everybody's wearing masks, but we have guidelines. And so at these shelters, everyone is required to wear a mask, and especially at the evacuation shelters, the Department of Public Health has operated and stood up public health units for each of the evacuation centers to check the temperatures and to evaluate the best place for people to evacuate to based upon their, if in fact they may be having a temperature, rapid testing for COVID. We do not want to unintentionally expose anybody to COVID during the pandemic. That would be adding insult to injury. So we know we absolutely have to be careful. I have not heard anything specific from my friends and neighbors, but I know that we've been pretty cautious all along about exposure to COVID and really taking care of our own personal health, because we know that seniors, especially those seniors with underlying medical conditions, are vulnerable to COVID. So, of course, we're going to do exactly what we need to do, but the Department of Public Health is helping with that.
Great, thank you very much. And our last question, we'll finish with Julie Johnson. Julie, you have a follow-up?
Hi there. Thank you so much. I'm wondering, and this is especially for our fire chiefs on the line. I'm wondering, as people go to sleep tonight in parts of Santa Rosa, how concerned are you about keeping neighborhoods safe and, evacuated neighborhoods? And are we over the worst? Are we under major threat? What is your mindset going into tonight?
For me personally, going into tonight, we are night and day to what we were last night. So last night we knew that we had the wind coming. We had the wind the night before. So we don't have those critical burning conditions that we were experiencing the last 2 nights. So firefighters across the board here on the glass and shady fires are still got a long road ahead of them, but they are feeling much more confident tonight than we were last night, when about this time or about an hour from now, when the first spot was seen on the ridge, that we knew that we had a long night ahead of us. So we take that responsibility to keep folks safe and feel safe in their homes very, very personally, and all the firefighters on the line are making sure that people can be as at ease and at unrest, or I'm sorry, not of unrest, but to feel comfortable in their own home environment.
Thank you.
That's an optimistic note to end on. So thank you very much, Chief. And I want to thank all of our first responders who are with us today. I want to thank our elected representatives for joining us, our staff, and everybody, and those who ask questions. We appreciate your participation and getting the information out there. Just a reminder that we will be doing these press briefings twice a day, once at 11 and once at 5, as long as we see the need. So we will convene once again at 11 o'clock tomorrow morning. Until then, be wise and be safe. Thank you all.
Thank you all.
Alrighty, so that was a press conference coming out of Sonoma County about the glass fire. We're going to head back to these aerials that we have from a structure in LA. We have actually some new information about that. But again, you can just see these plumes of smoke going up into the air. Interesting that, we've got an active fire going on right now, and we were just talking about fires going on across California. This one specifically in Los Angeles, it's in Jefferson Park. You can see several units out there on the street. There's firefighters out there trying to, really get some containment on that right there. So some new information that we have on this firefight continues. There's 38 firefighter personnel out there. Looks like this is a 3,324 square foot 2-story home. It was built in 1911 with another addition to it as well. One elderly adult has been treated by the paramedics out there. So definitely a serious situation happening in Jefferson Park, Los Angeles. Again, these are aerials coming from our sister station, KTTV, coming out of Los Angeles. We'll be monitoring this fire right here on NewsNOW from Fox. It looks like they're heading away in the opposite direction. So we are going to take you, kind of switch gears a little bit. We have some more coronavirus news coming out of Kentucky. We're going to bring that to you right now.
Got a little exhausted in it and maybe didn't wear my mask as much. I lost my friend Alice Sparks at the end of last week. Lived in northern Kentucky, lived a wonderful life, lived life to its fullest. But Alice should still be with us. I can name a half dozen other people that I knew that well that aren't with us anymore. Remember, when we are casual, we do not show urgency. The results are somebody that you might not know passing away, but other people know them. And what we're seeing right now requires, I think, even more urgency. Can you show the graph of the the United States and what we are seeing in cases. So as you all know, in the beginning of this, in March, what we saw was a rapid increase in cases. New York had its hospitals overrun. We saw how that can almost exponentially increase the number of people that we lose. We did something that I think has been done very few times in history. We took some really, even severe steps in being healthy at home here in Kentucky, and we were able to blunt that curve both as a Commonwealth and as a nation, though some suffered more. But then we saw what happened when we got into the summer. Again, I think some folks were just wanting to get back to that normal summer. You would hear, how could you steal summer from kids? And what do you mean the pools can't be open? And what we saw was a rapid escalation in this country where certainly the cases overall increased even more than what we saw in March. We saw mask mandates pop up at this point all around the country, steps that needed to be taken. People rightfully being very worried starting about July 5th. And we saw another decrease. But when you look at that graph, we never got down to the levels pre-July before we saw it coming. And now, what we believe that we are seeing, and I believe we're seeing it nationally, is the start of a new escalation of that line not going down, but going up. And these are total cases that we are seeing in the country. And as we come towards a fall season and winter, where more people are going to be inside, where we know the virus spreads faster, we got to do better than this. We can't be casual right now, and what we do right now may impact us 2 weeks or a month from now. Let's look at the Kentucky cases, because what we're seeing nationally, we're seeing here too. Last week, we had almost 5,000 cases, the most that we have ever had. Folks, we've been at this long enough to know what we can do to reduce the number of cases. We've done it several times, yet we're having the largest number of cases right now. We've got to have urgency. We've all got to believe that 4,949 cases, 4,949 cases are far, far too many. And I now believe that we are not sitting at a plateau, but we are seeing what would be the third escalation that we've dealt with here in the Commonwealth. We have to do better. We have to act with that urgency. We look at the White House report, which came out today. We had been pleased in the weeks before to not be in any of their red categories. We're back in one. We're in the red category for increasing overall number of cases. Thankfully, we're in the yellow category in our positivity rate. It's because we're doing a lot of testing. But being in a red zone in a time of COVID means our people will suffer. And I had somebody talk, I think that it was an individual told this to our Inspector General. He said, well, I hear you all, but I just go to the mall and I don't see people with COVID. COVID is one of these invisible killers that when you have it, you're quarantined at home or you're in the hospital, that you're not seen out in your community. But everybody knows at least one person now and sees one person they know whose family is suffering and says, if you all will do one thing, please believe this is real. Let's listen to them. Let's make sure that we are treating it like it's real. The White House report this week lists now red, orange, and yellow zone counties. That's what we do in our incident report. Here's the red zone: Warren, Laurel, Union, Callaway, Knott, Grayson, Marshall, Estill, Clay, Jackson, Meade, Montgomery, Wayne, and Leslie. A lot of these overlap with our incident maps. Now we've had, some groups, and I'm not suggesting it's those up here, try to argue their way out of our red status saying, oh, that's just individuals in a nursing home. When it's there, it's out in the community. Certainly if you're red in ours and you're red in the White House's, Let's admit there's a challenge in the community and that it's time to do more, not to do less. The orange counties, a number of other ones, of course, Jefferson now in this orange zone when it had been in red for a while. Franklin County, too. Frankfort Independent, operating under the zones we put out, is doing small pods starting today because they're in the orange zone. It's the right thing to do for the health of the students and of the faculty. But you can see the number and the breadth of the state of these orange zone counties. COVID doesn't care if you're urban or rural, doesn't care if you're in northern, eastern, western, south central Kentucky. It can very quickly explode in your community. And here's yellow. And listen, we want to be green, but very few counties are green right now. And the yellow counties that they see, again, many of these are kind of riding that wave that we saw Florida ride, that you have a whole lot of cases, and because you've had some, you start to taper off. But then what we have seen in numerous occasions, including Louisiana, which was hit early and then was hit just as hard again, is if we let our guard down for 1 minute, what can happen. I want to give a quick update on the travel advisory states. Remember, we just set a travel advisory for states that have a 15% or higher positivity rate. I mean, I believe 10% or higher is dangerous. We try to stay below 6%. But South Dakota right now, with over a quarter of everyone being testing positive. Wisconsin, close to 1 in 5. Idaho, just over 1 in 5. Kansas, 15. Iowa, 16. It shows you again how this is spreading throughout the country. We also have to make sure that we're carefully watching different areas where the virus can spread. It's an estimation, but it comes from our EPIs. We believe right now we have 44 and a half high school sports teams under quarantine as of today. We have 538 high schools. That is a pretty significant number. It does mean that those schools are doing the right thing, and the local health departments are doing the right thing. But it's something that we have to watch very carefully. And with those escalating cases, with the challenge that we are seeing right there in sports, with our kids going back to school in many places today or in some version, we need urgency from everybody. We don't get to choose the times we live in, but we do get to choose what we do to respond to the challenges we face. This thing is real. So I'd ask everybody, are you going to be proud of the way that you have gone about everything that's needed? I believe the answer for the vast majority of Kentuckians is yes, because I think the vast majority of Kentuckians have done a great job. You've shown compassion and kindness, and I couldn't be prouder of you. This is one where we need everybody. One big team, Team Kentucky. Everybody's got to pull their weight. So let's encourage each other. Let's try to show compassion to each other. But let's step up and show the urgency we need so we don't have another escalation, so it doesn't impact our economy, our kids, and their education, and it doesn't take more lives of Kentuckians. Because as of today's report, we've now lost 1,162 Kentuckians. That's 5 additional deaths today. I think it's too many. I think it's too many. And I think where we are right now is maybe into the place where we're getting into avoidable deaths. So let's make sure we are doing what we have to do to protect the people around us. Total new cases today, 456. That's actually the same number exactly as of yesterday, though there were 8 duplicates yesterday. So our total number of cases since March the 6th, 66,939. Positivity rate, we are still under 5%, though at 4.41%, and we ought to be concerned. We ought to try to push that down. We ought to push that below 4, and we ought to continue to work towards that. 5 individuals that passed away that are included on today's list include a 56-year-old woman from Fayette County, a 91-year-old woman from Jefferson County, an 84-year-old woman from Johnson County, a 93-year-old man from Jefferson, and a 97-year-old man from Jefferson. Let's remember, those green lights are important. Ringing the bells are important. Calling and checking on each other is important. Let's call and check on the families that have lost someone. Let's also call and check on those households where we worry about the kids during this virus. Let's call and check on the households where we're worried about maybe the relationships of the people who live there, and maybe we're even worried about the safety of someone inside it. Let's make sure that we are what we call active bystanders, meaning when we see something wrong, we do something. Because now, especially in the time of COVID, if we don't, it might not be noticed or acted upon as quickly. Now, let's make sure we are doing even more for each other. And when we see something that concerns us, that we pick up the phone and make a call, knowing right now that might be the only chance to stop something wrong that's happening. In future press conferences, I'm going to show the numbers of whether it's the domestic violence hotline, our child abuse hotlines, and others, because I know most of the people out there want to do everything they can to protect people through COVID, and that is one additional thing you can do. Also support those institutions. Our shelters are out there, they are open, they are working to make sure they are COVID compliant. They're having to do new and additional things like hotel rooms to make sure that they can socially distance folks. So now more than ever, let's support them. Our child advocacy centers. New cases by county, Fayette 108, Jefferson 100, Warren 25, Davis and Madison 13, McCracken 12, Boone 11, Allen 10, and the others will be up on our website. Specific areas that we provide updates on: long-term care facilities. This is since last Thursday, 119 new residents, 12 new staff. We've identified 20 additional individuals that have passed away as being associated with a long-term care facility. We'll be talking in the near future about new rapid testing, how that is being deployed in these facilities, and our overall plan for using some of that testing. K through 12 schools. This again is based on the information that lags behind the dashboard that we just created. Again, we'll have two areas that you can look. One is the short term, before it's audited, before it necessarily goes through public health, and one is post those audits and reviews. So this is the more accurate number, but doesn't give you that day-to-day or week-to-week picture. 53 new students testing positive, 38 new staff, 37 new schools, and that's just since Friday. Colleges and universities, again, this is just since Friday, 13 new students, 1 new faculty or staff, and now a few less schools with a case associated with it. Kentucky child care facilities. Since the last time we updated, which was last Wednesday, 15 new facilities, 12 new staff, 7 new children. All right, so we're going to open it up to questions, but urgency. Urgency. Let's make sure that that word means something to us, and let's make sure we act with it. It's not enough just to have a mask in your pocket, though I appreciate that you have one, and just about everybody does right now. But when we get close to people, let's make sure that we wear it, and let's also make sure we're not trying to find a way around the rules. The rules are there for a very specific purpose. Let's make sure we're following them. All right, we'll start over here today. Joe, you want to kick us off?
Yeah, I want to start with I guess the discussion about K through 12 schools. Obviously today is the day that, at least the statewide recommendation, you said, you can start in-person classes, but obviously we have the dashboard starting to go online here, but as we're talking about the number of cases, an escalation again, more urgency, do you feel confidently that schools across the Commonwealth are ready to handle in-person classes with that?
The question is, with escalation, with what we're seeing in cases, maybe with some of the casual nature we're seeing in our communities, in some communities, about dealing with COVID, am I confident about our schools and being ready for some version of in-person classes? If they follow the state guidance, if they look at that incident map, then yes. But we have a number of school districts whose counties are red and who are continuing with whatever their former plan was. These are some of the same districts that asked for this metric. If you hit red and you are continuing with the in-person classes, then no. I don't have confidence because you're not following the guidance out there. And if the approach is we're going to do what we want to do no matter what, then we can't manage the virus in that way. But for all the other school districts that are looking at it and that are willing to be flexible, in other words, if we are green, we're going to get in as much as we can. If we are yellow, we're going to be careful about it. If we're orange, we're going to do the pod system. And if we're red, we're going to NTI, and we're going to get ourselves back down to yellow. We're going to get back in. As long as you're willing to be that flexible, then yes, I think we can do this. And I think we can do it as safely as we can. Safely is a relative term right now. But let's remember, if we have all the scientists and all the public health experts telling you something's not safe right now, then we shouldn't be doing it. And the intent on the state tool is to provide that not only to the districts, but also to the parents. And the dashboard now ought to be giving parents and teachers a lot of instant information. Tom?
I've been hearing over the weekend from state employees concerned, especially at the Department of Transportation Real ID driver's license offices, that there are a rash of positive cases, but the co-workers are not being told of these infections and are not being helped by the health department, and also that there is no plexiglass between the workers and the general public, where there is, many other places, including room 102 down the hall.
So the question is, the reporter hearing about some concerns in transportation and whether or not there have been some positive cases in the area where real IDs may be given, and whether other employees are being told. If other employees are not being told, if we're not being sufficiently transparent with our own employees, it's absolutely unacceptable. I have not heard of those concerns, but when we get done today, I'm going to go do something about it. Plexiglass barriers are a good idea. If we don't have them there, we should. Sometimes the best I can do is respond when I learn about something, but we're certainly going to take a look at it just as soon as I'm done here. Joe?
Do you think that the level of security and law enforcement in Louisville over the past 5 days was overkill for the actual number of protests and demonstrations there?
The question is on the level of law enforcement and other security the last several days in Louisville. Was it too much? Was it too little? First, I'll say as of today, neither KSP nor the National Guard are in Louisville. It's very difficult to know ahead of time exact scale. Let me say this. 99.99% of people that took to the streets or the sidewalks did so peacefully, raised their voices to be heard, and we should listen. We should listen to the trauma and to the pain. Sadly, we had a couple of individuals that tried to take advantage of those peaceful groups, sometimes hide within them, cause property damage, and we had shootings of 2 police officers that thankfully are both going to be okay. Violence is never a solution to violence. I believe that we can always look back and evaluate. It's hard to Monday morning quarterback. My goal, and all I can tell you is my goal and the decisions we made, and I was very much involved in the decisions we made and even numbers that we set, was just to keep everybody safe, but also because there were requests made for significantly more that we said no to, also to try to keep it on the right scale or the best scale that we could do with the information that we had. We're also dealing with a lot of misinformation. People using social media that formerly was used for, if you look at protests here at the Capitol, to insinuate that significantly larger crowds were coming and coming from different places. The credibility of those are very difficult to determine, but there was certainly misinformation, maybe even intentional misinformation that was out there.
Reopening the floor.
bars, especially in the context of Florida. He said that he was really disturbed by Florida easing the restrictions completely. Given the state of the virus in Kentucky, talking about the escalation, would you consider another 2-week suspension of bars, or at least imposing a strict?
So the question is, Dr. Fauci today talked about Florida and the fact that they're going 100% restaurant, 100% bars. Let's fill up all the stadiums. Let's just pretend like this thing doesn't exist, and like we don't have 700,000 cases, and like it didn't devastate the case just about 2 months ago. So what Florida's doing is reckless and it's dumb. It's the best word I can give for it. Every public health expert would tell you shouldn't do it. They just experienced it. They had huge numbers of deaths, huge numbers of cases. And they're going to do this? I can tell you, as long as I'm governor, we're not pretending like this virus doesn't exist until we have a vaccine and until we can deploy it. We are going to continue with our current levels on bars and on restaurants. And if anybody out there thinks that we should just fully open them up to 100% capacity and fill up an internal arena, you got the wrong governor. I'm going to do what it takes to protect people. And just because there might be states around us making dumb decisions, we're not going to here in Kentucky. We care about each other way, way too much. And I'm, in the end, politically, I'm not trying to please anybody. I'm just trying to do the right thing.
September is close to being the month with the most cases. It's already the deadliest month of COVID-19 with 229. And you're calling for Kentuckians to be more urgent. But do you think that Kentuckians might look at you and say, why aren't you a little bit more urgent by issuing new recommendations for schools, sporting events, bars, restaurants?
The question is, am I showing urgency by not imposing new regulations or making changes? The difficult job with making some of these decisions is how protected we are, and I've said this before, is a pretty simple equation. It is the level and effectiveness of the rules times how many people follow them. And you can have great sets of rules and regulations, and if nobody follows them, it's not effective. Likewise, if you don't have good enough rules, even if a bunch of people are following what you have out there, it's not effective. Right now, we're not seeing enough people follow what's already there. And so that takes shifting a little bit. Our goal and our belief is that if we can get people wearing masks, if we can get them social distancing, if we can get them following the very basics, we can start decreasing our number of cases. But we need everybody. They talk about 80% of people wearing masks. We need 100% of people wearing masks. And if we do, we wouldn't have an increase in cases. We wouldn't have another deadliest month. So we know more now about this virus than we ever have before. We just got to do what it takes. And again, I don't want to suggest that most Kentuckians aren't doing it right. Most Kentuckians are doing it right. But we need more Kentuckians doing it right.
People look at September and they see a month with the most cases, are likely going to be the most cases and the most deaths. Are you surprised that some people do question the mask mandate, and you obviously you believe it's working?
On the mask mandate, it's every single public health official, every single scientist that says that masks are effective, sometimes even very highly effective in preventing you from getting the virus and from getting you to spread the virus. We have seen when there is urgency. Look at when other states that were Texas were skyrocketing and put in their mask mandate, and you can bet people put them on with what was happening. You saw a significant decrease. We know they work, but we got to wear them.
When the Lieutenant Governor was talking about it, she said that it will also show that schools don't report cases or numbers that day. Is there going to be any sort of penalty for schools that do not report on a daily basis or routine basis?
When the Lieutenant Governor talked about a day lag where you might not see some cases, it's because they fill it out at the end of days and not at the beginning. Schools will fill out schools will fill out that for every case they know about. A parent that has a child that tests positive has a legal duty to advise the school. That's in statute. It was in statute before we were here. So at least if all parents know that and call the school, then everything will be put up that day that the parent knows about. Now, there may be some instances where the health department learns about it before the school and it comes back. And so we've got to know that schools are doing the very best they can with the information when they have it. And at this point, I'm not concerned that schools won't report everything they know. That's both because I believe our principals are out there trying to do the right thing, but we've also set up a system of redundancies where we have that later report that we show that goes through all the tests that come through the local health department, and they learn. So we have a check on the back end too. I believe that this is a good system. It is really transparent in how it gives people information. Tom?
Updating their testing strategy this afternoon. Kept putting off the press release on it, but have you gotten any information yet on what it's going to be and how it may affect Kentucky?
Question is on an announcement about to be made by the White House. I don't want to take their announcement from them. It's going to involve them providing some additional means that we can use to test, and we can talk about what we're going to do with those tomorrow after they've made their announcement. I do want to point out, though, that not only is an announcement on more testing coming out, but the White House in its most recent recommendations to us is asking us to test more people. So any lingering doubts about the CDC suggesting that asymptomatic people shouldn't be tested is gone. I mean, the White House's specific recommendation to us and the actions they're taking is we need to test and test more. Joe?
Do you have any comment on State Representative Attica Scott being arrested Thursday night in Louisville and being charged with a felony rioting charge? I believe she still has what.
So the question is on State Representative Attica Scott, who was arrested during protest, charged with at least, I think, one felony. It is, I think everybody was shocked to even hear about it. She is a fierce advocate for her district. It is hard to believe. I have not seen any of the information about it, but I hope people take a very careful look. She is a very important part and voice in our legislature, and I don't know any of the specifics, but I would hope that whoever is handling that takes a very, very close look. I got a couple of written questions. 2 schools in one area that are in the red on the metrics map, and both are currently conducting in-person learning. Listen, when you hit red, you need to move to virtual because it means your community has so much spread that it is going through your schools. You're putting teachers at risk. You're putting administrators at risk. It is not a state law that makes you do the right thing, but you should be willing to do the right thing because all the data out there shows that it's not responsible when you are in the red to be having those in-person classes. At some point, we got to have people doing the right thing and showing the leadership to do the right thing. And it can't be give us a tool, and once we get the tool, if it doesn't do what we want, then we're going to ignore the tool. I mean, come on, folks, do the right thing. If you are in the red, it's virtual learning. Hopefully in a week, you can get those numbers down. But it's going to be really hard to get those numbers down if you don't do it. That's why it was put together. Let's see. There's a couple of questions here about, I think they are specific parts of Breonna's law about body cameras, about penalties, about drug testing, if weapons are fired on the job. I think we're having some really productive conversations on parts of that bill. I want to make sure that I do hear from everybody that is interested. We had another productive conversation with community leaders today. I believe that there is certainly the opportunity for significant improvement in our processes and in how we go about doing things like the service of a warrant. And I believe that we are getting buy-in that could lead to very positive change. All right. I want to thank everybody. We've gone just about the full hour. Urgency. This is your Commonwealth. This is your country. How we do against this virus depends on your urgency and those around you. Let's just do the right thing. Let's protect one another. We're going to get through it, and we're going to get through it together. But how well we get through it will depend on your urgency and all of our actions. Thank y'all.
That was Governor Andy Beshear speaking about coronavirus and testing and everything to do with COVID. That's pretty much been the main topic today. Again, we're going out to another coronavirus briefing, this time in Orange County, Florida. You're watching News Now from Fox.
Include more clarification on the Phase 3 reopening, the latest COVID-19 numbers for our county, coronavirus hotspots, and job placement and retraining programs that are available for dislocated workers. Also here in the audience today is Scott Howitt. He is the Chief Communications Officer for Orange County Public Schools, and Graciela Noriega Jacoby, the COO of the Heart of Florida United Way. And now Mayor Demings.
Good afternoon. Thank you all for rowing here today through the water and the flood that's happening outside. But in all honesty, I know that we're still within our hurricane season, and there's still another month or so to go, a couple of months, I guess, before the end of that season. So we likely will be continuing to deal with weather phenomena here within our community. What I'm going to do today is right from the very beginning, I want to address the executive order and the announcement that Governor DeSantis made last Friday. Since that period of time, my office has received numerous calls asking us to clarify the governor's announcement, and I'm going to hope to try to do that today. I have a few things just to say about the announcement itself. First, I want to remind everyone that the governor's order does not affect Orange County's executive order mandating facial coverings. We do not impose fines, and therefore the governor's reference to removing fines by local governments that require facial coverings does not affect us here within Orange County. What that means is that the facial covering order still is in effect here within Orange County. I want to remind our community that our nation, state, and county remain under states of emergency due to the public health crisis before us. But make no mistake about it, we are still in the midst of a dangerous pandemic. Florida has had over 700,000 cases of COVID-19, and over 14,000 residents have died as a result of the virus. I'll go over Orange County's numbers in just a few moments, but I want to make certain that there's no confusion about what the order says or does not say. I want to share with you just some personal experiences. Over the weekend, I had the opportunity to visit several different restaurants and several other major outlets. And all of the restaurant managers or owners I encountered wanted to do the right thing in protecting their patrons or their customers and their employees. They want the public to feel confident and safe patronizing their businesses. So I want to stress to business owners that they can and should still require the wearing of masks. We want businesses to fully reopen safely, and masks are part of this process. Based on these incidents, I believe our business compliance strike teams are more relevant now than ever. We're going to be proactive with our teams. Our goal is to make sure that they work with businesses so they can be successful and patrons can be confident they are visiting a business that takes its health and safety protocols seriously. We will continue to work with businesses in following the mask mandate, and we will be prepared to assist them with any needed personal protective equipment and signage. I want to alert businesses that they may want to check their insurance policies and make sure they are covered through a coronavirus super spreader or outbreak, or should a coronavirus or super spreader outbreak occur in their establishments. There are liability issues that should be considered. Now the state government really has abdicated all responsibility. I urge everyone to continue to do the right thing, however. Laws or executive state orders do not necessarily need to be in place by the state to do what is inherently right and good for our neighbors. It's simple. Take precautions, protect our most vulnerable and your friends and family. We all depend on each other to keep our numbers low. I want to talk about my goals for the week. I do that each week. We will continue our strike teams to assist businesses with any guidance, questions, and safety protocols. We will be as transparent as possible with coronavirus numbers and where the outbreaks are occurring. We depend on the Department of Health to provide the data to us. We will continue to offer free testing to any Orange County resident who wants it. Since the beginning of the pandemic, Orange County has had a total of 39,990 reported COVID-19 cases. That is an increase of 273 cases since last Friday when we provided the last update. We've had 443 residents who have died of the coronavirus. Since we last met on Friday, we're fortunate here in Orange County, there were no new reported death cases associated with the virus. But we do want to always recognize the pain and suffering of families of those who are going through the ordeal and who have lost loved ones. Our 2-week average is 4.2%. Remember, this is for the last 14-day cycle. Our average since the beginning of the pandemic in March is 11.4%. This past Saturday, our health services provided free testing to 145 people at the Caribbean Health Fair at Barnett Park. This Wednesday and Thursday, Orange County Health Services will offer free COVID-19 testing to those in East Orange County near Bithlow, Wedgefield, and the Christmas areas. The team will be at the East Orange District Park, located on East Colonial Drive in Christmas, between the hours of 8 a.m. and 1 p.m., again on Wednesday and Thursday of this week. Appointments are encouraged, but walk-ups are also welcome. Everyone will get a free mask and hand sanitizer who participates. You can get information by visiting our website at ocfl.net/EastOrange, or you can go to our website at ocfl.net/testing for additional information about future testing. Since the beginning of the pandemic, Orange County has given away more than 12 million face masks to our residents and 3 million bottles of hand sanitizer to small businesses and community-based organizations. With the mask order still in place, we ask that you please continue to abide by CDC guidelines to avoid the spread of the virus. Since March, many Orange County-based nonprofit organizations have had unanticipated expenses as a result of the COVID-19 pandemic. Nonprofit organizations that have seen an increase in services may need to make application for our Orange County Cares for Social Service nonprofit funds. We have $2.8 million in funding available through the county's social service nonprofit fund program. Reimbursement up to $5,000 is available for expenses that include personal protective equipment, computer equipment and software, cell phones, and cell phone service. Through our contractual agreement with the Heart of Florida United Way, disbursements and applications will be made. The deadline is October 19th, again for the Social Service Nonprofit Fund. The United Way is a trusted fiscal agent and community collaborator that has long-standing relationships with many nonprofits in our community. You heard Ms. Watrell mention earlier that we do have Ms. Noriega Jacoby, who is here, who will be able to answer any questions. She's in the front, and if you have any questions about how that process will occur, we brought her here today. For more information, if you're a nonprofit business, you can go to ocflcares.org, or you can go to OCCcares at hfuw.org. That's OCCares at hfuw.org. And finally, we have $36 million in federal COVID-19 aid that has been set aside for social service agencies and nonprofits in our community. The goal is to provide food, job training programs for people facing homelessness, mental health crises, addiction, and child care dilemmas because of the virus. We have allotted $9 million alone to help with job placement and retraining. Here today is CareerSource CEO Pam Neighbors, who will discuss a $7 million program that is funded also through the Orange Cares Act dollars. She is here, and Ms. Neighbors is down front, and she will speak after Dr. Pino. So I'm going to transition to Dr. Pino, and then we'll have Ms. Neighbors come up and talk to you about those dollars. Dr. Pino.
Good afternoon, everyone. The county continued to perform well data-wise, and the numbers are quite low at this point. Although I always said that Monday is not a good day to set a trend. It's just a day. The trend comes later during the week. But we continue to have a 96 positive recovery rate. That is 96%. And I want to give people a few alerts after I give you the numbers. The first one is that we received yesterday 34 positive tests. But again, it was a Sunday. That is a total out of, also we received 105 negative tests, and that gave us a 4.0 positivity rate. But within that data, we also are observing an increase of flu activity in the ERs continues. And this is the time for people to vaccinate against the flu. If there is a year to be vaccinated, this is the year to be vaccinated for the flu. This winter could be a harsh winter health-wise. The mayor mentioned to you that Orange has 39,990 positive cases cumulative, and we have no additional death since we spoke to you last. We also want to alert people about super spread events. That is congregation of more than 10 people without proper measures in place, and then the contamination of multiple people from a single source. We are not 100% sure, but we are looking into our data. We think that we have detected a couple of events, super spread event in the last week, and as soon as we have all the tracking information in place, we will display the data for you. But we thought that was important, even before we get to the data, maybe next Thursday, to alert people that this is happening. It is important when you are hosting individuals at your house, your church, your community center, to continue to have those measures in place, more so if the event is held out indoors. So wash your hands, wear your mask, keep your distance, and keep protecting people who are vulnerable and have pre-existing conditions. We also have detected a few instances again where the child is bringing the virus into a home and infected parents and grandparents, not necessarily acquired at schools, but when I say child, it's any age, and this is also happening. But in the midst of that, week 39, which was last week, we have a negative growth of 29%. That is the highest since week 32, the highest decrease that we have. And we also are our lowest point on incidence rate per 100,000 in the last 14 weeks. Now, but we also have, as I mentioned to you, continue to see a slow increase in the 14-day rolling average data. Now, this data doesn't include the testing that is done at the bubble in Disney for the NBA. So it's a little bit different. It's a data that we watch closely for our own consumption, but it gives us a better measure of just our residents. That is a small increase. It's not significant, but it's something that we have to look for. I don't have any additional data, but not because we are performing so well, not because the data is going all in the right direction, we should relax and rest in our laurels. This pandemic has proven before that it can come back and come back with vengeance. With that, Mayor.
Thank you, Mayor, very much for the opportunity to come and talk this afternoon about Orange County Help Is Here. As we know, our Orange County has been very hard hit by the pandemic over this last 6 months. We continue to see a 16% unemployment rate, and that is very high. We're in the top 3 in Florida, and we know that we will continue to see layoff notices. But despite that, we are still seeing businesses hire in the manufacturing, particularly in the healthcare sector, in social assistance, in construction, and in professional services. And so it's very important that Orange County knows that help is here through the Orange County CARES Act grant. So first of all, at CareerSource Central Florida, we have a dedicated team that is working to outreach to Orange County residents to be able to provide services for job search assistance, for short-term skills training, and for paid internships. First of all, I want to say the number, but I know that it's also being shown on the screen, but you can reach the services and ask about Help Is Here at 1-800-757-4598 and press option 6. You also can go to our website, www.careersourcecentralflorida.com/Help Is Here, to get all of the information that I'm going to provide this afternoon. So first of all, what people need most is to understand how do they reposition themselves into the job market. We have dedicated professionals who are helping with career consultation, job search assistance, reviewing resumes, helping to redo resumes, and also referring individuals to those jobs that are open right now. We have jobs immediately. Right now, just today, we were looking for 25 businesses in the healthcare sector, the accommodation. A few accommodation jobs still are rehiring. We also see a lot of healthcare jobs and manufacturing and construction jobs still being out there and being actively recruited after. So a lot of job search assistance customized for each individual. Secondly, we have training resources. So we can put an individual into a training program to, say, get their Microsoft Office certification with our partner, the Urban League of Central Florida. Or we can put them in micro-credentialing programs at Valencia College, at Seminole State College, at Orange Technical College to get things like project management certification, mechatronics, a medical office certification. And also with our nonprofit community-based organizational partners, we have some short-term training programs, again, that are offered through those training programs. And then most importantly and available right now are paid internships. So we have an opportunity for you to continue to work, gain a wage, and also fill that gap on your resume. We just this past week put 21 individuals, out of work performers, to work at Central Florida Community Arts, doing stage production, doing tutoring, doing classroom assistance, educational assistance, and we're so excited about programs like this that provide anywhere from $12 to $20 an hour for 8 weeks in healthcare, trade and logistics, construction, professional services, and manufacturing. So who is eligible for this program? You have to be impacted by COVID-19. You have to have either been a dislocated or laid off worker or furloughed worker who's looking for services. You have to be an Orange County resident. And so those are the things that our staff will look to help to document so that we can bring you into the program and enroll you. We have over 2,000 applications already, and we have many in the pending process, but we have 500 individuals who are already actively engaged in career counseling, training, and internship services. I'm very excited about this program. I don't want you to wait because this program is only available through December of 2020, and so it's so important that you reach out to CareerSource Central Florida right now. We have all kinds of different combinations of things that we can do. Either we can do services in person at our 2 Orange County Career Centers. One is in the East Orange County on Cimarron in the Airport Business Center. You can call for an appointment and meet with a career consultant there. Or all of the services that we provide are offered virtually through our website and through appointment and video conferencing ability. We also have another career center, brand new. We opened at the West Oaks Mall. It's right across from the Orange County Tax Collector site, so very easy to find. Again, all of the services that I've talked about are available in-person appointment or virtually through Zoom meetings, FaceTime meetings, and et cetera. Just today, we had 180 job postings open and looking for workers. So very important that you reach out to CareerSource Central Florida and connect with the Help Is Here Orange County CARES Act program right away. Thank you, Mayor.
All right. We'll open it up for questions at this time. Just as a reminder, we do have Mr. Scott Howard here from the school district, Ms. Noriega Jacoby, who is here from United Way, and then, of course, Ms. Pam Neighbors, who you just heard from CareerSource. Any of them can respond to questions. To our Spanish-speaking media, if you have questions in Spanish, certainly Dr. Pino is fluent, and if need be, I'll have my assistant, Ms. Ilia Torres, come forward to interpret for me. Okay. With that, we'll open it up.
All right. Lauren Seabrook, Channel 9. Mayor, this question's for you. I've spent the day talking to a lot of local business owners, local restaurant owners. Is that me? Sorry. And the consensus is that after this announcement came on Friday, many of them feel like they're kind of caught in a political fight of some sort. They feel like what's coming from the state and what's coming from the local leaders are different, and they feel like a lot of it has to do with politics. They don't really understand who has... Sorry. Is it mine? Okay. They don't really understand who has authority. Does that make sense?
I got the question.
Some of them are posting signs up that say you're no longer required to wear a mask in and things like that. I think for the most part, everyone wants to do the right thing. They just don't understand. Do they follow you or do they follow the state?
Well, in this case, the order that we put in place regarding the mandatory wearing of facial coverings in Orange County is still relevant. It's still the case here. In many ways, however, the state has decided that it would absolve itself of the responsibility for the response to the virus and left in place the ability of local governments to be able to respond. I'm sure you've read the order at this point, but it places the responsibility back to those local governments that if they do something contrary to the governor's executive order, and that is where he opened things back up to 100% capacity, but said that you should still consider social distancing, it creates some confusion there. What I'm saying here is that what we should not be confused about is the fact that we still do not have a vaccination for the COVID-19 virus, and that it is still alive and well in our community, which means that we have the responsibility, whether you're a business owner or an individual, to protect ourselves and stop the spread of the virus. So what I simply said to the business owners was that you do the right thing. Remember that there are CDC guidelines, and what I suggested a few moments ago was that there's still liability, exposure, risk, etc., and depending upon that business's insurance policies, if I visit your business and it is determined that you were negligent, that you didn't take some action that could have protected me and the spread of the virus while I'm there patronizing your business, perhaps you have exposed yourself to some liability. And for that, if I were a business owner, I would make certain that I continue to do those things to keep my customers, my patrons safe. That's all I'm saying here. And I think one of the things that businesses can do is mandate the wearing of facial coverings. They could still make the decision to socially distance their patrons. So if does the government need to tell you to do that in a public health crisis? I don't think so. I think that if you are listening to your patrons, we know that when we did the consumer confidence surveys here in Orange County, we know what the residents said to us they wanted to see. They want to see these sanitary protocols in place in those businesses. They want to see that the employees and the patrons are wearing masks. If it were me, if I go into a business knowing that the virus is still alive and well in our community, and I see a crowded place and nobody's wearing masks, I'm going to turn around and walk out. I'm not going to patronize that business. That's what I was hearing from the different business owners and restaurant managers, et cetera, who approached me when I was in patronizing these businesses over the weekend. That's what I heard them say to me. We're going to continue to do this because I want to make certain, we want to make certain that our business is safe for people to come in. Does that make sense to you? Yes. Okay.
Steve Hudak from the Orlando Sentinel. This is for, let me start with Dr. Pino, but it's also for you. Dr. Pino, you were talking about super spreaders, and I think, help me out with this, are we talking about super spreaders infecting a lot of people, say, at a business or say maybe at a private gathering? Because one of the things I noticed over the weekend is that a lot of folks are just eager for things to get back to normal, and they want to be around family and friends, but that's a little dangerous, isn't it?
Yeah, those are super spread. I was referring to super spread events, and it is the event itself where you can connect place, space, and time the infection of multiple people. In this case, probably one of them is more than 20. And the other one, I don't know the whole scope yet because that's the newest. But the idea is that in enclosure spaces, the transmission of the virus increase. And if you are not observing any of the guidance that was given before with regard to washing your hand, wear your mask, and watch your distance, you are going to create conditions that will favor the transmission of the virus. And that can be deadly. As we know, we have 443 people in our county have died. And we know that at some point, we all are going to go down that road. But many of those people didn't have to die. Many of those people were healthy individuals at a young age. We have 26, 21, 49, 39, 32. We have people who were 27 years old. So this pandemic is serious, and it's serious enough that it has killed 443 people in our county. So if that is not significant for anyone, you know, our community has events that have marked our life and will mark our life forever, where 1/10 of the number of people have died, that they died from the pandemic. Imagine how this pandemic is going to mark our community and the nation moving forward, when we have, could be, a very high number of people who have passed away. Serious.
Megan Cruz from Channel 9. So after speaking with people in the community, it seems like there still is, some confusion as to phase 3. Is it your understanding that phase 3 applies to just restaurants and only bars that have food service permits, or are we talking about all restaurants, all bars, theme parks, all of the other businesses that were mentioned in the phase 3 plan that was unveiled earlier in the spring?
The governor has a very detailed plan, and within that phase 3 plan, it makes reference to all businesses, but certainly it specifically enumerates restaurants, bars, retail outlets, etc. And essentially what his order said was that they can return to 100% capacity, but with social distancing in place. So that may be incongruent to say full capacity, but have social distancing in place. So that's what creates confusions. I know that the governor's office has said to some of my staff that they plan to produce some frequently asked questions and responses. I haven't seen it at this point, so perhaps when that comes out, it will provide further clarity. What I said on Friday and I'm saying today, when there's not adequate communication between the governor and the subdivisions of the state, the local governments, this is what happens. This is the result. It creates confusion. When that 2.5-page document was silent on many issues, it was not clear. Because I did not issue the executive order. We have asked additional questions ourselves and have not gotten the full responses, just like the public. So what we're trying to do today is address that as best as we can with the understanding that we have.
Emily Braun with News 13. This question is for Mayor Demings. So how does the implementation of phase 3 here in Orange County affect the issuing of penalties for businesses for non-compliance? And does this take any authority or power away from the strike teams?
What we were doing with our strike teams, our compliance teams, were being proactive. We wanted businesses to reopen successfully and safely. That is still the goal for us. As businesses reopen, I believe that in many cases, if experts can visit your business and help share with you best practices, you should listen to that. Again, there's a potential for liability exposure there, and certainly once, if our strike teams or compliance teams go out and they tell you that what you're doing is inconsistent with best practices and you fail to make any adjustments, if it can be demonstrated that a particular outbreak occurred at your business, I think that you can potentially be liable for that. At this point, there's nothing at the federal level or at the state level that has removed the potential for a liability exposure. And so, in my opinion, the governor got out of the business of trying to impose sanctions or enforcement for whatever reason, and has said now local governments, you can, but you have to meet certain thresholds. That kind of punted the responsibility to those of us at the local level. We have to deal with our residents. All laws pretty much get implemented at the local level, and there are still some regulatory authority over many of the businesses that we have talked about that still have to meet all of those sanitary protocols. If you're a hair salon, barber salon, if you're a grocer, if you're a restaurant, they already have sanitary mandates in place that the health department can still regulate and still enforce at the state level. So there's no blanket waiver of all of the government oversight for various businesses to operate in a safe manner. So,
Chelsea Thorne with Wedge 2 News. This question's for Dr. Pino. Dr. Pino, when can we expect to see either an increase or decrease in cases that we can tie back to this move into phase 3? And then also, how do you feel about the president coming to Seminole County on Friday? You know, those rallies are known for people not wearing masks. Are you worried that that potentially could be an issue?
The last question is good for Seminole County Health Director. He or she could answer that question. With regard to when we can see an increase, so this pandemic goes into every 2 weeks, 3 weeks kind of cycle. It is a little bit too early. And I don't think that moving to phase 3 is the issue. I think the issue, as the mayor was saying, is how can we move to phase 3 and continue to protect the public. And because as we have said before, we have to learn to live with the virus. But also to support what the mayor was saying, the executive order from the governor doesn't take away all the responsibilities that the health department has in fighting this pandemic. And we are guided by state laws that are in place, and we will continue to execute those and continue to execute the governor's order as our boss and state employee, but also at the same time protect the public. And I think we can balance both. Our numbers are low, very low, and that will give us room to be able to implement these increase in social activity. And again, as I said before, we are pleasantly surprised. The schools are a good example. How can we return to some level of normalcy and at the same time protect the public? It requires a lot of work, and people will not see and can't see what goes beyond the scenes, working with the board to try to keep the school in a healthy environment, and constantly in a revolving door, sending people to quarantine, acquiring people from quarantine, sending people to isolation. It's a lot of work. And you guys are going to have the opportunity to see that in action soon, as we have everything has been established. But it is hard to say when we will see an increase. We have not seen it yet. I can tell you that much.
Buenas tardes, Félix Virela de Telemundo. Quisiera saber, hacerles una pregunta tanto al doctor Pino como al alcalde Jerry Demings. Ahora que pasamos a la fase 3 en la Florida, ¿cuál es la principal preocupación de ustedes que ahora todos los negocios puedan funcionar al 100% de su capacidad, considerando que estamos en un área turística donde están los principales parques temáticos del país?
La misma pregunta para el alcalde? Sí. Oh, okay. So the question was, and it's the same question for the mayor, was what are the concerns that we have with phase 3 and the opening of all the theme parks and all the activity in our county? La respuesta, bueno, la gran preocupación va a continuar a ser el hecho de que las personas no tengan la falsa impresión de que la pandemia ha pasado. No ha pasado. Estamos en una buena fase, pero si nos descuidamos, nos da duro de nuevo y nos va a dar duro de nuevo si nos descuidamos. Tenemos que estar muy presentes y vigilantes. Pero también las personas que viven, los abuelos, la tía, las personas que tienen avanzada edad y que tienen condiciones de salud preexistentes, son las personas que nos preocupan más.
My concern is that by going through phase 3 without clear communication, it may suggest that things have returned to pre-COVID-19 conditions, and they have not.
La mayor preocupación del alcalde es que la fase 3, sin una comunicación clara, sugiere que las cosas han regresado a los niveles o a el estatus que teníamos antes de COVID, y eso no es correcto.
My concern is that if we become too complacent, we're going to see a third wave or surge in new cases in our community.
La preocupación adicional del alcalde es que si bajamos la guardia pudiéramos ver o experimentar un tercer brote o aumento en nuestros casos.
And I say that because today we do not have a vaccination or a cure for the virus, and the virus is still in our community.
Él lo dice o expresa su preocupación porque a la fecha no tenemos una vacuna ni una cura para el virus, y el virus todavía se mantiene activo en nuestra comunidad.
And I don't want that for our community, I don't want it for my family, and I don't want it for me.
Él no quiere que eso suceda ni en su comunidad, ni en su familia, ni que suceda en su caso personal.
This next question was texted in from Ryan Lynch with the Orlando Business Journal. It's for you, Mayor Demings, or maybe Pam Neighbors would be able to chime in as well. He asks, how will the CARES funding for Career Source be used? If there's some specific examples that you can provide.
Sure. So the CARES Act funding is being used in 3 ways at Career Source Central Florida. It is being used for the career counselors, the additional career counselors, to reach out to 4,000 and enroll 4,000 Orange County residents into the CARES Act program to provide them resume consultations, job search referral, a lot of career counseling and identifying what is their career plan. Actually, they will be creating an individualized career plan with each of the enrollees. Secondly, the CARES Act funding is being used to support those training scholarships, either at our Valencia College partner, our Orange Technical College partners, Seminole State, also with small organizations that we worked with in the past, like New Horizons, for computer skills training. So a lot of different kinds of training, very customized to the individual's need and what would make them more competitive in the market. And then thirdly, the CARES Act dollars are being used to support the internships, the paid internships of 8 weeks that I spoke about at either nonprofit organizations or even for businesses who are struggling to bring back all of their staff. One of the things that we found is that many businesses have brought back some of their staff, particularly small businesses, but can't afford to bring back all of their staff. And so this could bridge a gap for the next 8 weeks to bring those individuals back on under the internship program to continue to be engaged in work, build their skills, and be more competitive in the market.
Okay, if there are no other questions, thank you all for attending today. We will brief you later this week. Have a safe, blessed day.
All right, you were just watching a COVID-19 update from Orange County, Florida. We know just last week, Florida Governor Ron DeSantis said all bars and restaurants could open there in the state at full 100% capacity, but cases are still rising. So there's an update for you in Orange County, Florida from earlier today. You're taking a live look at the executive residence, the White House there. President Trump in the residence, gearing up for tomorrow night. We're going to have live coverage of the first presidential debate in the presidential cycle. Our own Fox News Sunday's Chris Wallace will be hosting that debate, and it'll be the first matchup between Donald Trump and Joe Biden with just, I believe, 38 days to go before the election. So you're taking a live look there at the White House. It's about 10:30 on the East Coast at night.
I'm Daytona Everett here with Andrew Kraft. Again, like he said, we're going to be taking that debate in its entirety here on News Now from Fox, but we're also bringing in a couple of contributors as well. I know Andrew spoke with several people today ahead of that debate. So, Andrew, what are you most looking forward to?
Well, Daytona, I want to correct myself. There are 36 days till the election. I can't believe it's almost October, but I'm most looking forward to the interaction, the facial cues, the body language, the kind of personal interaction you're going to see between President Trump and Joe Biden. They've never appeared on stage before together. They don't know each other that well. They've obviously been in the same room together before. I'm thinking back in 2016, they were at the inauguration together, but this will be entertaining. This will be dramatic. It will be bombastic. I think it'll be no holds barred, but like you said, we'll have full coverage of that tomorrow night, and that's coming out of Cleveland, Ohio at Case Western Reserve. Remember, Daytona, it was originally supposed to be at Notre Dame University. A lot of these universities had to cancel their plans and scrap them due to the coronavirus pandemic to host debates, but this one will be in Cleveland, and we'll have that for you in its entirety tomorrow.
So, I mean, obviously there are going to be some changes because of the coronavirus. We've been talking about the coronavirus all day today, briefings from Florida, Kentucky, all the way up to the White House with testing and everything. So there's going to be a few changes with this debate. There's not going to be as many people in the audience. There's not going to be a handshake like there traditionally is with President Trump and Biden. So what other changes are we going to be seeing with COVID?
Well, yeah, I think we'll be seeing the podiums, obviously 6 feet apart. Like Americans saw the last debate. You remember, this was back in March, and Joe Biden was not the nominee yet. It was between him and Senator Bernie Sanders in D.C. And so that was the last time people have seen Joe Biden debate. And the last time they've seen President Trump debate was back in 2016. So they've been doing debate prep for the last number of days. In between the president's rallies that he's been hosting. So we are mere days away from the election, a few hours away from that first debate, and we're going to be going now to.
So we were talking about coronavirus. One of our sister stations actually sent us an interview about the coronavirus effect on women. So kind of an interesting topic here. We're going to play that for you right now on News Now from Fox.
Hey TVU Fox. My name is Gassia Mikaelian, coming to you through KTVU Fox 2 News in the San Francisco Bay Area. Here in California, millions of children have started the school year with distance learning only. And many moms say they're under more stress than ever before. So let's talk about that mom stress by bringing in a mom herself, also a doctor. Welcome to you, Dr. Renee Wellenstein, to talk about what we can do to help manage not just our stress, but everyone's.
Absolutely. Thank you for having me.
Of course.
You know,
you're going to say, you just told me today's the first day of school for you and your family.
Absolutely. So I experienced this firsthand, which is why I think I'm perfect person to talk about this, and I have twins at that. So I experienced it myself, and I think a lot of moms out there are going through what I have been through and I'm currently going through.
I think a lot of us had stress leading up to the start of the school year. My boys have been in for a couple of weeks. Now that we're in it, it's just a whole different kind of stress. So can you give us all, parents, moms and dads and caregivers, some strategies to cope with the stress that we're feeling and probably our children are feeling too?
Absolutely. You know, here's the problem. Or maybe not, you know, we moms, even the dads, we're used to this high-paced, stressful world, right? In the last 6 months, the ante has just been upped. You know, we not only We experienced this in March, April, May, where we not only were employees or maybe had to move our businesses home, but now we're also, the moms still, and we're the teachers and learning how to do this virtual schooling thing. So I think it's important for us to recognize that some symptoms that moms, dads, caregivers may be experiencing that are more so prevalent now in the last 6 months, and maybe they've had them this whole time, they've just never realized it. And some of it could just be some mood changes, maybe a little more on edge, a little more irritable. Maybe they're just not sleeping as well. That could look many different ways. In the morning, they just can't get out of bed. At night, they're a little wired, they can't go to sleep. Maybe that motivation they had to do things in the past is just not there anymore. And, the other key thing I'm finding is we're grabbing for the sugar and the junk food. And that is because we're so low energy and fatigued. And a lot of moms, we think it's normal to be so tired all day long and run on a pot of coffee throughout the whole day. And that potentially is not normal. So, I think what's key across the board, and especially for our kids included, because they're undergoing the stressor also, is we need to try to make sleep a priority. And, the problem again is stress will impact your sleep, but without getting really great quality sleep, we're not going to be able to be as resilient to that stress. Because again, I can't make everyone's stress go away, but I can give you some tools to empower you to make it a little easier to get through your day.
I think part of the problem is that even when I'm strict with myself when it comes to bedtime, I anchor an early morning news program. I say, look, 8:30, the devices go dark. By 9 o'clock, I should be in bed. Great. I'm in bed at 9 o'clock, but I'm stressing about my job, about my son's distance learning, about everything that's happening all around me, and even in this house that I didn't have to deal with 9 months ago. So even though you're in bed, you may not be asleep. Help us get there.
Yeah, this is another really great tip to find your OM. And my OM often is first thing in the morning and last thing at night. And what I mean by that, a lot of people think, oh, meditation. And for me, it is meditation, but whatever you find relaxing, so you can shut your brain off. And again, the entry point into your day and the exit from your day are the best times to do this. Now, some people's OM is taking a walk out in nature, or journaling, which can be done at nighttime, maybe journaling out all the stressors you have, put it on paper. So, or things you have to do, so you're not thinking like, I have to remember to do this and this. But I personally trying to just I put on my earphones and I just meditate for usually 45 minutes. I fall asleep, and it's amazing how I just stop thinking of everything else and I fall asleep.
How do you help your children? How old are your twins?
They're 13.
Oh gosh, so they are just in those prime, I want to be with my friends. I have 5th and 6th grade boys, and thank goodness they have each other, as your twins do, but that cannot substitute for that rich social experience that comes with the middle school life that you and I probably remember.
Absolutely.
I sort of don't have a solution for when my 6th grader says, I just miss my friends. Can you help us that way?
Well, it's funny you said that, because my son today said, well, during lunchtime, can I Zoom my friends? And it's kind of this double-edged sword, because my mom instinct was first to say, you've been on electronics enough. You're on all day, Zooming your classes. But then I held back, and I talked to my husband, who's standing right there. I said, what do you think? Because here's the thing. Typically at lunch, they would be socializing. So, we have allowed them a lot of Zoom time. A very small group of people throughout the summer, they were in contact with just maybe 2 other friends. And that was it, basically, to have a little bit of socialization, because it's been incredibly hard. And I'm also married to a physician, and we are also parents that, we didn't go through this. So we don't understand the social dynamics that they're going through. And we really had to give up some control in July and say, okay, you're not going to have the big parties. You're not going to be going to any big birthday parties, but maybe 1, 2, 3 girls, boys throughout the summer, and just keep to that one group, make sure we know they're not going anywhere, and just to stay safe, basically.
Right. It's just even, we used to do like porch parties where we would drive by one of their friends' houses, and, they'd stay more than 6 feet apart. But even just that hour of socialization really helped lift our spirits. We're at the point of the year now where my sons are asking about Halloween. They want to go trick-or-treating. I said, don't count on it. I also said, I don't think Christmas and Thanksgiving is going to look the same. The problem is that we don't know when this is going to end. And so they want answers. What about my birthday next year? Can we go skiing next winter? And I'm just left to say, I don't know. Can you help us sort of talk our way through the unknown with children who want concrete answers?
Yeah, and I think it's just a matter of being honest. We don't want to give them any expectations of saying, you know, next month, 2 months, 3 months, because that time's going to come, you're going to be counting down those days and it doesn't come, you know, and I think it's just being brutally honest. I think they, you know, for instance, here we were supposed to start school 2 days a week in school, 2 days at home, and they were so excited about going into school, even though it was going to be with masks on. And literally like 2 weeks ago, they're like, oh, that's not going to happen. And now it's October. And again, my kids are a little bit older. They still are asking the when, the why, you know, and I think they're understanding the why, but I'm actually already starting to introduce the idea that it may not be October, that start date in October either. It may not be till the new year, because I think if we start to put out a little bit further in advance, like it may not, our vacation in February that we take every year may not happen this year, which makes mommy cry.
Right, right.
But I think just the realistic expectations, because at the end of the day, I mean, again, they're all the uncertainties, the stressors. But I think if we set these expectations going to happen at a certain time and it doesn't, they're even further disappointed. So I think just being honest and say, I don't know, you know, we're just going to keep doing what we're doing. Lots of quality family time, and, you know, get with your friends as best you can and socialize. And then everything else is, we'll have to see.
Yeah, we have to deal with what we know. I don't know about your 13-year-olds, but I will say that my 12-year-old is in the prime eye-rolling years of his life. And so, you know, I really tried to focus ever since the pandemic began. Before, but certainly during the pandemic, we have so much to be thankful for. We have a little cozy house. We have a refrigerator full of food. We have clean clothes in the dresser. You know, we have mommy and daddy who stay home. Like you mentioned, all of us are together. There are so many people in my city, in my state, in this country that don't have, you know, 3 out of the 5 things I just listed. And so I've been trying to say to my children, I know you miss your friends, but aren't we lucky that we can have this nice family meal together? Aren't we lucky that daddy can take you on a big, long mountain bike ride in the middle of the day? So really, you know, sort of zooming in on those very small blessings has become one way for us to realize it's not as bad as it could be. And maybe we should be looking at the same set of things in a different way.
I absolutely agree. And we try to do the same exact thing. And to the point where I'm even waking up from my own mental health, and waking up every morning and immediately opening my eyes and thinking what I'm grateful for. Even if it's my husband taking the dog out so I don't have to. You know, those little things in life right now, like we just have to focus as much as we can on the positive and what we do have, and stop focusing on what we can't have, where we can't go, and what we can't do.
How important is it to have a network of friends?
Oh, very important. And, you know, kids, moms, dads alike. And I think going back to mom burnout, I think that is where the most impact, the kids, yes, but I think we moms also are just kind of like, okay, we're trying to do it all. And at the end of the day, we're just so tired. We don't even feel like going out and visiting with our 1 or 2 girlfriends, or going to their house, or even getting on a Zoom meetup. So it's incredibly important for our stress level, because just having that time that you're not thinking about real life and you're just having some girl time or kid time is very important at this time, especially right now.
Amen to everything you've been saying. For people who might be new to the idea of mom burnout, not living with it for 12 plus years as I have, and 13 plus as you have, where, Dr. Renee, would you like to point our viewers who want to hear more about what you have to say on the topic?
They can come right over to my website, drrenewellenstein.com. I actually have a little quiz that they can take to see if they have burnout, and a free little gift of a little ebook that I wrote on the topic, because I've experienced it multiple times. And, you know, I think as soon as you put it on your radar of what it is, you can catch it earlier on, and you can really take care of it sooner rather than later.
Got it. Well, Dr. Renee Wellenstein, it's been a joy talking with you. I hope good things for you and your children who are going through distance learning. You know, as I say to everyone, we're all in this together, and it's not going to last forever.
Exactly. Thank you for having me.
Of course.
I want to take you over now to a police press conference from earlier out of Mesa, Arizona. The Mesa Police Department is investigating an officer-involved shooting that left one man dead last week near Tempe, Arizona. Let's listen in.
Their brother and their son and their family member. Appreciate you coming. Thank you. Take your time.
My name is Ana Sandoval, ANASANDOVAL. My son was a good son, and he didn't deserve to die the way he did. Not one shot, but more than 8 shots were given to him, and they didn't find no weapon on him. He's not an animal. He wasn't an animal to be shot like that. There's 3 cams, body cams, that were used, and none of them show anything because their guns were blocked. Makes no sense. All 3 of them were covered. Where is the footage? Where can they show and prove that he was defending himself? His hands were surrendered. His hands were up. He's not alone. I'm his mom, and I love him, and I miss him. And this is hard for me. Please, if there's anybody that's seen anything, that recorded anything, please come forward. If God allowed you to see, it's for a reason. Please, help us to find justice for Angel. He was a good boy. He was a good, loving son. He reached out to me, Mom, how are you doing? How's your day going, Mom? I miss you, Mom. Mom, I need you, Mom. I love you, Mom. Just like everybody, we all struggle through something with something. He didn't deserve to die like this, not like this. 1 shot would have been enough. 1 shot would have been enough. But 8 shots? Come on. His hands were up. Si hay alguien que miró algo, por favor, reporten este crimen. Por favor, ayúdenos a saber qué pasó. Solo queremos justicia para mi hijo. Por favor, if there's anybody, please reach out. We need your help. Please. Thank you.
Hello, I'm Eugene Sandoval. What do you say in situations like this? This ain't easy. It's like I see my wife hurting, I see my family hurting, and there's so many unanswered questions that we're looking for. It's like I would think that they'd be more trained in this, but 8 shots, really? Like, this ain't easy to take. It's not easy to process. There's a lot of sadness, there's a lot of anger in all this. And
He was shot to his face. He was shot to his face. His face can't do nothing. I can't even see my son's face no more because they shot him in his face. What is his face gonna do? Come on. Come on, you guys. You guys are skilled. Police are skilled to do whatever their job is to protect and serve. This is not serving. This is murdering. You guys murdered my son.
We're asking, like, anybody, if anybody's seen anything, please come out, come forward. We need some answers. And he had his hands up. He had his hands up. So please come forward.
Next up, a family member, Margarita, will come up.
Hi, my name is Marguerite Garcia, and Angel was like a son to me. He was a good boy. He had big dreams. He wanted to go to college. He wanted to get married. He loved children. He was a good brother. And now he's not here because of the excessive force that the Mesa Police Department decided to go ahead and use on him. His siblings are broken like glass, and it kills me to see them hurting so bad. And I'm just asking for justice for Angel. Please help us, anybody, in Jesus' name. Amen. Thank you.
Thank you. Next up will be Angel's sister that's come speak.
Precious.
You're Precious.
I'm Precious Garcia, and I'm Angel's brother, and Angel was a good brother. And he didn't deserve to die the way that he did. And I just ask that if anyone saw anything or anything, they just come and say something or help.
That's good. Thank you. Thank you. Next up. Next up is Sky, another sister of Angel.
Hi, I'm Sky Garcia and the sister of Angel, and I know that he was a good brother. He took care of us, and he made sure that we were okay. I know he didn't deserve to die like this, and that he deserved like a life to live, because he wrote us a letter that's saying that he wanted to go to college and have a future. We didn't know this was gonna happen, and we just that we're all like broken down to know that the way he died wasn't the way we thought it would. We thought it would. We didn't know that it would be like this, and we just hope that if anybody knows anything to say something, because this is not fair. And it's hard to deal with this now, because we just pray that if anybody knows anything, that you help us to figure out why, like what happened and why this happened, because we didn't want this to happen. He still had a whole life ahead of him. He was too young, and I just hope that if anyone knows anything, to tell us, because he deserves to be like a story to be told, and that he has justice. Yeah.
So, I mean, this is hard. As attorneys, we do this as a job, but we get to meet the families who grieve. It's never easy. And they lost a family member for no reason. And can somebody please do an independent investigation in this? A true independent investigation. Not just buddies with another police agency. A true independent investigation that looks into the background of the officers, looks at body camera footage, and find out why did these officers shoot Angel multiple times. As you heard his mom, over 8 times.
I would like to say something.
You go ahead.
I just want to say, what if it was your son? What if it was your brother? What if it was your grandson that went through this? Wouldn't you want justice? A lot of people are scared of cops of the state because they're cops, right? They don't want to speak up. But please, what if this was your son? What if this was your family member? You guys would want justice. We know, as believers, that everything that's in the dark, God brings to the light. And we know that we serve a God of justice. So we just thank you guys. Thank you for coming out here, supporting us. But what we want is justice. So please, again, if there's anybody that's seen anything, please reach out. Please. Thank you.
Okay. Any questions? We'll take a few brief questions here. And the family's grieving, so we're not going to, take any questions from them, but anything about the legal process, we can answer there in general. Correct.
What do we know about what led up to this shooting? They say he was in a stolen vehicle. What do we know about where the car ended up and where it was unfolded? What are the events that we know?
I mean, right now we're still looking into all the evidence that's happened, but we do know from 2 separate witnesses that his hands were up and they shot him. So no matter what happened in the past, under the law, if your hands are up and you're surrendering and you're not a threat, these officers didn't fear for their lives like they're going to say that they feared for their lives, and that's why we pulled the trigger and killed him and murdered him. You're not a threat. There's no justification for this. This is murder, and they should be prosecuted. And why weren't they wearing body cameras? Why? I mean, this is 2020. Every officer should have some body cameras on them. And as a law firm, we're frustrated because we deal with Mesa a lot. We had cases recently, as you said, one of our clients, his hands were up, and they shot him. But thank God there was a cell phone video there to show it, what happened. Or else Mesa would have covered it up like they always do. And in this case, too, we don't want to cover up. We want justice. We want truth. This family deserves justice. They deserve the truth and no cover up. They always talk about transparency. Is transparency was convenient for them, but when they did the wrong, they try to hide behind themselves or they try to lie and cover it up. So let's do a true independent investigation, and they should have body cameras. The taxes can pay for body cameras, and this is hurting citizens. This hurts everybody because tax dollars are going out for these type of cases, but you need to get the bad officers off the street. Go through your department and get the bad officers off the street. And in this case, you can de-escalate the situation. And if a person is unarmed with their hands up, I don't think anybody here in America, in Phoenix, in Mesa, in Tempe would say that he should deserve to be shot.
Some people say that they Mesa opened fire because they said that he had his hands up, but then he suddenly pulled his back. What's your?
Let's see the body camera. I mean, let's see the evidence, and that's what we're waiting for.
That's their cover up. That's their cover up. That's the way they're gonna cover this up. Their guns were blocking. The detective mentioned all three cams were blocked by their guns. Why don't you guys specialize a body cam that's where a gun's not gonna block it? But all three body cams were blocked. Come on, you guys. Where is the footage? There's nothing. This is the cover up to cover themselves. But what about the justice? What about the family that's broken right now? What about, they're still going to get paid. They're still going to be hired on. They're not going to get arrested. They're not going to get punished. Please, there's somebody has to come up and help us out. We need help. God is our strength. God is our help. I truly believe that He's going to help us, but please, He uses other people to help out.
So that's why we're asking for any other witnesses. Please come forward. Please contact us. Give us a call. Taylor Gomez, please give us a call because we need witnesses who can help prove what happened. We understand there's two witnesses who already come out and spoke. There's two witnesses, two independent witnesses, but we need more witnesses to please come out.
Can I ask one really quick, something in Spanish?
Yeah.
Señora, platíquenos un poquito sobre lo que dijo en inglés, pero sobre su hijo. Si le puede explicar un poquito más cómo era su hijo, platíqueme un poquito sobre él.
Mi hijo era un niño bueno. Siempre me llamaba para preguntarme, mamá, ¿cómo estás? Estoy orando que estés teniendo un buen día. Mamá, te quiero. Te extraño. La noche que pasó todo esto, el día siguiente estábamos esperándolo para que viniera a comer y teníamos una reunión de familia y él dijo que iba a venir y nunca apareció. No nos informaron de la noticia hasta 2 días después. ¿Por qué? Fue pronunciado muerto en el hospital y nadie supo nada. ¿Por qué se esperaron tantos tiempos? ¿Por qué se esperaron tantos días para venir a avisar de mi niño? Él era un niño bueno.
¿Cómo se siente que las cámaras bloquearon la
No entiendo por qué 3 cámaras que supuestamente los oficiales tenían estaban cubiertos por sus pistolas. Pero por las tres cámaras, por favor.
Eso ya es de más. Y no hay ninguna cámara que nos enseñe que él bajó las manos. 2 testigos dicen que sus manos estaban, él se había designado, él ya tenía sus manos arriba. ¿Por qué le dispararon? ¿Por qué no le dispararon en la mano? Yo sé que estaba en un carro, yo entiendo eso, pero ¿por qué tantos balazos? ¿Por qué 8 balazos y no 1? ¿Por qué? Eran como 20 policías y 3 policías solamente tenían sus cámaras. Y esas cámaras no grabaron nada. ¿Por qué? Porque pistolas lo estaban cubriendo. El caso es que yo quiero justicia. Nuestra familia está quebrantada, está sufriendo y no sabemos ni... Hay veces que ni lo creo, la verdad. No he podido entender lo que está pasando todavía. Solo sé que no voy a volver a ver a mi hijo. Lo voy a volver a ver un día ahí arriba con el Señor. Eso sí, eso me da paz porque Él está descansando en las manos de Dios. Pero lo que no entiendo es, no hay justicia. No hay justicia, ¿por qué? Porque todos tienen miedo a la policía, todos tienen miedo al Estado y nadie quiere hacer nada. Pero ¿qué pasa con las familias que están doliendo? Por favor, si hay alguien que tiró algo, por favor reporten. Si hay alguien que quiere ayudar con este caso y quiere hacer una investigación privada, ayúdenos porque... Todo ahorita es pagado por la policía, todo van a querer cubrir. So, por favor.
All right, you were listening to a press conference from a very, very tragic story out of Mesa, Arizona, and that's the mother of 21-year-old Angel Benitez, who was shot and killed by police last week. And those are the lawyers representing her and her family, and they're obviously trying to seek justice for her son. You heard from Angel Benitez's 2 sisters as well, and we'll be following this out of Phoenix, Arizona. We wanted to switch gears though and go to our sister station, Fox 2 WJBK out of Detroit, Michigan. They are doing a lot of COVID-19 programming, and let's see what they had to say.
Teaming up for progress.
And this is really a great instance of thinking outside the box.
Doctors and medical researchers at Henry Ford Hospital and the University of Michigan find a way to safely and effectively decontaminate an N95 respirator mask tainted with COVID-19.
We met up with masks on. We had our own personal protection on.
Safety first, so now let the testing begin.
We took these several masks through this process, applied live virus to them as a simulation for what a mask would experience out in the field, and then put it in the device, sterilized it.
So what made this decontamination process effective? Ultraviolet C light, also known as UVC, a method typically used to treat rare skin diseases.
And UVC, when it hits DNA, it denatures it. So it damages it, it just doesn't go very deeply.
When the right dose of UVC is applied to a mask, it can destroy coronavirus in minutes, and the shape and integrity of the mask is still preserved.
We basically could not detect any live virus after the mask had been exposed.
Researchers say they're confident in their findings and how it can help medical workers.
I felt confident that I would personally wear one of these respirators again.
This was about our healthcare workers.
These researchers maintain that although highly effective, this sterilization process should only be used when there is a severe shortage of N95s. But many are looking to use this practice of decontamination in other areas.
They've got devices now that are in the upper part of the room, where when you have air that recirculates, UVC hits any contaminants, and then the air gets recirculated.
In Southfield, Ingrid Kelly, Fox 2 News.
There was no way that I was not going to try to give this therapy for some other patients.
Dr. Scott Cates of Henry Ford Hospital is giving back. It was only a few months ago he was on death's door after contracting COVID-19 while treating coronavirus patients at the height of the pandemic.
I had a potential goodbye phone call just before I was intubated with my kids and wife.
Dr. Cates spent several days in a coma. While he was on a ventilator, his colleagues went to work to save his life.
I was the first patient at Henry Ford, just I think out of complete happenstance and at the timing that I was sick and how sick I was to get convalescent plasma.
While scientists can't officially say that the plasma treatment saved his life, researchers are encouraged by the results.
On Easter Sunday, I was intubated, and it was like a light switch. When I woke up 5 days later on a Friday afternoon, I just went bam. I just completely woke up.
Now that Dr. Cates has made a full recovery, he is leading by example, encouraging other COVID-19 survivors to donate their plasma.
I think if you have an opportunity to donate the plasma, it's pretty easy. It just takes a little bit of time, and I think it's a great way to be able to give back.
On a beautiful summer day, Natisha and Chris Fudge, along with their 3 children, are getting in shape. It's been a whirlwind year for them, and in a few months, both parents will be undergoing surgery.
I didn't even tell him at first. I just started sending off the paperwork to be tested through 2 different sites.
You see, Chris needs a new kidney. Diagnosed with kidney disease in 2018, his health has been failing ever since. Just months before the COVID-19 pandemic began, he was put on a transplant list. We'll talk about COVID in a minute, but first, the need for a new kidney and the news that Natisha was the perfect match.
They got the results back on his birthday, which I started crying because I'm a crybaby.
When we figured out that she was going to be a match, everything just changed right there. Like, I was like amazed.
When we found out that our mom was a perfect match for our dad, we jumped up in excitement.
That was in late July. Just a few months earlier in May, Natisha was working at a nursing home.
Lo and behold, the middle of a 12-hour shift, my mask snapped while I was working a COVID unit. And next thing you know, within 24 hours, I had COVID.
Then Chris tested positive, and so did his mother. Chris was in the hospital for about a week.
Like, if I can think of everything that I've been through since I heard about the kidney stuff, that was the worst.
We watch the news. We see how many deaths have happened because of this whole thing. In the early months of it happening, we knew they were going to do their best to make it. But all of us still had the fear at the back of our mind thinking, what if they don't make it? What are we going to do?
Thankfully, they both made it, but that was just months after Chris almost died after collapsing at their Detroit home. Natisha had one thought.
And if there was anything that I can do to save his life, I was going to do it. And I know that if it was vice versa, anything that he could do to save my life, he would do it.
She's been my biggest support, my family. If I did not have them, I don't know if I made it this far.
A GoFundMe page has been set up to help the family with medical costs related to the transplant surgery. And while the family welcomes donations, they are more focused on making people aware of their own health issues. A poignant message, short and sweet.
Just be honest about your health. Be sure to tell anyone about it.
Camille Amiri, Fox 2 News.
I was 17 years old, enlisted, went into boot camp, Parris Island, South Carolina.
At 92 years old, Norbert Miller, a Marine veteran, fought battles, his latest COVID-19. This fight he won after 51 days in the hospital.
It was tough. It's a long 7.5 weeks.
Norbert's son, Wayne Miller, couldn't be by his side.
They wouldn't let anybody up to see you.
How hard was that? That had to be tough.
It is.
Before COVID-19, Norbert was on his own. This photo taken a week before getting admitted to Ascension Macomb, Oakland.
I drove, fixed supper, did everything that you had to do around the house.
30 pounds lighter and struggling to walk after the virus. It all started with a fall April 1st.
I shoved a stick all the way up my nose. That was it. I didn't go back home.
All along, he didn't have the typical symptoms.
They say he lost control from the waist down, and he's still battling that now. That was the biggest issue, though.
His nurses became friends and finally a send-off home with a salute.
Surprised, I was overwhelmed. I couldn't realize what was going on. Everybody, where did all these people come from?
7.5 weeks behind him, at least as much recovery time ahead. Norbert will continue with physical therapy at home. The goal is to get back to independent living. He even said he'd like to drive again. Jessica Dupnak, Fox 2 News.
When was the last time you were on TV?
A reunion 6 months in the making outside the St. Anne's Mead Assisted Living Facility in Southfield. For the first time since the COVID-19 pandemic began, loved ones got to sit outside and visit face-to-face on Tuesday.
It was hard not to be able to see them face to face. And I'm so happy I can.
It's never normal, but it's better than it was, and that's what we're thankful for.
You just don't connect as much, I think, just over the phone. I think it's going to improve her mind and her whole sense of being.
The reunions are also emotional for staff who say they've seen firsthand how much residents have missed their families.
There's a buzz throughout the building. The residents are excited. Family members are excited. We're excited. It's overwhelming.
St. Anne's Mead says they're taking a lot of precautions during these visits. They're by appointment only. Family members go through health screenings. Everyone has to stay 6 feet apart and, of course, wear a mask.
We carry out these restrictions. We're not trying to be the bad guys. We're just trying to keep people safe, and that it hurts us too to have to keep them apart and to have to put these restrictions in place, but we're doing it, to support them.
Now, while thinking back to the uncertainty when the coronavirus peaked, staff say these moments have been a long time coming.
When you're seeing the family members react to how scared they are and what was going on at the time, to now be able to finally have it come full circle and they get to be together, it's so exciting.
And this family's leaving their first visit incredibly grateful to have something you can't replace. That's the ability to say, I love you, face to face.
See you on Thursday. Love you.
Love you. Bye.
Bye.
In Southfield, Veronica Meadows, Fox 2 News.
All right, you're watching News Now from Fox. We're going to change things up a little bit. We have some news coming out of Texas. Lots of press conferences happening today. Williamson County Sheriff Robert Chody has been indicted on a tampering charge in connection to the case surrounding the death of Javier Ambler. Let's listen in right now.
Contrary, in fact, in a TV interview by Dan Abrams himself, the host of Live PD, laid out very clearly what he believed happened. He stated that the Williamson County Sheriff's Office requested that the show retain the video of the Ambler incident. He stated that the show had retained the video for a period of time, but that the show was never contacted by either the Williamson County District Attorney or the Travis County District Attorney for access to the video. From the beginning, the Ambler incident has been hampered by prosecutors failing to act and then attempting to pass off responsibility for their inactions of others. In fact, it was only after the body cam video of the Ambler incident was released to the public that the Travis County DA began to move on this case. The DA had taken no action for 19 months. 19 months. So to try to save herself during a runoff election, the DA blamed me, the sheriff, and my office for the delay. But as I stated before, our office participated fully in the investigation launched by the Austin Police Department. We exchanged our evidence with them quickly. There is email correspondence that supports my statements. At no point during this process did the DA reach out to our office for additional information. I ask you this, why didn't Travis County District Attorney Margaret Moore call me personally or reach out to me sometime during that 19-month period she felt she was having any trouble getting anything from our office? Not one phone call, not one email from the Travis County. The answer is obvious. The Travis County District Attorney dropped the ball on the investigation. And when the video surfaced during her campaign, she had to find someone to blame for her own mistakes. It did not work. And the voters turned her out of office. Contrast that with Williams County Sheriff's Department, When there is a death, it's a standard operating procedure to have internal affairs investigations of the officers involved. We performed our responsibility. We completed our internal affairs investigation. All that remains is for the Travis County DA to complete the criminal inquiry. You reporters in this area right now who have covered this issue, do you know what it could be that I've been charged with or dragged? Do you know what could have been that I've dragged my feet on? I ask you that question. Has anyone seen any evidence to link me to this indictment? Any communication that I didn't provide? Or did you just take the word of a DA facing a losing election that her 19th month delay was my fault with zero evidence? Because some of you did. So why are we here? Let me tell you why we're here. We're here because it's a month before the election, my election. Let's review some facts regarding Sean Dick and his performance as a prosecutor for Williamson County. The DA's chief prosecutor who's in charge of grand jury, this person who is responsible for interacting with the grand jury without attorneys present, my defense attorneys present, represented my opponent in a civil case not long ago. In fact, my opponent stated in a recent article that he speaks to the DA's office staff on a regular basis, all the time. Would a DA do anything that would hurt his credibility? I have emails from the DA obtained under the Texas Open Records Act that show him emailing you, some of you reporters, with information that the sheriff's office and certain employees, keep in mind that show him emailing reporters with information of the sheriff's office and certain employees in investigations. Keep in mind that these exchanges happened at the same time during an investigation that he was saying publicly that he was unable to speak because it would compromise the investigation. Yet he's speaking to some reporters behind the scenes. When a DA gives information to a reporter about a case and even gives the reporter phrases being utilized in the anti-police movements, there is a concern. In fact, this is not only an ethical dilemma for DA Sean Dick, but potentially it could be a criminal aspect as well. DA Sean Dick is pushing a misleading stories while pursuing false prosecution. There's another email from DA's office discussing another issue with an outside counsel that is sensitive in nature, yet the narrative tone of that conversation is negative towards the Williams County Sheriff's Office and the sheriff himself. The advice centers around how to get me, the sheriff, into a courtroom setting. Yet another attempt at criminal charges against me. I find it shocking and disgusting that our district attorney uses his office for political agenda. The very same people who are pushing this case against me are some of the same individuals who refuse to test a bandana in the Michael Morton Act or divulge critical evidence in the Michael Morton case. Unfortunately, Sean Dick continues the sad tradition that exists in Williamson County of indicting people for crimes they didn't commit. And he does this, by the way, while not pursuing many cases that we hand over in this office. I've even turned over excessive use of force cases to the DA and they languish. Instead, he plays politics and uses his office for political infighting. We can see where his priorities are. Dick wants to influence this election, my election. He wants to join the chorus of folks who are attempting to undermine law enforcement, strip them of funds, and make our neighborhoods unsafe. DA Sean Dick knows there is no possible conviction here. He is pursuing an indictment at the time solely for political reasons, and I look forward to prevailing in the election, being exonerated of these false charges and continuing to protect and serve the people of Williamson County. I am proud to be the sheriff of Williamson County. And just as Sean Dick said once in the Greg Kelly case, I consider this quote that he said, "It is an utter collapse of the criminal justice system."
What do you have to know about you and June about my case and damage to my car? You and the assistant sheriff, Robert Cody, why didn't you answer my emails?
That's
Do you have those emails? I do.
We have some information that we'll be passing out to reporters
Why
later
didn't
on.
you answer my emails or answer my
I'm
claims?
sorry?
Does that include these emails?
Yes, sir.
What about my case, Sheriff Cody? And your Can I ask you a question?
I may not be able to answer questions based on my attorney's advice. I want to answer every question, I just can't.
Okay, one of your deputies was indicted. Would you put him on administration leave depending on the outcome of this investigation?
I'm sorry, say it again?
Pardon me. If one of your deputies was indicted, you would put him on administrative leave pending the outcome of the investigation?
I'm not going to answer that question.
So why don't you answer my emails?
I'm not answering any of your questions right now.
The gentleman who spoke first, I didn't get your name, the attorney.
Jerry Morris. G with a G. It's with a G. Jerry.
You know you're guilty, that you don't answer my questions, Sheriff Cody? That your officers use such a force and injured me?
We're not going to talk about that at this point.
Sheriff, you say that this is all political. You're saying there's zero merit, zero substance, zero evidence.
Yes.
Of the charges brought before you that the DA Moore, DA Dick colluded in this conspiracy to have you charged today to affect the election.
That's basically what we're saying. Yeah.
Do you realize that some people in the public may find that hard to believe?
Yeah, I realize that, and that's why we have jury trials, because at jury trials, all the evidence comes out, not just that the prosecutor wants to present to the grand jury. And, we'll be continuing our investigation through the discovery process. We'll find out what the theory of prosecution is. You can't tell from the indictment. If you read the indictment, it makes it sound like Sheriff Tody picked up the phone and called somebody and told them to destroy the evidence, which is absolutely untrue.
Sheriff, this may be a better question for you. Within minutes of Javier Ambler's death, or within some time that night, overnight, in the wee hours of the morning, you were calling and had contact with Bill Gravel. What was the substance of this communication?
Let me answer that. My understanding was it was to notify the county judge that the death had taken place.
Wasn't Bill Gravel at my assault? So, I thought he was in church?
If you were calling Bill Gravel, who's got no role in the judicial system, as it involves a case like this with Ambler, why not pick up the phone and call the DA and notify him there had been a death in custody?
It wasn't a Williamson County death.
Well, it started there, and it involved deputies.
It did.
Put hands on Mr. Ambler. We're Williamson County. They pursued him. This was Williamson County. It happened in Travis. Why not pick up the phone and call the district attorney, who any reasonable person might say, man, he should know about this, and not a year later?
Some reason we didn't know.
Pardon?
Some reason we didn't know.
Can the sheriff answer that?
Well, I just answered it because it was a Travis County death. That's why he didn't notify the Williamson County DA of the death.
Did Travis County testify before the Williamson County grand jury?
He did not.
You've all seen the video
Mm-hmm.
about Sheriff Cody. Did you see anything wrong with your deputy did in that video? Did you see anything that was out of line from those deputies that day?
I'm not going to respond just because they have a case that is pending in Travis County. I don't want to hurt their cause or anything like that.
Sheriff, you said this is a statement. This is a political deal from Sean Dick. But it's the grand jury that handled it, not Sean Dick. They saw evidence they heard from more than a dozen deputies. What do you have to say?
Well, let me answer that. The DA controls the evidence that goes to the grand jury. The defense has no right to be in the grand jury or to cross-examine any witnesses. We have no idea what went on in the grand jury. The old adage is you can indict a ham sandwich. As the prosecutor once told me many years ago, he said, I've never lost an indictment. It is easy to get someone indicted. What has to intervene to stop it from happening is judgment, whether or not it's right to indict a person.
Even OJ was found innocent online.
Can you say that you handled Javier Ambler's death to the best of your ability and fairly and justly?
Well, that's...
Yeah, don't answer that.
So let me just say this, because I can't answer a lot of questions that I really want to. I think you need to remember too, though, when we talk about the DA, District Attorney Sean Dick, you're talking about someone who picks and chooses what crimes he wants to prosecute and what he doesn't. You're talking about a crime where he had a suspect that he took for family violence, assault with strangulation case that he declined to prosecute, and sometime later that same person shot 3 police officers in Central Texas. And then now we have this case so these are the issues that we have been dealing with at law enforcement. And I think you go around law enforcement around Central Texas dealing with Williams County, you'll see just how much we are alike in Travis County Justice, that Williams County is starting to mirror that because of our DA. And it's starting to be frustrating because now you're starting to see leadership being effective for political gain. And that's all I'm going to say at this point. So that's all I'll say.
When your cop assaulted me, why did your IA say your deputies were wrong when they assaulted me? Lieutenant Lothar said that.
Well,
why would they say that? Your own IA.
Well, what's next is what we call the discovery process, where we're going to be given the evidence that the prosecution thinks supports their case. There may be some litigation over what they have to give us because, as Mr. Dick said in his press conference, a lot of it occurred before the grand jury. So we may have to file motions to, in effect, get the judge to excuse secrecy to allow us to get the transcripts of the testimony.
If I remember correctly, and not word for word, but the gist of it, that Dan Abrams put out a statement saying they destroy that live PD footage after X period of time by terms of the contract. They held on to it for a little while longer and then destroyed it after you said your internal investigation was done.
Let me clarify that. I've talked to attorneys that represent live PD, and I asked them, tell me when Sheriff Robert Chody had any conversation with anyone about the live PD tapes having to do with the Ambler case. And the response was to the effect of that was a misstatement. Sheriff Chody did not have that conversation. We believe it was someone in Sheriff Chody's office. I've since requested the name of the person that they believe had that conversation, and they have refused to give it to me.
You're saying he has more rogue officers. He's not in charge of his own deputies?
Sheriff, a couple of questions here. The first one, do you have any plan to step down while this investigation is ongoing?
Absolutely not.
Second part is, and I think Frank tried to ask this earlier, but if you had a deputy charged with a felony,
I won't answer that.
well, I want to ask you.
Well, I'm not going to answer it there, Jody.
If you had a deputy charged with a felony, would you continue to have that deputy patrolling the streets of Williams County?
Well, it's the same thing, Jody. I mean, you're under investigation by the Rangers for assault, too. It's as bogus as that your charge is my charge, is what I would say. For the same assault that you've been charged with over there in Hayes County is the same presence I would take in this case. Well, the Rangers are investigating an assault case on you just like they were our deputies. I don't know about that.
So you're not applying the same standards you would to any other deputy?
Well, I think the circumstances are completely different, Jody, but I don't want to get baited into your conversation either. Okay. Well, you know, remember, grand jury is about probable cause. It's not about being convicted or anything at this point. There have been other elected officials who have been indicted as well and still serving. Give me that opportunity in a courtroom to show my innocence. Obviously, everyone knows I don't have to do this. I do this because I truly believe in what we're doing here at Williamson County and the deputies that are here. And we made a lot of good changes here at Williamson County. We've got a lot of negative publicity as well. Some at the fault of the very people in the audience right out here. Not all, but some. And there were some things going on in Williamson County that didn't get the transparency before that were just as bad, but the press didn't cover those items because the office or the sheriff before wasn't as transparent before. So I'd say let all the truth come out before you make a decision like that, and you'll see what comes out, and people will realize the truth will prevail.
Mr. Transparency, why don't you give all cases the same treatment?
Well, what I wanted to ask you is, it seemed plausible to you that Sean Dick didn't know anything about Javier Ambler until May of 2020? I know what he said. My question to you is, that sound plausible? Okay. Well, so if you're not going to answer my question, then he's not going to answer yours.
Okay, so answer mine. If this thing is possible.
Are we done?
Yeah, we're done.
All right,
Thank you.
you all.
I would like to say something as a private citizen of Williamson County.
You're watching News Now from Fox. That was a press conference coming out of Williamson County, Texas earlier today regarding the Javier Ambler case and police tampering out there. We're going to take you out to Peoria, Arizona, though, where we're tracking some breaking news. So these are live pictures that are coming from our sister station, Fox 10 in Arizona. Just a little bit of information right now. This is just breaking right now. So from Peoria PD, they said that they're currently working on an officer-involved shooting in the area of 87th Avenue and Monroe. No officers have been injured. The suspect is injured but alert and conscious and was transported to the hospital. You can see obviously very heavy police presence right there. Again, an officer-involved shooting in the area of 87th Avenue and Monroe. It looks like they're all kind of huddled up in that area. These aerials coming from Fox 10 in Phoenix. Peoria, Arizona, another officer-involved shooting. They have that intersection completely sectioned off. We have crews that are being sent there as we speak. So we're going to continue to follow this story here on News Now from Fox. So again, just repeating those details that we know as of right now. Peoria Police Department is currently working on an officer-involved shooting on the area of 87th Avenue and Monroe. Our shots are going in and out because we have a chopper flying overhead, so we're going to keep monitoring that. But for now, we're going to take you out to Houston, Texas, where the Say Their Name event was held. Let's tune in.
Good. Mic check, mic check. How y'all feeling out there, man? Now we're gonna try this again. I say, how y'all feeling out there? That still ain't good enough, man. But check this out, man. I want to tell each and every one of y'all, I appreciate y'all coming out. You know, I travel across the world doing a lot of things for a lot of people. And I have a habit of showing love when I recognize something that was great. So I seen a picture that's posted, and it was called a Say Their Name Memorial. It was in Dallas. And, you know, it wasn't really getting the recognition it needed, but I felt it was dope, you know. But with a lot of us not being in Dallas, I'm like, man, I know it's a lot of people across the world who would love to pay their respects and would love to see something like this. So I think Dallas had a time limit of 2 weeks. So I reached out to Emily and Joy. You know, they're part of Say Their Name Memorial. They actually created it. I'm about to bring one of them up now, but I reached out to them, and I'm like, man, you know what? I can see the direction y'all going with it, and I feel this is definitely something amazing, but I feel it's something that the world needs to see. So what I'm going to do is I love to step in, partner, and advance it to take it to a massive new level. And we were going to do it a little bit different. See, so now we're doing it in Houston, but we brought a lot of families together. A lot of the people that you're seeing on the podium, some on stage now, some out there in the crowd, their actual family members are here. Because, you know, one thing that's very important about the Say Their Names Memorial is people always ask, why do we continue to say their names? The thing is, you have to think, man, after the social media wave or the regular media wave go away in a week or 2 weeks, they still gonna be hurting, and they still need people to stand up and fight for them or show that they care. And I feel with what we're doing with things like this, we'll be able to spark a whole new wave of helping people understand why we say their names across the world. So everybody know I hate talking. That's not what I'm here to do. But I definitely wanted to appreciate everybody that came out because this is the launch of it. I feel this is something that's going to be historical for the city. And right now I'm about to kick it off and introduce quite a few important people, man. One thing I do want to point out is we definitely stand in solidarity with anybody who's a victim of injustice, man. And that's why I felt it was real powerful for us to have a podium, especially for some of our hometown people, George Floyd and Vanessa Guillen, you know? So this is gonna be an amazing day, man. I appreciate y'all coming out. I wanna bring up one of the founders with Joy. I wanna bring Emily up here so she can explain a little bit about it. And then from there, we're gonna bring in a few more guests. And after that, we're gonna open it up to the public so we all can be a part of this. Emily, you wanna come up here?
Hello. Thank you guys so much. I know I speak for myself and Joy, the founder of Say Their Names, that we are so grateful to be here in Houston. Thank you, Trey, for making that possible. Trey's an amazing man. He just reached out one day and said, let's do this, let's make this happen. So really grateful to be here. The memorial honors Black lives taken by systemic racism and racial injustice. It started as a grassroots initiative in Portland, Oregon, and has been put in more than 25 locations nationwide. Joy is standing next to me. She is the founder and leader and brilliant innovator to create something with this much meaning. She manages the only database of its kind with lives taken by racial injustice. The database is not complete, and we need your help. Please help us and submit names that are missing and stories that we do not yet know. You can do that on the website. Our goal in the next 6 months is to make this database searchable and complete with bios and other information. We are also hoping to do a nationwide tour of the memorial starting next year. If you have a name, if you're interested, if you want to submit a story, please reach out. We're here to listen, we're here to learn and grow together. Thank you.
Hello, everyone. I am Deronica Horn. I am here to represent the Say Their Names Memorial, which is found at saytheirnamesmemorial.com. Thank you, Trey, for bringing this to Houston. Thank you, Joy. Thank you, Emily, for being such a great help to bring this for Trey. Before we go on, I'd like to thank the City of Houston and everyone and all of their help for allowing us to do this with such short notice. Without further ado, I'd like to introduce our mayor, Mr. Sylvester Turner.
Thanks, Veronica and Joy, Emily. Let me just say it's good to see everyone out here today. And I want to start off by really acknowledging Trader Truth. This brother has just stepped up time and time and time again. He was the one who reached out, wanted to bring this memorial to the city of Houston, called, said, Mayor, want this to happen, and it has happened. And I can't say enough for Trader Truth, who's been from Lake Charles to Louisville, back here so many times. I know he's not asking for it, but please give it up to Trader Truth. Love this brother. Thank you, ma'am. To Emily and Joy, thank you all so very, very much. To all of the family members that are here, let me just say to you that our hearts and our prayers, our thoughts continue to go out to you. And it's just so important to be here for this local debut of the National Say Their Names Memorial Exhibit. And then we are right here in Emancipation Park, which I think is quite fitting, a park that came into existence in 1872 by Pastor Jack Yates and a few others. There's so much embedded in this park, and now to have this memorial Say Their Names Memorial exhibit right here in this park. It's very powerful in and of itself. It is a commemorative display paying tribute to Black Americans whose lives have been lost due to social and racial injustice. And today, I'm joined by Congresswoman Sheila Jackson Lee, of course, Ramon Manning, board chair of the Emancipation Park Conservancy, Emily Clark, Dallas exhibit organizers, Veronica Horn, the Houston exhibit organizers, State Representative Ron Reynolds. I see my council member that's right here, Edward Pollard, that's also present as well, and Representative from Commissioner Rodney Ellis, who's also here. As the mayor of Houston and a person of color, you know, there's so many strong emotions that are evoked by this display of over 200 photos of people. And I want to say they're not just photos, they represent persons, they represent families who are no longer, in a sense, physically with us. But let me tell you, you simply cannot take that walk without feeling their spirit. And in so many ways, they're very much alive. For the next 15 days, Emancipation Park will be a place of healing and reflection that will commemorate the lives of those who were taken away from us too soon. It will also serve to inspire all of us to do even more, to do everything that we can, such that that memorial, that number, other than those lives that have already been lost, that memorial won't continue to grow. It's featuring over 200 photos of Black men and women, victims whose lives were lost to racial injustice, police brutality, and racism. And this memorial opens our eyes and hearts to the realities and struggles people of color face every day and allow us to have a conversation about peaceful social reform. The exhibit was started in Portland, Oregon on Juneteenth, 2020 by the Say Their Names Memorial, a nationwide grassroots initiative. And the group shares photos and information with individuals and communities who want to create memorials. It has been displayed in over 25 locations nationwide. And thanks to Trader Truth, it is right here. And I want to underscore something that Trader Truth said, that in this memorial, you do have George Floyd and you do have Vanessa Guillen, which also represents that irrespective of color, when you are the victims of racial and social injustice, we are all connected. And so I want to thank him again. I also want to thank Ramon Manning, the board chairman of Emancipation Park Conservancy, for giving this exhibit a home. And there is no place more appropriate for this exhibit than Emancipation Park. The park is a Houston gem that serves as a monument to the pride and hope of the founding members of the Colored People Festival and Emancipation Park Association. And I also want to recognize Emily Clark and Veronica Horn for their hard work in organizing this effort. And we must continue to amplify the events surrounding any loss of life of a person due to social injustice. As you walk the memorial, something that resonated in my mind over and over again, and that is, unless we stand up, unless we do more, that memorial will continue to grow. But we cannot forget, we say their names because we do not want to forget the lives that have been lost because of racial and social injustice. And it's my prayer that in this city, we'll work every single day to get it right. Thank you.
My program says next that I'm going to introduce Trader Truth. Would you speak? Okay. I just want to make sure. Okay. And now I'm going to introduce the board chairman of the Emancipation Park Conservancy.
You're watching News Now from Fox. We're going to take you back out to that breaking news coming out of Peoria, Arizona. Let's take a look at what we know right now. So no officers are injured. A suspect is being transported to the hospital. We do know this was an officer-involved shooting. If you're familiar with the area, it's on 87th Avenue in Monroe. Again, no officers injured, suspect was injured but is alert and conscious and was transported to the hospital. Again, like we said, this is a live breaking news shot, so it's going in and out. There it is right there. So officers obviously huddled around. This is live news coming out of Peoria, Arizona. We're continuing to follow this on NewsNOW from Fox. Heavy police presence out there in Peoria, Arizona. It looks like things have calmed down a little bit. Of course, that suspect transferred to the hospital now, where we haven't really been confirmed any details about the suspect or the situation, what exactly transpired, but we do know it was an officer involved shooting. We're going to take you back out to that Say Their Names event that happened this morning in Houston, Texas. Thanks for watching us and hope you have a great night.
Good.
And there is no place more appropriate for this exhibit than Emancipation Park. The park is a Houston gem that serves as a monument to the pride and hope of the founding members of the Colored People Festival and Emancipation Park Association. And I also want to recognize Emily Clark and Veronica Horn for their hard work in organizing this effort. And we must continue to amplify the events surrounding any loss of life of a person due to social injustice. As you walk the memorial, something that resonated in my mind over and over again, and that is, unless we stand up, unless we do more, that memorial will continue to grow. But we cannot forget, we say their names because we do not want to forget the lives that have been lost because of racial and social injustice. And it's my prayer that in this city, we'll work every single day to get it right. Thank you.
My program says next that I'm going to introduce Trey the Truth. Would you speaking? Okay. I just want to make sure. Okay. And now I'm going to introduce the board chairman of the Emancipation Park Conservatory, which is Ramon Manning, who took my call at the last minute and answered when I asked, could we have a home here for this memorial. So I appreciate you, Ramon, publicly for taking our call and allowing us to have it here. Without further ado, Mr. Ramon Manning. Thank you.
Thank you, Deronica. As Deronica mentioned, just to give you guys some historical context, a couple Saturdays ago, I'm at home with my family, and Deronica and Trey called me on three-way. And as I began to listen and hear about this memorial, it became blatantly apparent to me that it had to be at Emancipation Park. And at this time, I just want to recognize Steve Wright, Houston Parks and Rec Director. I want to recognize the mayor. I want to recognize Susan Christian at the Mayor's Office of Special Events. I also want to recognize Steve Williams from the City of Houston's Health Department. You know, he was very involved to make this thing happen. And just to give you guys a little bit more context, this is the first event at any public park since the pandemic. So this tells you how important this is to this city and to this mayor. You know, as everyone knows, Emancipation Park was founded in 1872 by former slaves. We are on sacred ground. And I just thought it was fitting, with the help of my board, that we have a sacred memorial here. And, you know, everybody has been at home since this pandemic. Everyone has been reading more, you know, watching more TV, consuming more. And I just want to tell you, this has personally been weighing on me because everyone knows that these lives matter. But one thing people aren't talking about is the value of these lives. I had a relative tell me about your top peak earning years are in your 40s and in your 50s. Many of you who know me know that I'm a numbers guy. So I like to deal with numbers and I like to deal with facts. Those lives in that memorial, over 230 of them, the average age of those lives was 44 to 45 years old. So I want to talk to you a little bit about value for a second. Think about what we missed out on, what contribution those people could have made to this country, to their respective cities, to their respective communities. Think about that for a second. The average age was 44 years old. Your peak earning years are in your 40s and in your 50s. We could have had artists, engineers, lawyers. We don't know. We're at a crossroad in this country. We can either go right or we can go.
Dr. Mike Srigliano with Penn Medicine joining us out of Philadelphia. Good to see you, Dr. Mike.
Always a pleasure, Thomas.
You know, there seems to be this balance of two worlds, Doc. The world of 7 million infections and 205,000 deaths. The world of returning to pre-pandemic normalcy here, states opening up, no masks, no distancing. Where does the science put us right now with this virus?
Well, basically, Thomas, we're not out of it. Some are calling Europe and other parts of the world a second wave. In this country, I don't think we ever got out of the first wave. But numbers are going up. There's concern about the fall and colder months. And so we're in no way through this. In fact, it may get worse before it gets better.